like to welcome you to the September 9th, 2020 board meeting. In keeping with the board's commitment to open communication with the community, this meeting is being streamed live on the CCPS website at www.carrollk12.org and broadcast live on Channel 21. We are also recording this meeting so that it can be accessed on demand on our website and broadcast throughout the month on Channel 21. This will be a hybrid meeting in which some board members are present in the boardroom. However, some board members and staff will be participating virtually. Due to COVID-19 restrictions, the public will not be able to attend the meeting with the exception of those who wish to speak during citizen participation. Citizen participation is scheduled on the agenda for approximately 5 p.m. and 6:30 p.m. Speakers will be allowed in the meeting room individually for the allotted 3 minutes to address the board. Citizens who wish to speak must adhere to the social distancing guidelines and safety precautions we have previously publicized in communications about public comment for this meeting. Citizens must wear a mask while in the building and also when addressing the board. The Board of Education will also continue taking public comment related to tonight's agenda items through alternate means. Citizens not appearing in person for public comment can write to the board through email or U.S. mail. Comments received will be posted on the website. For board members and staff who are participating in the virtual meeting, I would remind us all to silence our cell phones and other devices around us that the microphones may pick up. Also, we should each silence our microphones when we are not speaking. Please stand for the Pledge of Allegiance, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Okay, board members, I need a motion for the approval of the agenda.
So moved.
Moved by Ms. Battaglia,
Second.
second by Mr. Kyler. Okay, board members, any revisions to the agenda? No? Okay, then I will call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Any opposed? That passes unanimously. Thank you. Okay, now we will move on to the approval of the minutes. Board members, I need a motion to approve the unapproved board meeting minutes for August 12th, 2020.
So moved.
Moved by Ms. Battaglia,
Second.
seconded by Mr. Kyler. Okay, board members, any comments or revisions?
On page 18, Mr. O'Neill, this says, he said, this was talking about student reps on the committee, and this says, Mr. Neal responded that some of the subject matter discussed is challenging and difficult, and students should not participate in those discussions. That's not the word you used. Was it that it dealt with students? I forget exactly what you said. Maybe we don't have him.
I'm sorry, Mr. Kyler, where on page 18?
1, 2, third paragraph, the second
Okay.
sentence.
Oh, okay.
I think we're having a little technical difficulty with sound. Bob, the team is saying they're not able to hear sound right now. I want to make sure, was that a question to Mr. O'Neill, Mr. Kyler? Yeah, I think that's why he didn't respond to you.
Oh, okay.
I think he can hear us.
There's some sound coming through now.
There we go. Okay, great. Mr. Kyler, do you mind repeating your question? Thank you.
John O'Neill, on page 18 of the first set of minutes, where the student representative talked to you about the Security Advisory Council meeting and why there weren't student reps. And this says you said it was challenging and difficult and students shouldn't participate, but I think you said confidential or I forget how you worded it, but not challenging and difficult.
That's correct, Mr. Kyler. At this point, I can't be sure what exactly I might have said in terms of word choice, but I would have said something like, it's been something that the Board of Ed has discussed in the past. The challenge is some of the subject matter is very sensitive and a confidential security nature, and so therefore we've always erred on not having a student member of the council. One of the charges that Mr. Williams brought in the June report and then last month were ways to try to engage the student body in a better way, in a more ongoing way. But we had always stopped short of having a student member on the council itself.
So if we just said, Mr. O'Neill responded that some of the subject matter discussed is confidential and students should not participate in those discussions, good enough?
It would be accurate in my mind, yes, sir.
Okay. So instead of challenging and difficult, it would say confidential.
Sure.
Okay.
Was that the only change so far? Because I didn't have any volume.
Yes, that was the only one so far.
Okay. Thank you.
And Dr. Dorsey, on page 14, the second paragraph says, Ms. Savigny will serve as the board representative on this council, and then it says Ms. Battaglia will serve as the alternate. That's Dr. Dorsey, right? Will serve as the alternate?
Yes, I had made that change on my copy. I'm sorry, I couldn't hear anything earlier, so I'm just
Okay.
joining you all. Yes, in that second paragraph under reports, I will serve as the alternate on the Carroll County Teacher Advisory Council.
Right. Okay. Dr. Dorsey, did you have any other changes to the minutes?
Okay, I had a couple of pages I've dog-eared. Let me just go down and see. Okay, on page 8, when we were looking at the synchronous learning, is it 2 hours a day or 2.5 hours per day for elementary?
It's 3.5,
Yeah. I was going to say both of those are wrong.
right,
Yeah, so it should be,
right. It's an average of 3.5 for elementary. Jason, what's the middle school synchronous average?
That's about the same. The only one that's going to be different is going to be high school, which is 3.75.
So elementary 3.5, middle 3.5, high school 3.75 for synchronous learning.
Yeah.
okay.
And on page 22, in the middle of the page, it discusses that same thing again. Are those minutes correct? This one does it minutes.
Yeah.
Right. I think there's a disjoint, though. We didn't discuss, like, so when we were taking these minutes, though, I don't think that we had been talking about synchronous learning of 3.5 for elementary, 3.5 for middle, and 375 for high, did we?
Well, back on 22, we said 50% and the equivalent minutes, but I wasn't sure if the minutes were correct.
Right, and so we have gone back and looked at all of our synchronous minutes with a fine-tooth comb again, worked with our schools and our teachers, have made some adjustments, particularly at pre-K, where the state had made some recommendations. So to your point, Mrs. Savigny, I don't know that 2 weeks ago those numbers were reflected in what we have gone back through and adjusted. So I'm trying to remember.
I think, Dr. Lockhart, I think it would be fair to say that 50% has been our plan. And at that time, even 2 weeks ago, it was 3.75 at those levels with an average of 3.5 hours a day.
Okay.
Target has always been 50%.
Right, so I think when we had and I think maybe we make those clarifications tonight under the COVID updates section, but I think when we were discussing this on the 12th, on August 12th, I think it was it 2.5, 4, and 5.5? Is that?
I don't.
No, it's all, the schedule that's been in the plan had always illustrated 50% of the day was synchronous. That was based on, I think, a board decision back on the 29th of July, where we made that determination of being the target. The plans at each instructional level at that time illustrated that. And then we started to have to actually report those numbers to the state, where we had to actually not only provide the synchronous hours, but the asynchronous hours. And to your point, President Savigny, this evening we'll be prepared to give you the actual final numbers for synchronous as well as asynchronous that are now illustrated in the plan as well.
Okay. And I think, so I think in terms of these minutes, it makes sense to strike those hours a day and just say that students would be involved in 50% synchronous learning. I think that would be more representative of exactly what we had discussed at that time.
That's correct.
Okay, so Ms. Lucido, do you have that?
Yes, I do.
Okay, great. And then, Mr. Kyler, to your point on page 22,
Do you want to do the same thing?
I think the board is in agreement on 50% synchronous instruction and cross out the other.
Yep.
Yep, right. So we'll just put a period after 50% synchronous instruction and delete the rest of the sentence. Okay. So board members, any other comments or revisions for the minutes?
Yes, I'm not sure whether you had looked at page 9, the third paragraph, the second sentence. We sent all our, it's just IP addresses to them, and they mapped out access in Carroll County.
Right, right. That takes on a very different meaning, doesn't it? Okay.
Yeah.
Board members, any
And
other?
other questioning also on page 10, when we were hearing about the ESOL getting some services, were there 3 staff members at each location, or were there 3 staff members who were taking care of both locations?
Said you're on page 10, Dr. Dorsey?
Yes, page 10. The paragraph beginning with Ms. Pam Mesta. Did we say that there were 3 staff members at each location, or were 3 staff members taking care of both locations?
I believe that was 3 staff members at each location, but I don't believe Ms. Mesta's on the phone or on the call
Okay.
this evening. Yeah.
Okay, all right, that's fine.
Dr. Dorsey, any others?
Okay, I'm still looking at my dog-eared pages. Yes, just on the last page, on that page 23, for the August 12th closed session summary for approved minutes, we discussed 2 items under personnel.
Okay. So it looks like 1, 2, 3, 4, 5, 6. Looks like 6 revisions. Ms. Lucido, do you have all of those?
5. Yes, I do.
Okay, great. Board members, anything else on this set of minutes?
Could you tell me who did the motions to approve? I missed it.
Oh, you didn't hear the audio. I believe, was it Ms. Battaglia made the motion and Mr. Kyler seconded?
Okay, thank you.
You're welcome. Okay, so board members, with that, then I will call for the vote on the minutes as amended for August 12th. All those in favor, can I get a verbal aye, please?
Aye.
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 Any opposed? Okay, that passes unanimously. Thank you. Okay, now we need a motion to approve the unapproved board meeting minutes for August 26th, 2020.
So moved.
Moved by Ms. Battaglia,
I'll second that.
okay, seconded by Dr. Dorsey. Thank you. Okay, board members, any comments on this set?
On page 5, the wording of the original motion is correct. October 1st was that date. But then on page 7, we added the wording that Dr. Dorsey wanted, teachers have the option, but we also changed the date to October 5th, not the 8th.
Correct.
Oh, okay.
So that's a change on page 7. It's
Yes.
not October 8th, it's October 5th.
Yes.
Right. Okay. I would like to address on page 4, where we were talking about Mr. Singer's recommendations. It says, Ms. Savigny made the motion that the parameters and lead indicators that will go into making the initial decision to go into the hybrid school model would be, and then it lists the 4 items. We actually only had one parameter, and it was the first one. And the other items, the other 3 bullet points were simply the lead indicators and data to review. I just want to make that distinction. And additionally, we had said that if the state did provide guidance at any time after that date, that we would need to reconcile
Correct.
to that guidance. I also believe on page 8, under the first action item, it says, moved by Ms. Battaglia and seconded by Mr. Kyler, the approval of revised and so forth. It says, as submitted. That was actually amended. We did not approve that piece as submitted. I'm not misremembering that, am I? So all 3 of the transportation services were revised versus what was originally
Yes.
proposed. Okay.
Yes.
So I think we can probably handle it by saying as amended at the end of that sentence instead of as submitted. I think it does capture the rest of the information properly.
Or were those amendments noted starting in the last paragraph, Mrs. Savigny?
Right, I think that motion that was made was actually made as part of the first item, right?
Which one are you looking at? I'm sorry.
So the very last paragraph on page 8, it says, after board discussion, a motion was made by Ms. Herbert and seconded by Ms. Battaglia with the amendment that the driver and assistant and goes on. Like, that was actually part of the first item discussion
Oh, okay,
and carried on to the second item.
okay.
So I think actually if we made that that change that says as amended at the end of that first sentence, but then just move the last paragraph that starts with after board discussion, move that up to immediately after that sentence.
Okay.
Are folks in agreement that
Nope.
that accurately reflects what was stated? Dr. Dorsey, you look like you're Like you were about to say something? Oh, I think you're on mute. Oh,
No, I was just trying to figure out, I can't see anyone, so I'm just trying to
Oh,
see if I
okay.
need to make an adjustment here. No, but I'm fine with what we've just revised. That's good.
okay. Okay, great. Okay, board members, any other revisions to the minutes? Okay, then with that, I will call for the vote on the minutes as amended for August 26th. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? It passes unanimously, thank you. Okay, and now we can move on to section 2, public participation. Ms. Herbert.
Okay. To have an orderly presentation of comments by the public, the following guidelines apply. Number 1, speakers will be allowed in the boardroom individually for the allotted 3 minutes to address the board. Citizens who wish to speak must adhere to the social distancing guidelines and safety precautions we have previously publicized in communications about public comments for this meeting. All citizens must wear a mask in the building and when addressing the board. Citizens will not appear in person for public comment, can write to the board through email or U.S. mail. Citizen participation is not intended to be a question and answer session. However, if citizens have specific questions, the superintendent will assign a staff member to make contact during the board meeting to arrange a time to respond to questions. Number 3, the superintendent board reserve the right to correct misinformation presented as factual after the conclusion of the citizen participation period. Number 4, statements to the board should relate to a recent agenda item and an agenda item that is expected to appear in the future, or a matter of general policy over which the board has authority. Personnel matters, pending appeals, the action or statements of individual staff, or items related to employee negotiations are not appropriate topics and may not be discussed. Number 5, it is the intent of the board to allow all citizens an opportunity to speak. Therefore, the board has scheduled time on the agenda for citizens' participation at 5 and 6:30 p.m. The board reserves the right to limit the number of speakers on a particular topic so that all topics may be addressed. If 30 minutes has passed and there are citizens who have not addressed the board, additional time may be allotted later in the meeting. Number 6, comments are limited to 3 minutes or less. When the allotted time expires, the speaker is permitted to complete a sentence and return to the audience. The public may not display signs or posters during the board meeting. In lieu of signs, or if you are unable to complete your comments in the allotted time, individuals are encouraged to submit remarks to the board in writing. Our first person tonight is Shelley Jacobs. Shelley Jacobs. Whoops, that's not Shelley Jacobs. Oh, Shelby Jacobs, I'm sorry. I had a little, it was kind of, well, sorry.
Hello, Board of Education Committee. I'm speaking today I am a employee for Carroll County Public Schools. I'm speaking today to request that the board allow high-risk teachers to teach virtually from home during hybrid learning with a written request from a doctor. To date, the only option the board has presented for high-risk teachers is to take leave for 12 weeks with reduced pay under the Families First Coronavirus Response Act. There are several flaws with this current plan. Human Resources informed me that you have to be employed by Carroll County Public Schools as of March 2nd, 2020, in order for this to be an option. So anyone employed after that date, including any new teachers who were hired this year, are not applicable for it. For those who are applicable, there are teachers who cannot afford a pay reduction because they are providing solely for themselves. Also, as of now, it does not look like we will have a vaccine by the end of November when the leave would expire. Therefore, the at-risk teachers will still have to work in dangerous conditions when the leave is over. That is why I'm asking you to allow at-risk teachers to work virtually from home during hybrid learning with the presence of a doctor's note stating that they are at high risk of hospitalization or death if they contract the coronavirus. This is a very personal request because I am a high-risk teacher who was just hired this year, so the Families First Coronavirus Response Act does not apply to me. When I was 4 years old, I was diagnosed with stage 2 leukemia, which is a type of blood cancer where white blood cells are overproduced and register the extra white blood cells as a disease, causing them to fight each other. This greatly weakens the immune system of patients who survive and means that when I get sick, I get sicker than an average healthy adult. For example, last school year, I was put in the ICU twice and was in the hospital for 2 weeks after being diagnosed with a different viral disease, mononucleosis, which normally is not severe. Contracting COVID-19 would put me in the hospital if not be fatal. That is why my request to the board is to allow at-risk teachers to work virtually from home, as they are doing now during hybrid learning, with the presence of a doctor's note stating they are at high risk of hospitalization or death if they contract the coronavirus. Thank you for your time.
Thank you.
Thank you for coming tonight.
And next, we have Shelley Brzezicki.
Good evening, Board of Ed members, Superintendent Lockard, and Commissioner Frazier. I know you have read and received hundreds of letters in regards to the reopening plans for schools. My letter does not address that. Although I'm a mother of a CCPS third grade student and a CCPS employee, my main concern is the divide we are causing between our educational partners. A divide I believe will last much longer than the pandemic itself. A divide that will make it difficult to continue building one of the best public school systems in the state. In the past 2 months, I have read and listened to hateful comments about educators, elected officials, and partners in education. All of them are working through the unprecedented pandemic and trying to make the safest and best decisions for all stakeholders. These stakeholders are working to make the best of the difficult hand we have been dealt. The young ears among us can hear, see, and feel the tension that has become so evident in our communities. It is our job as adults to do better and to build communities of hope rather than despair. It is our responsibility to show young people how to handle adversity with grace and not anger, rage, or hostility. We need to consider the implication of our words, the impact they have, and the accountability they hold. This brings me to the purpose of my letter to you. There was a social media comment posted in which a community member stated, "Singer and the Recreation and Parks are going full Nazi on our children and parents." A comment that was made in response to a Board of Education member's post about current COVID statistics. The post comparing the actions of Mr. Singer and Recreation and Parks to that of a Nazi was liked by Mr. Kyler. A like is used to show support, agreement, or enjoyment in someone's post. I am requesting that we call on Mr. Kyler to apologize to the people of Carroll County, and more specifically the Jewish community. I also hope that the members of the Board of Education take diversity and equity training. It is inexcusable for any elected official to like a comment referencing the actions of the health department, rec and parks, or any persons as a Nazi. The term is historical in nature and refers to the party led by Hitler, responsible for the killing of 6 million Jewish people and the inhumane treatment of many more. My grandmother and grandfather, both survivors of the Holocaust, lost most of their families to the cruelty of the Nazis. This term is not only offensive to the Jewish people, but to humanity as a whole. Mr. Kyler suggested that although it was a poor choice of words, the comment was taken out of context. There's only one context in which the term Nazi can be taken. I hope that the members of the Board of Education consider Mr. Kyler's actions. We are all accountable for our words and our approval or likes as such. As adults and educators, we teach our students about the accountability of what they post and like on social media and the impact it can have on their futures. In part of this year's CCPS pre-service staff training, a policy stating school staff may face consequences when they say or do something that intentionally or unintentionally causes offense to a student, family, or community group was discussed in length. This policy should also hold true for our elected officials. As a member of the community and an employee, I ask that we expect better, that we demand better, and
please finish your thought.
Sure.
Thank you.
That we just take time to educate people on the various cultures of our community.
If you would like to leave the rest of it, or Ms. Gaddis will take it. Thank you. And now we have Teresa or Diane.
Okay, so
Good evening and Happy New Year, new school year, Superintendent Lockhart, members of the Board of Education, and Commissioner Frazier. I'm Teresa Basler-McCullough, President of the Carroll County Education Association, who represents the dedicated, hardworking teachers, counselors, RNs, speech language pathologists, OTs, and PTs who were all a part of a like no other start of the 2021 school year, entering a new dimension of teaching and learning. And I have to say, I was so excited to hear that most of our educators had a great and smooth first day back, for the exception of some technology hiccups, but that's going to happen. I was more thrilled to read comments from the community praising yesterday's virtual learning, comparing it to March or to the spring. Many parents noted that Tuesday's virtual learning was much better than the spring. And I guess it worked because it was supposed to be enhanced, and that was just good to know. I will have to give a shout out to our educators. And part of that enhancement of our distance learning this time is credited to them. Many of our educators went out and made sure they had other equipment, and they did this on their own. I get that. Some of them bought another monitor. They made an appealing environment for virtual learning, took numerous professional development opportunities just so they could prepare for a successful virtual enhanced learning. So I just wanted to do that. But like lots of current situations being unique, this evening's report has a new twist. I used to engage my students in a math activity called What is Number?, which is a number representation skill. It seems we've relied on numbers heavily in the past 6 months, but I can assure you that I'm staying away from COVID numbers, positivity rate, and ICU beds. I'll let Mr. Singer deal with that later. Tonight, I celebrate accomplishments with number. 9, we had 9 CCEA members served as delegates to the NEA convention, of course, virtually. 8 members attended the remote MSCA Summer Leadership Conference, obtaining union and leadership skills to continue to make CCEA stronger. 120. There were 120 cars riding around the block on July 29th to Circle Central for a safe start. 2, we had 2 members, Kier Vinson and Nicole Carbajal, facilitated a book talk on So You Want to Talk About Race. 26 educators participated in that book talk, which prompted some more worthwhile and needed courageous conversations. 3, November 3rd's Election Day. Hope everybody goes out and practices their right to vote. 21,000. Those are the amount of hours that our Carroll County Public School employees partook in the summer virtual learning professional development, which keep in mind that 8 hours were required. And lastly, 2020. Now that number has got to go. Moving forward in this together, and thank you.
Thank you, Ms. McCullough.
Sure.
I'm glad I read the rules to keep this on because I was going to take it off. So I'm glad I double checked before I came in, guys. Good evening, Dr. Lockhart, board members, and Commissioner Frazier. My name is Diane Deal, and I'm the president of CASE, representing Secretary Clerical, LPNs, and Instructional Assistants. Standing before you is one proud CASE president. I am so very lucky to work alongside some of the hardest working people in Carroll County Public Schools. Ms. Savigny got to witness that. I would like to share some of the many duties and tasks we have completed to ensure a successful opening of our virtual education experience. Last week, ESP worked to prepare materials for students. At the high school levels, countless bags with textbooks and other materials were put together for students. I understand Man Valley's still handing out tonight. Westminster High School did 1,600 bags. Materials were also being readied at the middle schools, with a picture of it making the front page news from East Middle. At the elementary level, toolkits with whiteboards, info on social media, headphones, and other items were put together for students. Robert Moten did 400 toolkits. Some of our clerical helped prepare and distribute computers to students' families, some even delivering them to homes that did not have a way to pick them up. ESP even worked evenings, like this evening, along with other staff to make sure families were able to pick up the materials at a convenient time. Then this week, we switched gears to join in the virtual classrooms to work with the students we love. This school year has started off like no other. But as always, our ESP stepped up and met the challenge for the students of Carroll County Public Schools. Case would like to thank all ESP staff, food service, custodial. I hope I haven't missed anybody. I've already thanked my bargaining unit. Teachers, students, parents, administrators, for their dedication and professionalism for meeting the challenges of virtual learning. Again, this school year is like no other, but if we follow a few simple rules, it can be one of the best ever. I truly believe that. First rule, be kind, no exception. Respect is a two-way street. Positivity rules. Put forth effort, see results. There is no I in team. And always move forward. And yes, Case does make a difference. Thank you.
Thank you, Ms. Deal.
Thank you.
Okay, Ms. Herbert, there are no more speakers.
Nope, that's it for
right now.
tonight.
Okay.
So far.
So once we approach the 6:30 hour, we'll go out and check and
Yes.
see if
Ms. Gaddis will
anyone
check
else
for
is
us.
here.
Do you mind if I comment on Shelley's?
Please do.
And again, very well spoken. And I understand her point. I did apologize in a message. I never found the comment. It was deleted, and some of that group told me it was deleted. And if it's offensive, I'm glad it was. But I look at the word like soup Nazi and whatever, and I shouldn't. If it does offend people, I'm sorry it was on there. But I didn't make the post. I didn't make the sentence. But still, it was on my page.
Okay. Thank you for that correction, Mr. Kyler. Okay, so board members, with that, we will move on to Section 3 for the COVID-19 updates. And first up, we have the Health Department updates, and I believe we have Ed Singer on the line.
We forgot one thing.
Oh, did we forget something?
Yes. Board member activities and Dr. Lockhart's report. Am I right or wrong?
That's section number 4.
Okay, all right, okay. I'm looking, I had mine, but I don't know where it got to.
Okay. Yeah, we're doing the COVID-19 updates
Right.
first because we have Ed for
Got it.
a limited amount of time, and then we'll move on to board member and superintendent correspondence after that.
There he is.
So, yeah, joining us tonight is Ed Singer from the County Health Department. Thank you again, Ed, for joining us, as well as Garrett Hoover, who's the president and COO of Carroll Hospital. Garrett, thank you for taking time to join us as well. I know the board, first part of this, we want to ask questions around metrics, and some things have happened since the last time we spoke. So we want to talk about that as it relates to the governor's announcement in terms of metrics last week. And then the second part of the updates will be just a little bit about the beginning of school and any additional clarifications that we want to provide. So to respect your time, Mr. Singer, I know you've got some slides for the board. We can get into those and then open it up for a conversation with you and Mr. Hoover.
So I'm not sure. I think your staff had preloaded them, or do you want me to share mine from my computer here?
They are preloaded.
Okay. You can go ahead to the second slide. and I can't see them here, so I have to assume you're where I think you are. The second slide is something that we developed kind of based on some of the metrics that the health department had suggested to you all as a Board of Education, along with the metrics that the State Department of Education and the governor's office put out within the last couple of weeks. The first, it's just kind of a red, yellow, and green thing that I've developed that kind of gives you a snapshot of where things are. We're going to get into talking in more details about most of these things in the rest of the slide, but I'll just point out here a couple of things that aren't specifically in my slide. Is the second thing down is the total number of cases per 100,000 population, which is one of the metrics that the governor put out, and they were generally hoping to see that at less than or equal to 5. Last week we were at 3.1. This week we're at 7.5. The other thing is the positivity rate in the state's creeping up, and there's a big difference between the Hopkins positivity rate and the way that the state's calculating it. And I know the Board of Ed said they wanted to kind of keep an eye on both of those. I sent you all an article that was in the Sun today that kind of does a really good job of describing the difference between what Hopkins is calculating and what the state of Maryland's calculating. So both of those have reasons to take a look at them. I still think the most important thing, though, that we should be taking a look at is this overall number per 100,000 population, because that's kind of showing us how the disease is spreading in our community. So if we can move on to the next slide, that's our overall case numbers.
Mr. Singer, on that,
the case numbers
Hey, Ed,
this week.
Ed, can you hold on a second? Okay.
Sure.
Go ahead, Kenny.
hey, on the first slide, like you say, the 89 to 7.5 shows how it's spreading through the community. Did you see any indications on why it spiked like that? Did you see certain age groups or college kids, or did you see anything that caused that?
Well, I've got slides on all these metrics except for the ones that have to do with the two that the governor and the state put out there, which is the positivity rate in the cases per 100,000. But I mean, we'll get to. We do have an age breakdown. It's one of the slides, and we could talk about that when we get there, if that's okay.
Sure.
Okay. Moving on to the next slide is just the overall number of cases, and we've, we were getting real close to where I was kind of getting comfortable with where the cases were heading, and the curve seemed to be heading in the right direction. And I don't know whether it's just that people aren't being as vigilant about keeping distance and things as they were, but we went from, previous 2 weeks we had 37 cases in Carroll County. To this past week we had 89, and that's the third highest week we've had since the pandemic started, and the up much higher, higher than anything we've had since mid-July. So next slide is just the 14-day rolling average. We can move to that real quick. And really not much to say here other than it just shows that trend that we were talking about. We can go to the next slide. It's the deaths by week. We didn't have any deaths in the last week, which is a good thing. We and if you look at it, since early June, we've seen the number of deaths that we've seen from COVID have really been pretty low here in Carroll County, and that's one piece of good news. And then we've talked about the ICU utilization in the hospital, and Garrett can talk more about all the types of things we want to be looking at hospital metrics wise as things have moved along. But over the last couple of weeks, at the very beginning of the 2-week period, we were up at 11, but over the last 2 weeks since then, we haven't been higher than 7 in the ICU at Carroll Hospital Center. So that's all really good news. One of the piece that Mr. Kyler was asking about was the age groups that we're seeing these cases in it. If you look at the week of August the 30th, you can see there's an extremely high number, 44 cases that we had were in that age group of 18 to 29. And so that's kind of continued a trend that we've seen since July, that young adults are tending to be the places that we're seeing a lot of these cases. They're wanting to be social, they're wanting to get out and gather with their friends and things of that nature, and we're seeing a lot of cases in that population. We did see 5 cases this past week in the age group of under 18, which that's one of the highest numbers we've had in that age group since the pandemic started. I think we did have 1 or 2 weeks where we had higher numbers in that age group. I'm actually looking here at, I think it's only maybe one week where we've had more than 5 cases in a week in that under 18 age range. So that's kind of what the age demographics look like as far as the cases are concerned. We're continuing to see a high number of cases the first couple of days of this week. Now, I don't know what to tell you other than I'm hoping that people will start, keeping in mind that we're still in this pandemic, and if we want to keep things open and we want to get schools open and we want to be able to get kids back in the classroom, that it's a team effort, and it's got everything to do from what we do in our social life to even our recreational sports activities. We opened some things back up and whatnot with recreation and parks in the last week or two. And it's just important that, people who are attending these things and whatnot, take the precautions, make sure they're not going if they're sick, wash their hands, and make sure that if you're a parent and you're spectating on the sidelines, keep that social distancing between yourself and other groups so that we're not spreading the virus around the community. I'll leave it at that. I guess it's up to you all, but would you like Garrett to go ahead and speak next, and then either of us can take questions from you, or do you want to ask me questions now and then move on to Garrett?
Why don't we give Mr. Hoover a chance to speak real quickly, and then we can address both of you with questions that we have? Did we lose Mr. Hoover?
I'm not hearing anybody.
Mr. Hoover, do you happen to be on mute?
Would you like me to go ahead? Yes, I was waiting for the cue there. Thank you. I appreciate the opportunity to get acquainted with you under these circumstances, and it's been an interesting 5.5 months getting situated here at Carroll Hospital and within Carroll County. And first of all, I want to thank you for connecting with you, and also for the opportunity to collaborate with other leaders across the county, like Ed Singer, who's been an exceptional partner during this pandemic and during my transition from New York to the state. So in addition to the data that Ed shared with you, we look at positivity rate as well, but we also look at raw data every day, multiple times throughout the day, such as new hospitalizations, new deaths, critical care census, vents that are in use, positive rates, PUIs, you name it. We're looking at the data real time throughout the day. So just to give you a perspective on how we're doing now versus a 7-day moving average, or even we'll do a 30-day rolling average on some of these data points. But new hospitalizations. Across LifeBridge over the last 3 days, new hospitalizations have been less than 5. That's good news. At Carroll, we've had 1 in the past week. New deaths, the last one at Carroll was on August 21st. Across LifeBridge, we had 1 on September 7th and 1 on September 1st. So that's a perspective on the impact that deaths have had relative to COVID. In terms of positives, the number of positives have been averaging in the low 40s since August 31st, and that's across the system. At Carroll Hospital, we have five positives right now that are in-house. In terms of persons under investigation, again, similar number across LifeBridge, we had 50 a week ago. At Carroll, we're averaging 2 to 3 per day. Today, we had 7 PUIs, persons under investigation. And then, as Ed mentioned, we take a look at our critical care census. That's one of the key triggers, because when the pandemic was at its height, our critical care capacity was stretched beyond our normal 12-bed census. We have a 12-bed unit, and then we have an intermediate care unit of another 22 beds. We were overflowing into IMC. We had some real staffing challenges during the height of the pandemic, and I'll say that was mid-April through first, second week of May. Since that period of time, as Ed mentioned on one of his slides, we had 2 dates in August that we had a census of 11, 2 dates of a census of 10, but the 30-day rolling average is 6. So about 50% of our CCU utilization. And that's pretty much what we budget and staff for regularly. So that's good news. I'm very pleased that we've been able to flatten that curve and keep that critical care census at 6 or below. And I'm happy to report that as of today, we have no COVID positive patients in our critical care unit today. So we've made progress, we've flattened that curve, but I want to echo the same message that Ed has shared time and time again with you, and that is the time for vigilance is not up. COVID is still here. It's among us. It's going to be here for the next year or until a vaccine hits the market. So due diligence by everybody, social distancing, personal hygiene, the frequency of masks in public places, all of those need to remain in place. And I foresee that for the foreseeable future. So that's the message that I'd like to share. And I want to thank everybody. I think the county has done a pretty good job up to this point, but I am fearful that we could see a resurgence if we become complacent under those three key variables. I'll pause there for any questions.
Mr. Hoover, I want to say thank you for being here tonight, and that's great information that you're able to provide, and I think all of us on the board agree with you that the vigilance needs to stay high. We definitely need to do our due diligence. We want to open schools as quickly as we can, but it has to be safe in order to do so. And I think that all of these numbers are trending in the right direction, and your points about one of the key things that we've wanted to track with COVID all along has been flattening the curve from a healthcare perspective. And I think what this shows is that, we've done a very good job in Carroll in managing that. We do have some additional potential capacity around the rest of the state, right? We have a lot of neighboring hospitals that could come into play if we did see a surge, like an unexpected surge. But I still think that it makes sense for us to keep an eye on the local hospitalizations just to make sure that we're not stressing ourselves locally, right, as kind of a leading indicator of where things are headed. So, with Ed's guidance, and I know that he had been talking with you at length, about, okay, what are the parameters that we wanted to put in place in terms of reopening schools? And I know that you guys had a lot of conversations, so I want to thank you for all of your input that we received through Ed, and I'm glad that we actually got a chance to talk with you directly tonight. So again, thank you for being here.
My pleasure.
And
those calls with Ed and the county health department, they're continuing. We for a period of time, we were having them almost daily, and now we feel comfortable that once, maybe twice a week is sufficient, but I want to assure you that we are in constant dialogue each week.
Okay, thank you. And board members, did you have any questions for Mr. Hoover or also Ed? Kenny, I know you wanted to circle back to the 89 cases, and it looks like on the one slide that's being driven by the 18 to 29 group. So you were trying to dive into, was that potentially being driven by students that had gone to universities and maybe come back, or just trying to understand that grouping a little better?
How's this week look?
Well, and I had mentioned, Mr. Kyler, that that this week has not been looking better. And I would have expected maybe this week we would have seen a little bump just because with the holiday weekend that people probably would have been out and about and doing more things. And we're only a couple days into this now, but each day's been, I think we've seen more than 12 or 15 cases each day so far this week. So it's not looking like this week's going to be trending any more positive than last week. And I can't tell you exactly what's causing it. I don't think it's because we're seeing a large number of students returning from colleges. I think most of the cases that we're seeing in talking to our contact tracers are happening and we're just here locally. So we are seeing local transmission, and that's an important thing to know. We are seeing a few people returning from college here and there that are cases that we're having to manage. What we've been trying to do is differentiate between cases that are required here. If they're required elsewhere, we're trying to have them counted there. And for instance, if we have a case at McDaniel College, rather than count, because these students have been here long enough now that they're living in our community, we're trying to count those cases as cases here in our community because they're living here, and we're trying not to count the ones that have been acquired elsewhere and they're living in college communities and other places. So I don't know if that helps any with your question about. I think it's just generally that this age group is very much more active socially, and they're wanting to get back out, and it's been very frustrating for them since March, and it's it's as we've gone on with this thing for as many months as we have, it's been very hard to continue to keep people vigilant about this and keeping them taking it seriously. So I think that's all part of it.
Okay. So, Mr. Kyler, did that answer?
Yeah. No, thanks a bunch. And yeah, it just it makes you wonder that essentially 18 to 29 is half the cases.
Right.
So are any of these test results like late test results that you were waiting for them to come back? Because I know there was a backup for a while. So are any of those potentially later ones, or are these all like they've been within the past 2 days they came in?
So since we switched laboratories back in August, we've been getting often when I leave here on a Thursday, I'm seeing the test results come in from the same day that we were testing. So we're getting test results back in 24 to 48 hours in general, and we're not seeing a lag in results at this point in time. These are cases that are coming up now. We're actually able to contact, when we were having the problem with the labs, when we were doing contact tracing, it was really almost too late to put people in isolation or quarantine. And what we're seeing now is we're generally catching these within a couple of days of people getting sick.
When did you change the laboratory that you were sending the results
I think
to?
it was the first week. I'd have to look, but I think it was the first week in August.
And I had another question too. I thought when the governor spoke the other day, he actually referred, and I believe was quoted as saying that we're considered no longer in an actual pandemic, that we had flattened the curve, but at this point, it's just to monitor and do what we can to not get back into that situation again.
I don't recall the governor saying that we're not in a pandemic, but I've not seen anything else anywhere else that indicates that we're not in a pandemic. I don't know, Garrett, if you've heard anything on that, but I've not.
I haven't, but my opinion is we're still in a pandemic.
And Mr. Singer and Mr. Hoover, I did want to get your input on. I thought it was kind of ironic. You know, we had been looking for state guidance, right, on what would be some numbers in order to be able to open schools under a hybrid model. And since we hadn't received that guidance, we worked very closely with you and trying to set our own parameters, which we did last month. And then right after we finalized those, and we said that if the state did come out with guidance, that we would want to reconcile to that guidance. And then the very next day, after we finalized our parameters, the state did come out with guidance, and it is a little bit different than what we had come up with. I think that we're actually more conservative in the parameters that we set, and I think that that was appropriate given the lack of state guidance, right? That we used we basically said we wanted to keep an eye on positivity rate, but it wasn't a key driver. But we settled on the number of cases per 100,000, and we're at 3, which translated to 35 cases per week, new cases per week, which is what we were tracking. But when the state came out with the guidance the next day, they had a category of 5 deaths per 100,000 and 15. And so it was looking like, under a hybrid model, they were saying you could do that with less than 15 cases per 100,000. Board members, I'm not sure where everybody is. I'm not comfortable with that level. I would assume, Ed, that you're not as well. But there is a 5 category as well, where they said you could go to expanded in-person learning. I'm not sure we understand what that means versus hybrid.
I think, I looked at the guidance that came out from MSDE and MDH, and I think when we're talking about the less than 15, what their intention was is that essentially you guys would be doing what you're doing now. I think what they're looking for when you're back in a hybrid model is really, and I mean, you certainly could reach out to the state school superintendent and MSDE and ask them what the intent is. But the way that I read that document, they kind of have the flow chart there, and it looks like that if you're less than or equal to 5 cases per 100,000, that you can go back fully hybrid. I think what they're saying, if you're less than or equal to 15 and less than 5% positivity, that the guidance is that you could start doing some of the things like you're doing now, bringing back your English as a secondary language type students and your special education students and your career and tech in smaller groups. That's the way that I'm interpreting what's in that document. So, I mean, I think you all need to read it and figure out how you interpret it. And, the recommendations, I don't think the 5 per 100,000 is really that much different than the 3 per 100,000 that I gave you, because we were specifically looking at community cases, and the state's guidance is based on all of the cases, whether they're facility cases or whether they're community cases. And sometimes we get a lot more community cases, and sometimes we get a lot more facility cases. The facility cases have been way down the last few weeks, and the community cases have been up. But I think they're very similar numbers, honestly, if you look at the fact that the state's including the facility cases in their 5 per 100,000 population, and we're not including the facility cases in the 3 per 100,000 that I gave you. And I think you need to take a look at all of this as a package. And if we were looking at going back to school tomorrow, I'd be really concerned about the number of cases we're seeing and how many kids we'd be putting in quarantine or isolation if we potentially went back. If those 5 cases that are your students, and we've got 5 cases in a week that we're dealing with in different schools, and they wind up having close contacts with other people, we could be looking at, generally what I've seen in other places is, if you have, most of the time we're talking about putting an additional 5 people in quarantine for each person that 5 to 8 people in quarantine for each person that we've got that's sick. So you could wind up with, as many as 40 people in quarantine. So you'd be talking 40, 45 people that wouldn't be able to come to school for a period of time for that week. And then you get into the next week and the trend continues, that's another group of people on top of that. So I'm concerned about the case rates that we're seeing right now in Carroll County, both from the standpoint, well, just basically the number of folks per 100,000 that have got the disease. If we get down close to those numbers at this point, and we're around where the state numbers are, sure, then I think it's the right time to move forward with the plan. I really want to see kids back in school, because I really do think that it's important. with the case rates they are today, and what we're looking at this week, maybe we're not in a good spot. But we've still got a month before we reach that date that you've kind of put out there on the calendar. And I like the fact that you've told the teachers to be prepared, and we're just going to have to see where these numbers go. And I've said that time and time again every time we've had a meeting. And it doesn't make me very happy to have to come to you this week and say we've been moving in the right direction for the last month, and then all of a sudden we hit a spike the last week, and it looks like we're still going to have that issue this week. But if we're all, as things are starting to settle down and the summer's ending, maybe we'll have less large gatherings, and maybe people will get more back in their normal routine, and hopefully we can get the case numbers to go down again. But we are where we are at this point, and I'll share the numbers with you and tell you what I think. But I think that right now we're not in the greatest of spots, but who knows where we're going to be 2 weeks from now.
Right, and we do have another meeting that we're looking to schedule for September 23rd, right, which is 2 weeks from tonight. So Ed, when do these numbers get posted typically? So I know out on the website, this week of 89 wasn't up there as of at least this morning. Do you typically post those on a particular day of the week?
If you guys, generally we're posting those in the weekly data. Well, we're posting data daily, so I can give you our number of cases every day if you want me to send you our community cases and our facility cases. I can give you that on a daily basis. We could just I could shoot an email to the school system, and they can get it out to the entire board if you want daily numbers. But I'm pretty sure that we're posting those on our website each day as to how many cases, because I know we're updating that every day because I've got an information person, Maggie Kuntz, who every day she consults with our epidemiologist and updates the numbers on a daily basis.
Okay. Maybe I wasn't looking in the right place. I know I went out to the weekly totals, and the 37 was the last one that was posted, and that was from the week ending 8/29.
So the weekly updates are posted on Tuesdays.
On Tuesdays, okay.
But every day we post the number of new cases.
Okay.
So you can get that number daily. I can email it to you guys if you'd like. It's not that big a deal just to put a group together and send you an email every day. Say this is how many new cases we have. If that's something you're interested in seeing.
I don't know that we need to make Ed send us a daily email. I think if that information is available out on the website, that's fine. Yeah. I probably just wasn't looking at the right place this morning because I was looking at the weekly totals. But if there's a daily spot for that, I think we can go out to the website and check those.
And we're generally not updating the website on Saturdays and Sundays or holidays. But we do update it every other day.
Okay. So yeah, I just wanted to make sure that we would have, so if we're meeting 2 weeks from today, that we would have 2 weeks more of these weekly totals to be able to look at that point.
We'll definitely have the 2 weeks more of the weekly totals. And I can also, I'll get you the Sunday, Monday, and Tuesday figures. Now sometimes they change because they may change by 1 or 2 because we come across a result or 2 that was reported on a Monday, and for some reason it didn't get counted on Monday. So if I give you a number of 22 on Monday, it might wind up being 23 by the time we get around to Friday. If we classify them all on the date that they're reported out to us.
Okay.
And I just got a note from one of my folks that Maggie Kuntz is going to send you. There's a guide to the webpage to kind of tell you what information's on there and where to find it.
That would be very helpful.
Thank you very much.
And can I just add, there was an earlier slide, because I had printed my packet out a little bit earlier, but there was another sheet that had the table of pediatric cases and hospitalizations and deaths for Carroll County, Maryland, and the United States.
Yeah, I had shared that last week because Mr. Kyler had asked for it. I didn't think that was something that was really important in our decision making, so I didn't include it. I mean, we know that the pediatric deaths and the pediatric hospitalizations are low compared to other age groups. But the main thing that we're looking at is how much this is going to spread in the community and how much impact it's going to have on your school operations. I can get you that information again when we meet in a couple of weeks if you'd like to have that as a slide. That I did share that last week, but I really don't think, honestly, I don't think that data is impactful in you're making a decision as to whether or not to go back to school, because we know those numbers are low. We know the number of kids that are going to get this is the number of kids that are going to land in the hospital is going to be low, and we know that the number of deaths in this age group are going to be relatively low compared to the rest of the population. But you know, that doesn't mean that we're not going to have to isolate and quarantine kids that potentially get COVID-19. So I think your biggest decision point is whether or not it's going to impact your school operations to the point that, you know, you'd wind up having to shut down classrooms or schools because you have too many cases. And I don't know if you've been paying attention to what's been going on with the college, and I guess I'll brag on us here in Carroll County a little bit, because I've been really pleased that McDaniel's been able to manage their cases and stay open and still have in-person learning at McDaniel. And then you look at, just as an example, what happened with Gettysburg. I don't want to say they didn't do a good job with contact tracing, but they wound up with a lot more cases than what we have here, and it became more than they can manage. And I really think that, you know, even if we get to the place where we're comfortable with where our numbers are and we're opening up, it's going to be really important that we're collaborating closely to contact trace and make sure that we're not having sick kids come to school, and that we're not anybody who's been exposed is not allowed to come to school, so that we don't get other people sick. And I think that's going to be the important effort that we have to make once we get back to in-person learning. And even with the number of students we have there now, it's also important that we don't want people there that are sick. I mean, that's something that we need to emphasize. And anybody that's been exposed shouldn't be coming to school, because, you know, that way we wind up with more than we can manage, and it winds up having to close things back up. So that's all going to be an important part as we get back to the in-person learning.
And I guess what I was thinking, when I saw 90 cases, frankly, I thought that was high. And again, it does cover our population, the 0 to 17 years of age. So I, for one, would like to see this information.
Okay, I can certainly, I'll make sure that next time we'll share that chart again.
Okay. Thanks.
So, board members, what are our thoughts in terms of, so Ed, thanks for your comments. I guess when we voted on the parameters at the last meeting 2 weeks ago, we had said that if the state did provide guidance, that we would reconcile to that. I guess pretty much what Mr. Singer is saying is he thinks that they're relatively similar, because the state numbers are intended to include the facility cases as well as community cases, whereas ours is just community. But I think we need to specifically say whether we want to keep the parameters that we've decided on, or if we want to change those to be what we think is more consistent with the state's parameters, or what are folks' thoughts on that?
I think I like the 5. And I know, Mr. Singer, you said before the positivity rate isn't a great factor all by itself, but if it stays down and it's still not above 3, the 3 and the 5, because I get what you're saying is regardless of how you feel about kids getting it or kids getting it badly and all that, it's still what's a disruption to the schools when we're trying to teach the kids. And I don't know, Mr. Singer, are you comfortable? The 5 would be like you had in early August, 54 maybe, that kind of a level.
That would translate to 60, right, Ed?
It's close to that, yeah.
So if you had 5 times 1.7 for our population times 7, so 59 and a half, so 60,
Yeah.
60 cases.
When I look at back, early August was 6154, and then there's 2 weeks of 37.
You know, I just, if I could just chime in here, I don't think there's anything wrong with, I kind of like the dashboard that we put together for you. And you guys can look at all of that. And I think that ultimately, I don't know that there's going to, I don't know that, and I tried to say this the last time when you asked me to give you metrics. I think you need to look at these benchmarks and we know, kind of take a look at where the trends are going. I don't think you should have a hard number in making your decision. I think you need to take a look at all these things in a group and deliberate amongst yourselves and get my input and make a decision as to whether or not you think you can safely operate schools and that they're going to be able to continue to operate and not have to reclose if we've got too many cases or we're concerned about something. And right now, you know, if we were making this decision last week, when I was giving you the data, I probably would have said, well, yeah, you're probably, you know, we're right on the cusp of things, and it'd probably be okay to open up, not knowing that we were going to get the numbers that we got this week. I just think there's nothing wrong with looking at all those numbers, kind of giving them some consideration, and ultimately you're going to have to make a decision as to whether or not you think the time's right for going back and bringing kids back in the hybrid model and getting everybody back into the classroom. And you know, I really sympathize with you having to make this decision because I really think that you know, I'm more for getting the kids back in school than not, and I'm willing to think that you ought to push the margins on that. And you know what? If you make the wrong decision and we wind up having to do what Southwest did, well, that happens. I mean, you know, I'm sure everybody's aware of the Southwest School District. They opened up and then they had to close for a week. We don't want to see that happen. We're trying to avoid it, and we'll have to do everything we can to avoid it. But that's not the absolute worst thing that can happen. I mean, we really need to keep in mind what your mission is and how that fits in with what we're doing in public health. And I think looking at all these metrics and kind of considering them, and you know, it's always really nice if somebody can tell you if it's X number, then we should go ahead and do it. There is no X number for this. I think there's a whole bunch of different factors to consider, and then ultimately, you know, you guys have a lot invested in what you're doing as a Board of Education. You've got a hard decision to make, and I wish I could give you a magical number and say this is the right time and this is going to be perfect, and we know we're not going to have any problems. There's a possibility, regardless of what our numbers are showing and where things are trending, that if you open back up, that we could still have issues, and we're going to have to make the best of it, and you're going to have to make the best decision you can based on the data you have, and we'll have to see what happens when that decision's made.
So you're pretty comfortable with this dashboard. So if we said, let's throw out the 3 we talked about now that the state's done this, and what you're saying, if I hear you right, tell me how thick-headed I am. We need to evaluate it based on this dashboard on a weekly basis and make a decision accordingly. You're comfortable with that?
That's what I would suggest. And you know, again, setting a magic X number that this is going to trigger us to open or not open. If we're at 36 on the number that I gave you, where I said I want to be at 35, and we're well under what the state's number is in their metric, where they're looking at 5 per 100,000, you know, maybe it's not that big a deal. The hospitalizations right now are in a really good spot. The number of deaths are in a really good spot. If we stay there with those, and we're just back and forth where one of these things might be a little bit above a metric we set, then you know, then you have to think about it. And you know, it's like I said, it's not a magic number. Even the number the state gave us is not a magic number. There's, you know, this is all everybody's best estimate based on a disease that we have very limited knowledge of because it's been around for less than a year.
Mr. Singer, I have a question. Now, I know COVID is something completely different than the flu, but last year, what was the average number of people that got the flu a week?
I don't have that data in front of me right now, and one of the things we keep talking about as health officers is the need to make sure that when we're testing somebody we're trying to figure out if we can make it work so that if we're testing somebody for COVID, we're also testing them for flu. But it's a very different type of disease, and the impact that it's having on people in the community and whatnot is significantly different.
Oh, no,
it's not to say that the flu is not deadly, and there is a vaccine out there for that, and I've been encouraging everybody to get vaccinated because the fewer cases of flu we have confused with COVID, the better off we are. I didn't bring that data with me. I certainly could get flu data if you'd like to see flu data, but
no, I was just wondering.
Or just let me know, and I'll gather it and bring it the next time, or I could send it to you by email.
No, I was just wondering because I know that's flu season is coming, so just so that way we kind of also get a grasp on that too. Like, what was the average number of flus that we had last year? For every week or whatever.
There's also a really, I'm sorry, I didn't mean to cut you off, but there's also a really important differentiation between COVID and the flu, in that most of the time when you're not symptomatic, after you've gotten over your flu symptoms, you're not capable of making somebody else sick. And we're seeing a lot of people who are pre-symptomatic or asymptomatic carrying COVID that are making other people sick, and they don't even know they're sick. So there is a big distinction there. Usually with the flu, it's pretty easy for us to manage, and it's just a simple matter of if you've got flu symptoms, you don't go to school, and once you're over your symptoms, then you can go back to school. And generally, it's not been hard to manage that way. But with COVID, we've got issues where we've got asymptomatic people and pre-symptomatic people who aren't showing any signs of being sick that show up and can make other people sick. So it is a different type of disease to manage. I mean, they are very similar in symptoms and things of that nature, and we do have deaths from the flu, and we do have deaths from COVID. But I guess the important thing is often with COVID, people are presenting without any symptoms.
Okay. All right. Thank you.
All right. Do you mind? Okay. So for everybody so everyone knows what we're all talking about is we made one metric that new cases of COVID-19 that fall below 35 new cases for 2 weeks in a row. Our data is then hospital ICU utilization numbers, number of deaths in the community, and positivity rate as calculated. So leave your data, but then we really need to decide whether you want to change your metric.
Mm-hmm.
That's what I think. Do we leave it 3, 5?
But I think what Mr. Singer's
just leave
saying
everything
is
alone.
use this dashboard he gave us,
Right.
where he has the 5 and the 5 and the way he has it here, and he still has the 35 up there, but then he has the 5, and then our decision, I guess, is if everything's green and there's one yellow box, we need to make a decision.
So that's what we voted on.
Right.
So that's what I just want to make everybody aware of what we voted on.
Ed,
So
Ed, can I ask a clarifying question to you in the chart?
that's why I pulled that
I'm
out.
sorry if you already stated this. In the second column, which is total cases per day per 100,000 population, that's the weekly average, and you have that is the governor's metric, the 5. Does that include nursing homes and convalescent living in that figure?
Yes.
Okay.
Oh, wait a minute. You're saying the 89, I might have misunderstood your question, Steve.
On the second column,
Yep.
which has the 7.5 in the red, I was just
Right.
checking with Mr. Singer, is that solely community cases, or my question was, does that include nursing home, convalescent living? And he said, yes, that's included in that figure, because that's what the governor's metric includes, correct, Ed?
Yes, exactly.
Oh, but the 89, so the 7.5 is just based off of the 89, and the 89 is only community cases, not facility cases.
The funny thing is, this week we've not had any facility cases at all. But the governor's metric, as superintendent has pointed out, includes the facility cases. So it wouldn't just be based off. If we'd have had 10 facility cases this week, in that metric that the governor and MSDE put out there, we would be including those facility cases in that number.
Right, so the top line, the community cases, 35, that does not include nursing homes and convalescent living, but the second line does from the governor. I got it.
So it's interesting, if we wind up having, and we haven't had any significant outbreaks in the last few weeks, but if we had wound up, just to make it clear to you all, in that number that the state put out there, the less than 5 or less than 15, however you want to look at that, the cases per 100,000. If we had an outbreak and had 60 cases in a nursing home, those would all count in that number towards that. We've been excluding those from the number that I suggested was important for us to be looking at community-wise, because I guess I look at it from the perspective of, you're not going to see a nursing home resident show up in your school.
Right. Okay. Well, and I think one of the other things that would be really helpful for the community to understand, Dr. Lockard, as we're getting closer to that hybrid date, right? We're preparing to go back into a hybrid model. A decision tree of exactly how things would play out and what the action plan is in terms of if a kid or a staff member in the school has symptoms, what do you do? And what exact symptoms are we talking about, right? Is it just a fever, or is it a fever or persistent cough, or, so what exactly are the symptoms that we're talking about? And then what is the decision tree of how things happen there, right? Like, do you force a test? Do you, force a quarantine? How do you, but what is the exact process that you would follow? And then differently, like, so if they are tested and you get a positive test, then exactly what is the decision tree from that point on, right? So, and you kind of see, like, okay, if a kid is exhibiting symptoms, then what are the symptoms that we're talking about? Do they go to the isolation room in the health suite? And then exactly how does it trickle from there? So I think it would help folks to kind of understand, okay, exactly what are the criteria around these things and the decision tree that will be followed when we're in a hybrid model. I think that would give people some comfort.
Sure, and so we've outlined that in our planning, but it's interesting that you mentioned that. Ed and our team are having a meeting tomorrow to further clarify that. My hope would be to bring that back on the next update meeting, so we have a glimpse of that, and we really appreciate Ed and his team helping us through that process, because I get it. There's a lot of questions, and we've tried, and as information's evolved throughout this whole thing, sometimes guidance shifts, or what one organization or group put out initially might have morphed over time. So we're constantly looking at that, trying to get updates. That's the purpose of tomorrow's meeting, to make sure we're up to date, because we do want to be able to, as up to date as possible, have that information available to our families and to our school communities.
Okay.
Yes, I want us to be careful with that too, because I know we hear, like, if someone has a runny nose, send them home. They possibly, get them tested. And I want to make sure we're really careful. I mean, right now we're hitting ragweed, grass, all kinds of pollen, and it makes your nose run. Even wearing a mask for an extended period of time can start making your nose run. So I would like us to definitely just, if we have some type of layout, that whether it is just fever, that's it. Because I really don't want, could it cause a legal issue if we sent a child home because they had a runny nose and they did not test positive?
Well, I think this is why we need to have the conversation, and I think the guidance has shifted. I don't want to dive too much into it because I don't have all that in front of me so I don't want to be misquoted. But there's really two symptoms, onset of new symptoms that we'd be looking at. Although fever trumps that, so that'll be important to communicate. And you're right. We're going to be battling. That's the whole thing this fall. It's seasonal allergies. It's cold and flu season. It's you name it. I sneezed because it was bright, and that makes me sneeze sometimes when I walk into a room.
Fuzz in the mask.
Right. So those are all considerations that we've been thinking about throughout this whole time, and want to be really clear. Although I will say to you, when we have that guidance, I think we're always going to err on the side of caution and safety. I wouldn't want to keep somebody around just because I'm concerned that, well, I'm not really sure what those three things might be. If it's more than one, like we said, two new onsets of symptoms, then we're going to be erring on the side of caution to make sure that we don't have to be, as has been said before, starting and stopping all the time or shutting things down when we don't have to.
Right. And Mr. Singer made that point, and I think we've discussed that on several other occasions, that once we do open up, you would expect there to be a rise in cases, right? So that doesn't mean that as soon as you see a rise in cases that you rush to judgment of, okay, we're going to close back down again. I think we're probably going to have to look at some thresholds and maybe, I mean, if you took a very literal read of the slides that the state put out, right? Like they're saying that you could go to a hybrid model if you have less than 15 per 100,000, which is 180 cases for our new cases for our population, right? Like, I'm not comfortable going to that level, but maybe that's the benchmark that we look at in terms of if there are additional cases that come on after we go to hybrid, that as long as we stay under that level, we wouldn't need to reclose down. I mean, maybe that's the way to look at it. Ed, I don't know if you have any thoughts on that.
I do, and I was going to wait to see if you wanted me to chime in on that or not. But my personal opinion is once you open schools, that we base any decision to do anything differently on contact tracing, regardless of what happens with the community numbers when kids are back at school and whatnot. I think what's going to be the determining factor is if you have too many kids that are sick or too many kids that are in quarantine that you can't effectively teach in-person classes, then that's going to trigger the decision that schools are going to have to potentially reclose. I just don't think having a number of how many cases are going on in the community is relevant. Once we've made the decision to move forward, I think you open, and then ultimately what's going to trigger the decision is if all of a sudden you have it at one of your high schools or one of your middle schools, 70 kids that can't come to school, is it practical to continue to offer in-person learning at that school during the period of time that those people are in quarantine and in isolation? And then we'd have to figure out, what makes the decision to reopen that school so that I think those are things that maybe as a school system you need to be thinking about. I don't think it's a public health decision at that point. I think it's more of an operational standpoint when we determine, 70 kids can't come to school today. What does that do? Maybe it's 10 teachers can't come to school today. At what point does it make it impossible for you all to offer in-person learning at a school when you reach a certain number? And I'm sure that Dr. Lockhart and I, if we get close to any of those numbers at any point in time, are going to be having a lot of conversations about this, and I'm sure he'll be seeking your input as his elected board. But I don't know that there's metrics that would necessarily, once we've made the decision to move forward, that any of these metrics should have an impact on whether your schools stay open or not. I think it's what we're trying to do here is to set the stage to say we think we could safely reopen, and we think we can control the cases because we're at this level. And once we successfully, and there are going to be bumps in the road. When McDaniel brought their kids back, they had a number of kids test positive during the first week, and they put those kids in quarantine and isolation. And then you get past that, and there are going to be cases along the way, but it all depends on how many people are going to have to be excluded from school because they're sick or exposed as to whether or not you're going to be able to continue to operate. And that's an operational issue that you're going to have to figure out as a school system, as to how we can make this work and whether you can manage the number of cases we're seeing or not.
Yeah, I think I'm not sure if other board members agree, but I completely agree with that. I think it's just a matter of setting the expectations, right? Like, so we've set kind of the numbers and the dashboard that we're looking at in order to make that decision. I think we need to set expectations that those numbers are going to bump a little bit after we open, and that doesn't mean that we're immediately going to shut back down again, right? So I think it's just setting the expectations of it then does become an operational discussion after that point, not strictly a number of new cases discussion.
Yes, and I think, and Mr. Singer's comments on not having a hard and fast number on this, and then the same thing there, and you alluded to Southwestern, and I don't know whether this is an advantage or disadvantage, but that's one high school. That their system is one high school, and what they did, unfortunately, and I don't know how they've done this week, they said if we have a case and we contact trace, we have 3 more, we're going to quarantine, we're going to do our thing. If we have 4 more, we close. Well, they even said, 3 to 4 and we close is ridiculous. Well, it happened the first week. And I guess, and I rest assured you guys are going to have all kinds of protocols and what ifs and all that. And then the decision might be to close, well, I'll use North Carroll because it doesn't exist anymore. You close North Carroll High School, not the county. But that's got to be a decision you got to make. And I think, Mr. Singer, what you're saying, it's pretty convoluted, but that's what you have to do.
And again, I guess my point is while we're looking at these numbers to make a decision, it's to kind of tell you that we think we could be successful in reopening and not having to close back up again and disrupt operations. And regardless of what the numbers do after, and I think Ms. Spigney hit it right on the head, regardless of what the numbers do after schools reopen, it's going to be driven by the number of kids that are going to be out of school because they're in isolation or quarantine as to whether or not the schools can successfully continue to teach.
So, Dr. Lockard, you are planning to bring kind of a very detailed level of guidance in terms of that decision tree to the September 23rd meeting?
Yes.
Okay, great.
And we're hopefully close to done holding up you guys, but Mr. Singer, I want to thank you as always, and Garrett Hoover, I'm glad you decided to come to Carroll County, and we are so blessed here with, I think other counties are very jealous of us, how we can, Mr. Singer works with us and works with the superintendent, and you work with him, and Carroll County is amazing, and thank you both for being part of it.
I'll second that.
I appreciate you guys putting up with me over this time. It's none of this stuff is easy, and it's a lot of back and forth on. I heard them talk about social media earlier tonight, and I keep telling my family, my friends, I said, I can't let it bother me. We just deal with what the facts are, and we try to do the best thing we can for the community. And there's always going to be people that disagree because, unfortunately, I think most of the community either thinks that we should close everything and have restrictions on everything, or open everything entirely back up. And really, the decisions we're ultimately looking at having to make are somewhere in the middle, and that doesn't make anybody happy. So it's understandable. There's going to be unhappiness with whatever decision you all make, and we're just going to have to move forward and do the best we can.
Well,
so thank you all very much.
Well, I just like to hear when you say that we definitely need to get these schools open, and that's a positive for helping us to get through this, and I really do appreciate that.
Well, thank you so much, Mr. Singer and Mr. Hoover, for your time tonight. And I'm assuming that we will probably reach out to you again for the September 23rd meeting.
Put that on your calendar.
Right.
It's already on my calendar.
Okay, good.
All right. All right. Thanks so much, gentlemen.
Thank you. The board members, along with the COVID updates, there's a couple things. I want to, obviously, with the start of school getting underway this week, just want to acknowledge the ton of effort and work behind all that and leading up to it. And I'm just checking, Ms. Gaddis, are we good with no additional public comment? Okay, thank you. Certainly, I think in just a couple days, folks can see much improvement over last spring with more structure, far more synchronous learning where teachers and students can see each other and talk to each other and engage. We still recognize it's not the same as face-to-face. We still recognize the challenges associated with virtual learning. We continue to problem solve and work on every request and individual thing that comes up, and so we know it's far from perfect. But I wanted to take just a couple minutes, and I asked Ms. McCabe and our directors if they wouldn't share just a couple of positives so far this week, and then we can certainly get into some of the additional questions and related items in the update section. Ms. McCabe?
Good evening. I would say that just as Diane Gill mentioned earlier in the meeting, our schools have been very, very busy giving out so many materials to our students and families. Bagged materials, textbooks, supplies, as well as, of course, our laptops and our MiFis, our hotspots that are going out to families. Our school staff, including administrators, teachers, IAs, and tech services, have been working around the clock to make sure that our families get what they needed to start school on time. And in fact, our tech services staff were out over the weekend visiting homes and trying to problem solve with families about what the best solution for their internet needs would be. So everyone's been working so hard, and everyone's been so excited. Yesterday, just going out to the schools, there were so many teachers and assistants in the schools working with their students from their classrooms, and so excited to just show us what they've set up for their students. So I think it's been a very exciting start, and teachers have done a great job to engage their students and help to motivate them in a very different start to the school year. And with that, I'll send it over to Mr. King to talk about some of the high school highlights.
Thank you, Ms. McCabe. So I'll sort of start with the pre-service, the activities that occurred with the community outreach before school started, and many folks have reached out to the principals and to me to thank us, especially to highlight South Carroll, Century, and Winters Mill. Winters Mill did a parent-student resource site in Google that was highly, highly appreciated. Also did sort of a video slide presentation to talk about what the first day of school would look like. All of the high schools did wonderful things, but those are the three that certainly got a lot of feedback. But the pre-service activities, the freshman orientations, and then the back-to-school nights, which are still ongoing, many parents reached out to thank us for the quality of those presentations and how they answered all the questions. Certainly all the high school principals, assistant principals, all the teachers know there's a lot of anxiety about this, of course, and I'm really proud of how they started even before school started to explain to folks what is your student's life going to look like and how are we going to support them in this new virtual environment.
Thank you, Mr. King. How about Mr. Wernick or Mr. Hill?
Good evening, everyone. Board members, Dr. Locker, Commissioner Fraser, I'm very excited to report the positive feedback that we've had from parents and from staff and from, just the community at large. Especially, I wanted to commend our teachers and schools for their approach by just reaching out to families. I know Ms. Battaglia had mentioned that at the last board meeting, that one of her teachers, reached out individually to families and to their students. Prior to them coming back to school last week, the week before, teachers have been very busy reaching out individually or in small groups to share their schedules, to share what they will be doing, what the school day is going to look like. As well as just explain, the virtual learning process. I know many of our students, had that fear. We're coming back to school. It's different. And I think that with teachers allowing themselves to be present, allowing themselves to reach out, really eased those fears for a lot of our students. And they were excited and comfortable coming back to school yesterday. So again, I think that they did an awesome job. Administrators, teachers are just reaching out, supporting their students. supporting their families with questions consistently last week, as well as, within the first couple of days of school. And again, just reiterating what Mr. King and what Ms. McCabe said, I think all the schools did a great job with materials, as well as with their orientations and back to school nights.
Oh, I think there we go.
Mr. Hill, are you there? He may be having internet problems. We can come back to Mr. Hill. One last thing I will put in a plug for is I was at Hampstead Elementary School yesterday, and it was so great. One of their special educators was sitting out front of the school in a chair with her computer, and there were a couple of parents waiting to speak to her, and she was actually meeting with them outside and social distanced, wearing masks, and helping them through some of the things that they were struggling with in getting into the LMS and getting their students set up. So that was just another example of how staff were taking the time to really address some of the personal issues that were going on with specific students and families. And of course, this will be ongoing throughout the next few weeks. We'll be doing everything we can to help with any problems that start to pop up as students really get into the work of first quarter. And
Ms. McCabe, can you hear me now?
yes, I can, Mr. Hill.
Good. A little bit of a connectivity problem. I just wanted to talk about the actual day, and having a few more years in the system than a number of people, I will say it was very unique to drive into school and not have to deal with traffic. But once we got here, the outstanding job that everybody did, as we discussed, preparing for it. Schools were starting off with morning announcements. The students were in and active. It had a normalcy to it of a day that we haven't been able to experience for a long time. I really want to praise our teachers. The teachers and the work that all of the staff did to get to that ability to start off and get that day going is outstanding. I still say that's the strength of our system. One of the things that I noticed were all of the wonderful enhanced online activities from all of the PD work that we did. You actually saw that apply yesterday and today, and you saw the students engaging. You saw students getting to know their classmates. You saw teachers really getting to know their students. Those are the kind of things that you want to accomplish in any beginning to a school year, but with the uniqueness of this year, I just thought that was absolutely outstanding, the way our staff rose to the occasion and made that happen. The way that the feedback came through from parents afterwards, and the feedback that I got about there were 100% of my students in class. We had outstanding work to do. We still have people that we're working with and are having connectivity needs and things. And the work of IT and all of the folks to make that happen as fast as we can is really exciting to see. One of my principals summed it up, and he said it was an excellent start to a very unique year. We're really excited. And I don't know how you could ask for much more than that.
Thank you.
So Cindy, just to ask a couple of follow-up questions. It's really great to hear how successful we thought the first 2 days were for school. That's great. Really proud of everybody for all the effort that we put in. We've been saying for months now that it was going to be enhanced virtual learning, and I think we all saw that play out. I certainly saw it with my own 2 kids yesterday. And but you had made some comments about connectivity and how the IT staff has been out helping out. Do we know what we're down to in terms of number of families that are still having connectivity issues? And have we used all the jetpacks, or where are significant problem areas still?
Sure. We're meeting about that just about every day. And those numbers are in flux every single day because we continue to get requests from families who maybe didn't think they were going to need something and now they do. So those issues change daily, and we're trying to address them daily. And with that, I'll turn it over to Mr. Davis.
Good evening. I'll just give you throw out some statistics. In the spring, we had issued 1,600 approximately, maybe a little bit more, of the laptops for loaners. So when we were trying to estimate, we were like double, triple, we were trying to figure. So we kind of thought maybe triple. Well, we're way over that. For the phase one, which was the people who had responded, for the folks that have responded to the intent form, and for those that we didn't get responses, the schools did a lot of work to follow up, to call and get additional information. So for phase one, that was the people that have responded. We had issued 8,255 laptops since the follow-ups have begun. We've gotten 1,325 more requests. So right now we're sitting, well, it's probably higher, but as of 4 o'clock today, we were at 9,580 laptops requested. So we're starting to get a little concerned because we need to have extras for replacements because from a support perspective, we want to be able to just give them a different one if they have a problem instead of trying, and then fix it and later, so they're not stuck without something. So we're starting to get a little concerned about the numbers being so high, but so far we're okay. The MiFis that were delivered, to start out with, we worked off of what the governor's grant, the requirements for the governor's grant. And so we had done an analysis of data through the FCC data and determined that we had, according to this data, which we knew wasn't 100%, 424 families that did not have access to internet. We did 400, and after that, we determined an additional amount that was 459. So we delivered 440 of those before the first day of school. There were 19 families who just don't have coverage at all. Between wired internet or coverage of the two providers we were using, Verizon and T-Mobile. So we know there's probably going to be more of that. So as of right now, we've delivered a total. Now, this doesn't mean that they've all been picked up, but this includes numbers of ones we delivered to schools today of 496. As of today, we have a total that were approved for being distributed of 661. We have 800 available. We're going to do some projections on the numbers, and as Ms. McCabe said, meet daily, and we're going to talk about if we need to order more. All those numbers above the 440 don't qualify for the grant, but we're making decisions to provide them for families. And we ran into a lot of situations where families, we had to do everything based on the student's address, but we're finding there's a lot of people, understandably, where the kids are going to be at grandmom's house, or somebody else at some other location, or they're splitting time between mom and dad, and mom has internet but dad doesn't. And so we're dealing with all these situations as quickly as we can, and we're working as fast as we can on this. We also know that there's 425 families right now that qualify for Comcast Internet Essentials, which is the service that Comcast provides for qualified families. They will get the service for free for a year. So that's kind of where it stands. Because we're still doing, the schools are still doing following up and getting information from schools. It's like Ms. McCabe said, it's in flux and very dynamic. But we're trying to get to everything as we can.
So, Mr. Davis, with best case information, do we have an idea of how many families we think, or how many students still don't have connectivity? So you had said there were only 19 families of the ones that we knew about originally that haven't received the MiFis, but it sounds like we're finding out more. Do we, from everything that we know at the moment, are there 200 families that are without connectivity?
Yes, approximately 200, but again, it's hard because we have not been able to get in touch with all of the families to this point. So that would be a approximate guess by me.
And the way we will look at those numbers is not only from tech services and who's telling us that they don't have any internet or cellular, but we'll also get those numbers based on feedback from the teachers about which students have not attended school yet. And so, once those numbers and that information starts coming in, then our pupil personnel workers start taking over to contact those families and find out what's going on and how we can help. So that's the second phase that will help us get a better picture of how many and who they are.
And I know it's not always convenient, but I was reading in the paper that the Carroll County Public Library has some hotspots available, as well as a space in the town mall. But again, I know that families can't always, travel to those places, but I thought it was good that at least there are two more possibilities for folks who could, go to those places.
And we also, like last spring, we still are offering again, not the first choice, but as a backup option, all of the Wi-Fi is enabled on the school, around the schools, and there's still those maps of where that's available in the parking lots is on the websites. Also on the websites, we have a list of all the internet service providers in the area. We have the information about the public library and about our the school systems having access. So, and I know there's a lot of other locations. I know that people, I've heard, there are churches that have internet service that I know the students I've heard are taking advantage of. So I know there's a lot of other places. Again, wouldn't be our choice for how to do it, but there is the concern about the folks that just simply don't have a choice for access. And I know our curriculum people have done a wonderful job of preparing materials for those folks as well.
So one thing I'd like to add to the conversation, I appreciate all the work that Gary and his team, nights and weekends, delivering and going out to homes to help. And we knew we were going to have a handful of situations, as they're describing. Some we may have known about, but a lot where things have changed, understandably, circumstances, or my child can't be with me, half the week, so they have to go here, and that's where we need the internet now, and that's changed on us. But one of the things I've talked to Cindy about is here, as we get through this first week or so, and really hone down, okay, who is the handful. I've tasked the team with starting to look at what can we provide then in small group settings, for kids to be able to come in and utilize our access during the day, provide some support or coverage, supervision for those students so that their needs are met. We don't want to, at the end of this, say, well, sorry, it didn't work. We're trying to problem solve every little angle we can to make it work right now, but we recognize with 25,000 plus students and some remote areas of the county and access being what it is, that then we need to provide that next piece, which is I think we can provide that support for students. It's a small handful, as we're hearing about in our schools. So that's what I'd like to see happen next.
That's perfect. That's where I was trying to take that conversation. I think that's exactly the right way to be looking at it. Like, so pick away at every little bit that we can, and then try to bring them in for small group settings for the ones that we can't troubleshoot. So, Mr. Davis, I want to thank you for all the efforts of your team. It's been an outstanding effort the last couple of weeks.
Well, thank you. It's very hard because we know we haven't gotten everybody, and we really want to, and I know that there's been some frustrations, and I know that there are situations where we test it and it seemed like there would be connectivity at a location, but then once they get it in the house, it's not fast enough. So we're trying to swap out with a different provider. But again, it's just one of those things that it's just kind of hard to know until you actually turn it on and try it out. So we're trying to address all of those as quickly as we can. So thank you.
I have a question on connectivity on the other end. And again, you guys have said the teachers have really stepped up and the kids are excited. And in many cases, they're seeing a brand new teacher or teachers, and they're very excited. I've heard a few things about connectivity on the teacher's side, and I don't know what you guys do for that. I'll be honest, I never much thought about it. Even if we open soon, whatever we do, we're still going to have some virtual going on all year the way it looks. What happens, I heard of one, like the teacher's thing cut off 10 minutes early and they couldn't get back on, or I could really hear my science teacher who happened to be in school, but I couldn't hear my other teacher. Their connectivity was poor. What can we do to help the teachers that are home for whatever reason and maybe can't go into school to make sure if they need an upgrade in service or something? Because again, if my kid's computer doesn't work, that's one kid not listening. If the teacher's doesn't, that's 100 kids that don't hear. What do we do about that?
So right now, many teachers are still getting used to teaching from whatever location that they're teaching in. And that's going to take a little bit of time. The other thing that's happening is administrators are starting to go into different Google classrooms to make sure that things are going well and that the teacher can be seen and heard. And so as teachers and administrators discover technology issues that are happening, we'll be working through that with our instructional technology team as well as with Gary's folks to see what we need to do to make sure that students are having the best experience that they can have. But yeah, it's going to take a little bit for teachers and administrators to hone in on whatever problems are happening. It would also help if students or families are having a problem with hearing or seeing a teacher or a teacher's connection. It would be helpful to let that teacher and administrator know. Sometimes the teacher is not aware that there is an issue. So I think with everybody working together, we'll be able to address the problems that are going on out there.
Thanks.
Board members, any other questions under the start of school updates?
Have we heard anything else regarding sports?
Cindy, do you
Uh,
want to? Sorry.
Yes, we have been moving on with athletic conditioning. We're implementing a plan for our general athletic conditioning and then working on plans for sports-specific athletic conditioning. And I see Mr. Duffy has popped up on our screen, so I'll let him share that information with you. You're muted, Michael.
Good evening, board members. I hope everyone's doing well this evening. Our plan will begin this coming Monday with non-sport specific conditioning. It'll be taking place in the afternoons. Students will be working with athletic coaches in pods of no more than 20 students. Students will not be crossing over between pods. That was our initial plan. Our hope is after a two-week period of that, we're going to move into fall sport-specific activities under the supervision of coaches, still in small group pods. Our hope for that is between 3 and 4 weeks of sport-specific working within the schools, allowing students to reacclimate to the sport, work with their coaches, work on skills, which will benefit when we begin ultimately the second part of our 2-semester plan, which will involve full-on interscholastic athletics. After the period of fall sports, around mid to late October, we will begin a similar 5-week period involving conditioning and sport-specific activities with spring sports, followed by our hope we'll be back in the buildings, and then we will have the same period of time involving winter sports prior to the beginning of the second semester, where the plan right now is that the MPSSAA will have the 2-semester plan in place, and we will have 3 sports seasons included into the 3 abbreviated sports seasons included into the second semester of time. So our plan, we're going to be moving forward starting next week with non-sport specific conditioning in the school at the high schools. And then our hope is to move into sport specific. We are finalizing what that plan is, what exactly that plan is going to look like now. Are there any other questions?
Thank you so much.
Absolutely. You all have a wonderful evening.
You too.
Board members, I didn't want this to go by, since we're still on this topic, without giving you just a brief update on the synchronous, asynchronous, total hours. You know, 3 weeks ago or so, when the state was reporting that, they had numbers of ours which didn't accurately reflect all of the synchronous opportunities, and that was true for a lot of counties across Maryland. We recognize what the state board decided in determining a minimum number of what they expected, but they didn't have all of our synchronous support times, all of the additional follow-up that's synchronous, et cetera. So we've gone back and reviewed that with our level directors, our principals, to make sure that our averages are correct, and wanted to make sure you had that revised copy. We did, however, where we really needed to go back and look was in pre-K. You know, the state is expecting 3.5 hours of synchronous instruction. We didn't quite have that, and you know, we can, for another time, have an argument about how much screen time for a 4-year-old is appropriate. But in terms of meeting the intent, and the state asked that, I think in their final vote, they wanted systems by the end of the calendar year to meet this mark. As you remember, a lot of systems had already started. Some were only 4 days a week, we were 5 days a week, and so this was not a significant move for us at all, because it really all existed there with, like I said, with the exception of a little bit of tweaking. And so I wanted to make sure that we shared that with you. That's being updated on the plan that's been submitted, as well as the plan on our website. Those changes will be shown there. All of our teachers and schools are fully aware of what that expectation is. Ms. McCabe or Mr. Anderson, did I miss anything there? And
Before you go on, Dr. Lockard, I raised my hand. I was wondering, is that something that you just passed out? If
Yes.
it is, can you share your screen with that information?
Yes, you know what, when Ms. Savigny mentioned this earlier, I had some copies made, so I will forward that to you. But essentially, it outlines the synchronous, asynchronous, and total hours per week for elementary, middle, and high school. And for all intents and purposes, for elementary, it's 3.75 hours on average per day of synchronous instruction. For middle school, it's 3.7 on average per day, and for high school, 3.5. Asynchronous is also shown there, and we do note that, you know, asynchronous time is going to vary depending, and I'm sure Devanshi can say this, if you're given an independent assignment or a follow-up assignment, what might take you, Dr. Dorsey, 20 minutes to complete might take me 50 minutes to complete. And so there is a little bit of flexibility there, but we tried to prepare it so that work we were providing certainly would fit within the average expectations for students each week. And so I will forward you a copy, and we'll put a copy of this on our on this board meetings items, as well as, like I said, reflected in the plan that's posted. And so I apologize, Dr. Dorsey, I didn't have an advanced copy for you. It was kind of a last-minute conversation in terms of making sure we brought that to share.
Okay, thanks.
And Dr. Lockard, I want to thank you for handing this out and making that distinction, because I think what we want to say is, like, we didn't change our plan other than some minor tweaks, but it was that the state had completely misinterpreted the information that we had provided, and several other systems had provided as well, in terms of their synchronous and asynchronous time.
Right, and you know, there was a little lack of clarity of what they were asking for to begin with. And so we've clarified all that, as lots of other counties have too. And so we feel very confident in what we have here. It's what the expectations are. So, like I said, Ms. McCabe or Mr. Anderson, I think I covered that, but if you had anything else, please chime in.
No, thank you, Dr. Lockhart. I just wanted to go ahead and add also that Carroll County is one of the few school systems that actually has provided a schedule of 5 days a week of direct instruction. And that's something that we should, be very proud of, that each day our kids are being met with on a regular basis. And, there are some systems that are looking at only doing it 4 days a week. And as Dr. Lockhart said, everyone is now required to have 5 days a week of instruction by the end of the calendar year. And so, Dr. Lockhart did mention there were some minor tweaks that were done. When we say minor, we're talking less than 5 minutes in some situations to make sure that we are in compliance with the new state guidelines. So again, hats off to the curriculum team, hats off to our directors of schools, making sure that happened. And we're in a good place, I think, right now. So thank you.
Thank you for that, Mr. Anderson. I think that's great that we had always anticipated, providing or planned for providing 5 days a week. And even when we come back in on a hybrid model, that will still be the case, right? Wednesdays will be, it's not that, Wednesdays are off. Wednesdays will just be all virtual for everyone under the hybrid model as we currently have it. So.
Yep.
Great. Board members, any other questions on that?
While we're under school starts, is this the right time to talk about school use?
Yeah.
One of the things I wanted to at least start the conversation on tonight, of course, Mr. Singer and Jeff Daggetts a week ago reopened rec sports, including basketball, wrestling in the winter, and tackle football. And so what all the rec counselors are hollering now is, when can I ask for facility use inside the school? And the staff here stepped up and did the outside quickly. And I'm sure everybody wasn't happy, but I haven't heard anybody complain, so everything must have gone pretty well. But now, what about inside? And I recognize there's going to be cleaning protocols. There's going to be, calendar issues. Again, I'm the last person would want to see a basketball tournament in the school October 18th, and then we can't open on the 19th or something. So I recognize this isn't like every other topic tonight. It's not easy, it's not black and white, but I think we need to start the conversation, and hopefully the kids can get doing the sports in the buildings too.
Right, so I know from an operations standpoint, I talked with Mr. O'Neill just a little about this, and there are some challenges. We want to support any way we can. We also have to be cognizant about, our own building. Right now, our plan, we'd have to adjust our plan, which is why we'd want to have this conversation here. The goal is ultimately to have our students in our buildings. And so one of the things that comes to my mind most is making sure we've squared away the cleaning protocols so that we have outside user groups eventually using the inside of our building, that we're confident that it's clean to our protocol satisfaction. And so, for example, we had some discussion in here with Carroll Community College. They have traditionally always used for welding and another heavy machinery, they always used our Career Tech Center in the evenings for just a handful of students. We worked with them. We trained their staff in our cleaning protocols so that, because we're going to have Career Tech students back in our buildings here next week. So, so we want to make sure that we're putting ourselves in a good position so that our students can continue to occupy the buildings when we move to that hybrid. Mr. O'Neill, if there's any additional pieces, that's the one big one that comes to my mind, that we do plan on ultimately having our own students back in our building, so I just want to be careful. And I know our partners in rec and parks and other places will step up. I don't doubt that at all. I just think that's a consideration.
And I think, but before John starts also, what a lot of groups want to do is just plan. Can they have games in December or January? More, and I think, again, I'm not good at pleasing everybody, but I don't think any of them expect to be in there next week. Right. But if it's November 1st, And thereafter, when can they do the paperwork? When can they know they have it? And that kind of stuff. And when do they know what they got to do to use it?
So I guess I'd say my sense is that tonight you're not seeking to have the full discussion on this, and maybe the next update meeting is a time slot to go into that deeper, perhaps. I would say that, some big picture items for now, and maybe I could call on Ms. Eisenberg on some assumptions that I've made, although I think there's been so much, but I think I did talk to Mr. O'Mealy way back at the beginning of the planning period on some of these things. First of all, the plan as it is does not allow any inside use beyond the before and after daycare. So I think, would require formal action to change the plan. We'd have to update the plan and send it to MSD. That's just sort of a, procedural or technical part of it. Secondly, Dr. Lockett probably hit the biggest part, which is, we don't believe we're really sort of resourced to take on that additional exposure and activity, managing that activity relative to cleaning and sanitizing, especially once we reopen in a hybrid model. And so even if you look at the conditioning that Mr. Duffy and Ms. McCabe were discussing for our own students, for our student athletes, we don't really have them in our buildings for that kind of conditioning. They're very limited in terms of entering the building. I think that we need to be careful, although, Dr. Locker referred to the partnership with Carroll, or our Carroll community, and that certainly is a true example. That's one room in a building with a little bit of other limited access that's a little more comfortable than all the schools. And I think we would bear the liability for to whatever extent the cleaning protocols were met each night. So I don't think we could simply say, kind of clean up after yourselves. This would be kind of a different time and place than in the past. And I also don't think, and this is a place where Rochelle could maybe add clarity right now, I don't think we can make an exception for one community use group under our general procedures. We have a separate MOU with the college, but under our general procedures, we couldn't say, well, we'd be willing to let rec and parks in, but not any other groups. I'm not sure that we'd be legally capable of limiting others once we make that decision to move forward. So cleaning, and in my own mind, it sort of goes with it, but I'll say it right now so it's out there for you to start thinking about. Related to the cleaning is our exposure protocols. And so the CDC guidelines, the MSDE guidelines, and therefore in our own plan require closing the spaces where a person who either tests positive or who demonstrates symptoms is in a building. And so now we would be allowing outside groups in the building. And if we're following those protocols, and that's, I think, one of the things on the ongoing agenda that Dr. Lockard referred to with Mr. Singer, including a meeting tomorrow. But if we follow those protocols as written, then you might have to close down the gym or the cafeteria or the auditorium or whatever the main use area is in one of our schools for the next 2 days because we found out that somebody in one of those outside groups demonstrated symptoms or tested positive. So I think that's a very important operational question that the board would need to kind of think through as they make that decision, or if you want to pursue that decision in any way. Rochelle, I know I'm putting you on the spot, but I don't know if you want to have a comment on the equal access part of it now, or if it comes up at the next meeting then.
You're not putting me on the spot. I agree with what you said. And also the hurdle, the huge concern about what happens if somebody does test positive that was there. Having just lived through a quarantine in my office and knowing how it brought all business to a halt, what you're saying is so very true.
So that's sort of why the plan is the way it is, I guess. And if the board wants to take up that discussion, we certainly, can try to bring more information. I know I asked Mr. Prokop to poll the facility managers for the other districts. You never get 100% response when you do those surveys, but I think if Ray's out there, you got a pretty decent response. And if my memory serves, you only found one other county board that was allowing external use inside the building, and that was with a fee. Is that true?
Yeah, that's accurate, John. I believe I have
10 or so responses. They've been coming in and just a little over time, but for the vast majority are just not allowing indoor use, and it's all because of the same concerns that you're expressing, just expressing a few moments ago. So there is only one other county that appears to be allowing it. They're charging a fee. I don't know the exact amount of the fee, and I would have to look at all of their use of facility protocols to try to compare them with ours. So it's hard to discern exactly what that looks like, or whether there's any restrictions or anything else. It was a quick survey we conducted, and the results are, in general, we're in alignment, although I do know that I think Frederick County may be reconsidering this evening. They may be having the same conversation tonight. That's the last I heard from their use of facilities coordinator.
So that's another piece of data we could try to get a little more info on, and if this is something the board wants us to talk more about at the next update or at a future update.
Yeah, I think sooner or later it's going to happen, and the sooner we talk about it and start looking at the what ifs, the better off we are. And tonight is maybe premature, but I just figured the sooner we start talking about it, the better.
I don't feel that it's premature. I just want to be ready. We need to be organized, and they definitely, these kids need to be engaged. And I know Mr. Rothschild's called me for his after school group too, and we can't do anything yet.
So, President Savigny, are you okay if we gather a little more information, continue that conversation at our update meeting on 9/23?
Yep.
Mr. Kyler?
Yep.
Good.
That makes sense.
I think it'd be great.
And speaking of this, and brought up the plan, does anything have to be done with the plan to set the opening date? Or is that something that in the plan there's different options, and the date, when the date happens, it happens?
Yeah, I think the latter. We don't have to signal an exact date. I don't think that could be anybody's expectation. Now, we've gone ahead and targeted.
Yeah.
Just
Right.
for all
Yes.
the reasons that we've talked about, but for MSDE's intents and purposes, no.
Good.
Okay. So, board members, anything else under section 3? COVID updates. No? Okay, great. Then we will move on to section 4, which is board member and superintendent updates. So, board members, just if we can try to keep our correspondence pretty quick to keep this meeting moving. But Ms. Herbert, do you want to start?
Sure. I didn't think yesterday would ever come, but it did. And I need to thank Dr. Lockhart and everyone down. Did a great job for yesterday's great opening. Yes, we did have a couple glitches with connections, but I visited 2 schools yesterday, and over 50% of the teachers were there in their classes working, and they were working really hard. And I will say that the new layout for the Schoology is really user-friendly, and it's clear, concise, and it was inviting for the students. And it actually, for people that don't know, you have your classes, your 7 classes, or how many classes you have that during that day for the younger ones, and the times are there, and the actual how many times they meet, if it would be health or music or whatever. And I thought that was really clear and concise, and took care of any mix-ups, mess-ups when their classes were. I saw great interaction between students all day yesterday and today, because I have 2 at home. The kids were so excited to see their new teachers and see their classmates. And I can tell you, these teachers really worked hard during the summer, and they really had exciting openings. They really did. Last night during riding lessons, I asked my older kids, I have high schoolers that ride, middle schoolers that ride, and they were very excited to see their friends that they had not seen, and teachers, and they just said, we want to be back in school. And I think they would see every once in a while a classmate, Manchester Valley area, reception over there. A kid would drop off, and then they'd come back. I saw it at Manchester Elementary. She'd go, oh, we lost one, then they came back, and then of course, with the teacher connectivity too. Hope we can get that all worked out. Still concerned about, I had a parent come to me the other day and said, it's going to cost my daughter $10,000 to get Comcast, but we need to thank all those grandparents and other family members that have helped out and said, bring the kids to my house and we'll get through this. So we have to thank members of the community for stepping up too, because this just isn't just Carroll County Board of Education and kids going to school. This is a family affair this year, and these grandparents have really stepped up to the plate. So I know she has 3 children in her house doing it. I did run into a North Carroll student who is now a PA at Carroll General, and he says, Miss Herbert, I need help. My son, or I forget who, boy or girl, is special needs. We just have a 2-month-old baby. I've got to work at the hospital all the time. And he said, is there any way we can get one-on-ones to help, because they have a special needs child? So we still need to help those out as much as possible. Dr. Lockhart, wave a wand, because those people, really do need help. And I understand it, and that's just one situation that we need to take care of. And of course, I still worry about parents, single parents, work all day, and then they've got to come home. And of course, those other disadvantaged kids and my career and tech kids, I worry about them. But we are on the right track for that. And I do need to thank IT, because they have gone above and beyond. And just like today, when they were having a browser problem, that is not my expertise. I don't know, but I know they stepped up the plate, fixed it, did whatever, and got the job done. And I'll be out tomorrow visiting more schools. But it's so much better than last spring. And look, we were the first out of the box, and we did the best we could. But this is wonderful. But I still want school open. Still want it open. Those kids want it open. Parents want it open. So that's it. Thank you. Can't thank them enough.
Ms. Battaglia?
First, I do want to thank all of our students and our families and all of the staff and all the teachers for an amazing first day. It really was a really good first day. I was able to be home and get the kids logged in. A couple little hiccups with some downloads of things that we didn't expect, but we're working all those glitches out, and it's been they've been able to get online and do everything they need to do. Miss Funk, if you're watching, God love you right now, because it's been so funny to see the first graders. And it's just her trying, she's trying to get them all like, all right, let's do this, and they're like, look at my doll, or in my daughter's case, look at my trash can. I don't understand, but I think it's just these kids missed each other so much, and they just seeing each other, and they're just very, very active and want to talk, and it's been really cute. It's a crazy cute, but God bless all of our kindergarten, first, and second graders, because all those teachers, I feel so bad for them, because I know it's been a little crazy, but I think it will calm down in a couple days. Videos, they've been incredible. Manchester Elementary does the morning announcements.
Yes, she did.
Mount Airy Middle School, their video was phenomenal. That was shared with us. North Carroll did a really good job getting all the information out to the parents. And Man Valley, the morning announcements, getting the parents involved, and all their back-to-school materials has been really good to see everything that is happening and all the hard work that went into this summer. So I am extremely thankful for it being a very much nicer and easier process to witness now. Just a couple things, as we go through this weekend. Tomorrow is actually World Suicide Prevention Day, and at 9 o'clock is a worldwide lighting of a candle. And of course, I think it'd be interesting as through all the time zones, that'd be really neat to see if there was a satellite image of that. So at 9 o'clock, they are asking people to light a candle tomorrow evening for Suicide Prevention Day. 9/11, of course, is coming up, and with COVID, a lot of the different special events have been canceled. Carroll County is having still their very small ceremony, but they're asking just a couple to come, and they will be videoing it so that can be viewed later. And I'm sure many of our news stations will be doing something and it just won't be as big as we normally have seen it. But I think, they'll still make sure, we do remember that day. Out of Darkness virtual walk is this weekend. Again, another suicide prevention awareness. And I have to give a huge shout out to HOFA. This is an organization here in Carroll County. It's Healing Opportunities Free from Addiction. And they are doing incredible work to help those who want to get help. So they're doing a lot of different fundraisers and opportunities to get the word out. So I think anything to help any of those that are in need is incredible in our community. So, but yeah, I think that's it. Just I'm glad we're hoping to get back to actual school soon, but I'm glad everything went really well the past couple of days.
Thanks. Dr. Dorsey, would you like to go next?
Yes, thank you. Okay, I attended an Open Meetings Act training on August the 27th, and this was a virtual training provided by MABE. And before I get off the topic of MABE, we are having our annual conference coming up on October 14th and 15th. So fellow board members, I do encourage you to attend this MABE conference, and it is going to be held virtually. And as I had shared at one point, the first day, the 14th, is a business meeting day, and the 15th, there will be workshops that I think you will find very helpful if you're able to attend. So I think last year we had 4 members plus our superintendent, Dr. Lockhart, attending. So hopefully some others can join me at the MABE conference this year. Also during this time, I have communicated with principals of my ambassador schools just to touch base to see how they are doing along with their school staffs. And I am happy to report that they are doing well. They have the kids' best interest at heart, and they're doing all that they can possibly do to make sure that our kids are going to be moving forward with meaningful lessons and learning. And as we know, there is no day like the first day of school. It certainly is a day filled with promise and high hopes and enthusiasm. And it's a day when we can chart the course for what we want to accomplish for a new year. My ambassador schools, and I'm sure all other school staffs as well, as we've heard from the directors at each level, I'm just so impressed and so encouraged with how enthusiastic everyone is, how encouraging. And I guess the other word that I would use is reassuring, because staff members are sharing the hopeful message that they are going to work through the challenges together and turn those challenges into opportunities. So they've been very, very encouraging, and our kids, I think, certainly are benefiting from that. It's been impressive to hear how our instructional staff has worked hard to enhance the virtual learning environment for their students. And something that I've always felt and something that I've always known is that here in Carroll County, we rise to the occasion. So this certainly is no different. We can go to every department in our system, as well as our school staffs. Everyone has worked very, very hard to make this beginning of the school year a very, very good one for us. I certainly have many thanks to share to the instructional staff for the hours spent in professional development, teaming, and preparing for the year. I know we've heard how teachers have been preparing their home offices, and we're hearing how they're going into the schools, preparing their classroom spaces as well. We certainly thank the chiefs and all employees for the extra efforts in preparing for the school year. I thank Dr. Lockhart for his positive, encouraging welcome back message to school staffs, and certainly for many hours coordinating all the moving pieces that we've had to deal with to prepare safely for the year. I give a shout out and a thanks to Mrs. Lilly and members of the Mount Airy Middle staff. As I think Mrs. Battaglia alluded to, Mrs. Lilly shared some links with the board members, and these links just shared the various ways that students and families in the Mount Airy Middle School community were greeted by members of the staff and really introduced to what the expectations are for the new year. I thank our students for being ready to work hard and accomplish their goals for the year. We thank parents for being supportive of your children. And again, thank you for your patience, because we're working through this together. So we certainly thank you for your patience as we go through these new experiences during the pandemic. So again, kudos to everybody in our entire school staff, all of Mrs. Deal's folks, members of CASE, everybody has really worked hard. And again, it's virtual, but it's very, very promising. So again, I'm just so grateful for how, again, we've risen to the occasion once more to make this a wonderful beginning of the school year for our students. So many, many thanks.
Thanks, Dr. Dorsey. Mr. Kyler?
I want to start off by saying that Ms. Herbert and I had a MABE legislative committee meeting, and that's great. We get great information, but and I think they know I feel that way, but we get done that call, and I'm sure there's many hardworking counties. I think all but maybe 2 or 3 were on, but we get done that call. I'm so happy that I live in Carroll County.
That is so true.
And I mean, I listen to the other issues. You guys are ahead of them. And I want to thank the superintendent, the chiefs, the staff, the admin, the teachers, the families, the support, all the support staff. And like I say, Carroll County, like I said, with Mr. Singer and Mr. Hoover, we just got such a great network up here. And I know we sit here sometimes once a month, it seems like 3 times a month, and spend hours beating on things, but we all just want what's best for the students, and Carroll County wants it. It's amazing. And then I've got to thank IT, and no offense to the other 48 of you. I think there's 49 of us on this meeting, and we still have a couple glitches. A couple of us don't mute when we have to, and vice versa. We had a couple people cut off. I cannot imagine computers with every teacher and every student in Carroll County functioning all day the last 2 days. So again, like I say, it's we all want to see the kids face to face as soon as we can, but man, what a great start in Carroll County. Thank you, guys.
Thanks, Mr. Kyler. Devanshi, did you want to say anything?
Hi everyone. So yesterday was the first day of school, and it was definitely a new experience for everyone. But it was wonderful to see teachers and our peers face to face again. I heard from many students that they definitely went a lot better than they were expecting. I want to applaud and thank all the teachers and everyone for adapting to this new environment. You could really tell the amount of effort that teachers put into making the day great for the students. Last week, I, along with the CCSJ officer team, met with our new advisor, Mr. Melhorn, and we have another full executive board meeting coming up next week. September is National Suicide Prevention Month, and I just wanted to bring awareness to it. I want to look towards bringing awareness to mental health and emotional wellness in our schools and having meaningful conversations about these topics, especially in a virtual learning environment. And again, I encourage students to reach out to me on Instagram, Twitter, or through email, and I'm looking forward to a great new school year.
Wonderful. Thank you, Devanshi. And just real quickly, I did actually get to meet with Mr. Bogger over at Westminster High School. He had invited me to come in to take some time to just look at all the projects that have been going on over there from a construction standpoint, you know, kind of take a look at the new science classrooms, the brick facade work that's been going on for quite some time and is almost finished. The impact that the career and tech construction is having on their campus, and then all of the other changes that are going on around the school to prepare for the hybrid model and folks coming back in at some point in the near future. So it was great to be there. I met a lot of staff while I was there. As Ms. Deal was mentioning earlier, it was amazing to see all of the IAs there and working hard. And I heard anecdotal stories of some of the IAs were clocking like 20,000 steps on their Fitbits to deliver all the materials and put all the bags together and take them out to the parents. It was a pretty amazing operation to witness. The people were just furiously working towards, having a fantastic September 8th opening. It was great to see, and I got to meet so many people who were clearly excited to be there and looking forward to the enhanced virtual opening. And I can attest, certainly, so I want to thank Mr. Bogger for that. I mean, that was a great experience and appreciate that. But my own two kids, that we had a really great start yesterday. Things were, lived up to the enhanced nature, right? Like, even though I think we were really ahead of it in the spring versus a lot of other counties, it was still a very rushed situation, right? We knew that there were issues with it, and that's why we've always been saying that the fall was going to be enhanced, and we definitely experienced that yesterday. My daughter, she's one of those incoming freshmen, right? So she had a lot of anxiety of not really knowing what's going to happen. I'm starting my freshman year of high school, and I'm not even actually going to be in the building, and I'm not going to know the teachers, and we've got this weird feeder pattern, and so she doesn't even know most of the kids in her classes, and so there's a lot of anxiety there. But the teachers really put them at rest. I mean, all of the orientation work, the back to school nights, it was clear all the effort that's been put in, and I know all the other board members, they've mentioned it, but I do just want to throw out a huge thanks to everyone for having such a successful first day. I actually personally was expecting there to be a lot more glitches than I think there actually were, and that is the event, that is the outcome of planning. Right. Thanksgiving came a little early this year, right? I'm so thankful to be part of Carroll County. We mentioned that we really are a great community, and everyone stepped up. Parents, community, staff, teachers, educators, instructional assistants, our food services workers, our custodial staff, central office staff, everybody, just an outstanding amount of planning and effort going into this, and it really paid off yesterday. So can't say enough thanks for how the first day of school went. So, and with that, I'll hand it over to Dr. Lockard.
Thank you, board members. I appreciate that feedback. Just a couple of good news items. Tuesday, September 15th is Custodial and Maintenance Personnel Recognition Day. You think we've heard them mentioned in our comments, but these employees do whatever it takes to keep our buildings cleaned and well maintained, to make our schools safe and comfortable places to teach and learn, and their work is vital as always, but certainly moving forward as our staff are returning to our buildings and as we prepare ultimately to reopen schools to students. So on behalf of the board, I'd like to thank all the employees in our facilities, maintenance, and operations department for their hard work and dedication to our schools. Congratulations to Savannah Kunkel, a Westminster High School student in the Masonry program at the Career and Technology Center. She received the Mortar Net Solutions Mason Apprentice Scholarship. Savannah's hard work was recognized by our instructor, Mike Campanile, who nominated her for the award. She received a $350 check towards her education and a tool bag filled with $1,000 worth of new tools. So congratulations, Savannah.
That's awesome.
I'd also like to congratulate Uchechi Umba, a 10th grade student at Century High School. You might have seen her in the newspaper recently. She was elected as a Maryland delegate to the 2020 World Food Prize Global Youth Institute for her exceptional research paper and video presentation on the fallout of political instability in South Sudan. The Global Youth Institute, hosted by the World Food Prize Foundation, brings together 200 outstanding high school youth from around the world to interact with international leaders and experts dealing with food security and agricultural science and policy. So congratulations, Uchechi, for this distinguished recognition. And finally, I'd like to share this evening, congratulations to Jenna Eamon. Many of you remember Jenna. We brought her on recently as our Carroll County Teacher of the Year. She's a reading specialist at Winfield Elementary School. She has been selected as one of 7 finalists for Maryland Teacher of the Year. Yeah, it's quite an accomplishment and worthy of that applause. I was with Jenna on the first day of school, so yesterday Miss Gaddis and I went over to Winfield to visit her and share that great news with her. Board members, I'll remind you, in the last 4 years, we've had a finalist for Maryland Teacher of the Year. That says volumes about the quality of educators we have here in Carroll County Public Schools. And she's in great company. You remember former finalists Tom McHugh, Tina Thoman, Brandy Jason, and now Jenna. So congratulations, Jenna. We're very proud of all your accomplishments. We wish you well as you go through the selection process for Maryland Teacher of the Year, which is a pretty rigorous process. Starting this weekend, we congratulated her and then said, oh, by the way, you're going to get grilled and interviewed all weekend long for this. Just what you want after the first week of school. But that process, we have no doubt she will shine in that. And the winner is announced during a Teacher of the Year gala on October 8th. 2020, and I believe that's a virtual gala. So we'll keep the board updated on that. And those are my comments this evening.
Thank you, Dr. Lockard. And Mr. Kyler, we have one recognition for the month?
He's ahead of us.
I apologize. I recognized our...
He did.
Oh, okay.
Yes.
You actually read it. Okay.
Yes, he did.
Our custodial maintenance personnel recognition.
Yep,
Yeah.
Gotcha. Okay. Sorry about that.
Sorry to steal anybody's thunder there.
Oh, no problem. No problem. Okay, then we can move on to section 5 for the presentations. And the one item that we have is the strategic plan pillar 1 update. Dr. Lockard, do you want to kick us off? And then I assume we'll be handing it over to Mr. Anderson after that.
Right, and team, the presentation here is our annual review of outcomes from the 2019-20 school year. That's a little bit modified due to the end of how March through the end of the year went, but Mr. Anderson and team is here to share some of the metrics and our progress and our next steps. Mr. Anderson and team.
Yeah, thank you, Dr. Locke, and good evening, board members again. It is September, and it is necessary that we continue to, through all that we've been dealing with over the past 5 to 6 months, we are going to try to refocus and bring our attention back to our CCPS strategic plan. Pillar number 1 is the presentation that is scheduled annually in the month of September and January. As Dr. Lockard said, the information that's going to be shared this evening is going to be a little bit different. It's going to be a little bit limited as we did not have any state assessments taking place last spring. Our students left us and became virtual in March. But what we are prepared to do this evening is to give you a little bit of an illustration on how our students were doing mid-year of last year in comparison to a longitudinal look over the past 3 years. And then also provide you some insight. We are able to provide you what we feel is very informative insight as it relates to our underrepresented student populations in the area of CTE, honors, and AP transcripted credit. With that said, this evening, Angie McCausland, our Director of Curriculum Instruction, Nick Shockney, our Director of Special Education, and Judy Jones, our Equity and Inclusion Officer, are here this evening to provide the presentation. So with that said, if we could have the presentation queued up, I will go ahead and turn it over to Ms. McCausland to go ahead and start the presentation. Thank you.
Thank you, Mr. Anderson. So Pillar 1 is providing multiple pathway opportunities for student success. There are 3 objectives within the Pillar 1 section. Objective 1.1, students exit CCPS college, career, and community ready. Objective 1.2, CCPS improves the proficiency level of students in ELA and mathematics. And Objective 1.3, CCPS provides access to a well-rounded, varied, and rigorous curriculum to all students. Brenda, if you could advance 2 slides, please. It should be titled Data Points. One more.
There you go.
Thank you. So the data points we will be looking at this evening are the comprehensive benchmark assessments and reading inventory at the end of grade 3, Algebra 1 for grade 8, and CTE, honors, and AP transcripted courses grades 9 through 12. Next slide, please. So the mid-year comprehension benchmark assessment data comparison for grade 3, and again, this is at the mid-year point. In 2018, 40.8% of students made the 80% or greater target at the mid-year point. In 2019, 37.3% of students made the 80% or greater target at the mid-year point. And in 2020, 47.8% of our students made the 80% or greater target at the mid-year point. CBA is given twice a year, November, December range, and March through April range. Upon returning to school, students will take their grade level CBA when they return physically. Teachers will use the data to group students and identify priority standards to teach. The mid-year CBA data is used to formatively inform next instructional priorities. And spring data is much higher than winter data. And we continue to see a rise in our mid-year data.
Ms. McCausland, the 47.81%, that was based on results that were in March, in February?
The November, December range.
Oh, that was November, December, okay.
Yes, for the 1920 school year.
Okay.
And what did we do to have such a wonderful jump? What did, from 37.3 in 2019 to 47.81? What did we do to make such a dramatic change?
I believe Miss Dale's on the line, and I would like her to jump in and talk about what work she's done with her staff.
Good evening, everyone. Good evening, board members. So the data, this is mid-year data. We typically report spring data, and obviously we didn't have that. The mid-year data for our comprehension benchmark assessment always is lower overall because we use it formatively. We can actually use it before the state assessment to guide instruction. The jump, we transitioned to an online assessment so that our students could really get that experience that they would be getting with the high stakes testing. So that 2019, you see a bit of a drop, and that is because 10 of our schools started taking the CBA online. So that is why I think we saw the drop initially. And then followed by everyone actually took the assessment online in 2020. So, I think the initial was the technology piece. And then I think we are just continuing to see big jumps because of A, the technology piece and our students getting used to the technology now, and B, because of our strong curriculum connection to this assessment.
And Ms. Dale, these aren't the same cohort of kids, right? I mean, these are the kids that were
Correct.
in third grade in 2018, and then it would be a different group of kids that's in third grade in 2019, right? So it's not following that cohort through. Every year it's a different group of kids.
Yeah, it was a different group of kids, but I just saw that 10 points was, I thought.
Right, that is very promising.
That was a big jump. And I know we've discussed before students not being able that do not have laptops, iPads at home to type on and to work with. So, okay, well, thank you.
And how do we, what is our plan? So normally the CBAs are done in the November, December timeframe, but we've said that we're going to try to do those as soon as possible at the beginning of this year so that we can see if our students have regressed at all. I guess we want to see how far off of the 47.81% we are, if at all.
Correct. So I think right now we're actually working on a newer platform. We're going to go ahead and try to use the PowerSchool platform, which is an online assessment as well. But it is going to be changing that. So we're in the process of working on that right now. I don't believe that we will immediately assess students when they come back. I think we're going to have to see how we come back. And we're also I would rather give it closer to the November, just because I think once we come back, we're going to need time to get acclimated into the classrooms. I feel that if we go to a hybrid situation in October, we could probably begin there, but we also have another thing happening right now with CBA, and that's putting it into another platform. So we have a couple of different factors right now that we're dealing with. We will give it, and really at that point, we will start looking at that data to see about COVID slide, to regroup our students, to see where we have missed our comprehension standards and our writing standards. Will really, once we get that data, we will be delving into it like we always do pretty deeply to see where our next teaching points are going to be and how we will be grouping our kids at that time.
Very interesting. The COVID slide, I guess that'll be in Webster's dictionary next.
Hey.
Well, we're hearing it a lot and for various reasons. And so, this
Sure.
will be a really good, temperature check for us.
Yep. Thank you.
You're welcome.
And so our next data point is reading inventory data, and it's the percentage of students who are reading on grade level as measured by local assessments by the end of grade 3. In 2018, 74.5% of our students fell within the winter grade level band. In 2019, 75.8% fell within the winter grade level band. And in 2020, 76.6% fell within the winter grade level band.
And Stephanie, can you go ahead and talk a little bit about how the reading inventory is done online and can be completed virtually when teachers are feeling it would be appropriate?
Yes, absolutely. That is one of the benefits of having RI for all of our students beginning in grade 2nd when they reach a certain reading level. And we are already planning for how we are going to deliver this assessment virtually. So we're not going to have to wait for this. We will be able to deliver it. We're going to develop a protocol so that teachers will be able to kind of monitor their students as they're doing it, probably in small groups. So that is one of the great things about this assessment, is that we will be able to get our data results, before we go back. And if I could just speak a little bit to what you see here is that we are steadily, and again, this is our mid-year. We are steadily, though, with mid and end-of-year data, steadily increasing a few percentage points each year, it seems. For the most part, that's the trend, which is also the trend that we see with our park data, which is why we can really say, and if you can see here too, this kind of gives you the green, where there's the green circle, that is the mid-year for 3rd grade, where we would want their Lexile to fall. And if you can see the row with the white to the right, you can see again that we kind of keep going up incrementally, which is the same thing that we see with our MCAP data, which is why we feel pretty confident that it also helps inform how they're going to do in our state assessment.
Well, I know this.
And board members also, I just want to commend the team in regards to, there's a strong linear relationship, as Stephanie's referring to the CBA and the RI and then the MCAP score. In fact, I think it's like a 0.7 value, which is almost unheard of. So there's been a ton of work in regards to our local assessments becoming pretty accurate indicators of how well kids are going to do on the high stakes state assessment. Again, we don't have that this year, but I think that we are in a good place to say that the students are progressing well. And also, as Ms. Dale has said, this really is we need to be commending our pre-K, our K, our grade 1 and grade 2 teachers as well for really preparing these kids to be coming into 3rd grade really strong. So, hats off to the content team.
Well, I will say that when Don and I first got on here, these scores were not like this. And Stephanie sat down there in front and got drilled. And I can remember that meeting very, very vivid, very clear. And this has been a big turnaround. And I think, Donna, you can agree to that. That
Absolutely.
was not the case 4 years ago. I guarantee you, yes. And you took it like a champ. And I don't know all what you do, but I will say that it has really turned around in the 4 years that you and I have been on this board.
Thank you, Marcia, and I would love to take this opportunity to put a plug in for my amazing ELA specialists and the amazing elementary teachers that honestly, tirelessly have worked since March 13th to pull all of this together, making classrooms, learning new tools, and it just could not be more proud of our ELA specialist group that makes this happen, and our teachers, and especially congrats to Jenna. I just want to say that publicly. We are thrilled to have one of ours I've had the privilege of watching her for a long time grow and rise as a professional, and there's no one better suited. So congratulations, Jenna, for your being a finalist for Maryland. That says a lot for our group.
Well, I do remember that night, and the scores weren't great, and we went through that night, and thank you again, because this is not what we saw 4 years ago, and I'm so happy.
And I think the comment that was made, certainly sharing, it just doesn't start in third grade. Not just, okay, right. What have they done in third grade? But it's really that back mapping and seeing that all along from K through third, that everybody has a piece in helping the kids be successful with reading.
We try to leave no stone unturned, and we begin in pre-K. So that's a huge reason for our success as a county.
Right, and that's what the intent of the strategic plan was, right? Was to try to identify, okay, grade 3 reading levels are one of the best indicators of future success, right? So that was the what we needed to really focus on from a results perspective, and then backward map from there. How do you best impact those scores? And I wanna thank you guys for going at this hard for several years now, and then the results are paying off. So thank you for all that effort. And let's just hope that the COVID slide, so once we start doing the testing early this year, I just want to make sure that we focus on the early indicators, right? Like we want to make sure that we catch those issues as quickly as possible so that we can figure out how to work with it and stop any further regression from happening. So
that's absolutely our plan.
And, it's something we shouldn't take lightly as well when you mentioned that it's all done electronically now. I think that's certainly a big plus as well.
Right. It really has been. It's prepared our students. I don't want to say just teach to the test, because those are the standards, but they really are at an advantage because they understand the tools, and that does not prohibit them from showing what they know with the content.
Yeah, because that wasn't always the case.
No. Yeah, and that's also hugely in part to all of the devices that we've been getting because of all of our efforts as a county, which has paid off immensely, I believe.
And interestingly enough, I mean, we know that for our farms kids, right, like the technology aspect of it was a little bit of a barrier for them in the past, but through the strange twist of fate, that's actually one of the issues that's going to be addressed very directly in this new virtual world. So,
yeah, that's a kind of an unintended positive consequence of this, which, yes, well said.
Look for the silver linings wherever we can find them, right?
That's absolutely correct.
Okay.
Thank you, Stephanie. Appreciate your time.
Sure.
We could go to focus area 2, please. Thank you. Percentage of students who participate and complete Algebra 1 by the end of grade 8, and the measure is credit and actually MCAP now. And we know that there was no MCAP this past year. But 27.5% of our 8th graders completed the course, completed Algebra 1 in 8th grade, and earned credit for that class. So we've already surpassed our 2021 target of 26%, and we're going to be coming back together to obviously change that target for 2021, but we're really happy with where we are there.
Right. Ms. McCausland, just previously it was that you had to take and complete Algebra 1 and pass the PARCC test. Since there weren't any PARCC tests or MCAPs, is that requirement, are those students who took Algebra 1 last year, or that would have taken it during 1920, do they at some point have to take the MCAP?
Ms. Swack, are you on?
I am, yes. Actually, no, there was a waiver passed by MSDE that says that those students have been waived from meeting that graduation requirement as long as they took the course and did indeed receive credit for the course they are waived from having to sit and take that Algebra 1 graduation requirement exam. They have met that requirement.
Okay.
So just to be clear, Mary, they won't have to sit for the exam when they get to high school then?
That is correct.
Thank you.
Okay, they have been granted credit for that particular course without having taken the...
That is correct.
Okay. My daughter will be very happy to hear that.
Board members, I just wanted to draw your attention also to the pretty impressive progression of students, not only enrolling, but also doing exceptionally well. And I do think that Ms. Swack has been behind that with her leadership. Mary, can you talk, the measure that we have up there of the actual 27.5, as President Savigny said, that did not include Park. Can you talk a little bit about historically, though, those students that pass the course are usually proficient, yes?
Yes. So I don't know that that number would look much different if we did have students taking the MCAP this past spring, because we have very high, close to 100%, if not 100% pass rate at the middle school level. This has been a multi-year effort in order to bring this number up. And a lot of credit goes to both the middle school teachers as well as the fifth grade elementary teachers. We have had a lot of meetings and have worked closely with Don Hicks, the math elementary supervisor, because in order to have students really ready to be successful in 8th grade Algebra 1, you have to back it up a few years to get them prepared to be able to experience that success. So that really starts for us in 5th grade. So we had held some meetings to make sure that we had a newly revised and consistent matrix of expectations of what characteristics we wanted those students to come into Algebra 1 in order to meet with success, because that Algebra 1 course in middle school and in high school is so critical to students meeting with success in subsequent high school math courses. So we are really pleased to be able to bring that number to 27.5, and we look to increase it even more, but we want to keep a close eye on it. We want to make sure that we are certainly stretching kids as much as we can and getting them ready, but making sure that we're not putting students in there who really aren't going to experience success and then have a real challenge when they get to high school.
That's well said.
I'm sorry. I was going to say, I know we've always looked at Algebra 1 as a gateway course. Do we have this broken down into subgroups by any chance?
I don't at the moment, but that's something we could certainly look at doing.
Absolutely. And Mary, I was just going to say that's part of some of the reports that we can now run through our new data dashboard. Once we get that data in there, we can begin to disaggregate that data, Dr. Dorsey, as we did a brief overview. I believe in the next month or two, we're supposed to do a data dashboard update. And that could be something that we look at illustrating, actually, to give an example of what that may look like.
Absolutely.
Okay, good.
Okay. Thank you, Mary. And I should mention Mary is our secondary math supervisor. Thank you very much for your input, Mary. Our next slide is focus area 3. Participation of underrepresented student groups in high school, career and technology education programs, honors courses, and advanced and AP transcripted courses. This slide looks a little blurry. Maybe it's just me. Next slide, that's fine. Thank you. So for CTE, we're looking at each underrepresented student group within 1% of the overall high school population. For honors, the strategic plan outlines farm students enrolled in honors courses within 3% of the overall high school population. And for AP transcripted, it's farm students enrolled in AP transcripted courses within 6% of the overall high school population. You can see that we continue to do well. We still have work to do in special education as well as in our free and reduced meals section for CTE. And I don't know, Judy and Nick, did you all want to talk a little bit about what we're doing as far as our academies and what we're doing in special ed to work with our students?
Sure. Just good evening, board members. Just a quick overview for our students with disabilities in these three groups. And obviously there's still more work that needs to be done. For our students and their participation in CTE, what we know is that the importance of narrowing that gap for the student and the areas that we're addressing in the IEP early as possible. The big piece is also for this is transition planning. If we know a student wants to participate in a CTE program, we've really worked a backwards map to build capacity even into the middle school level. We've done a lot of training and professional development with our department chairs, our team leaders, and our teachers, but there is more work that needs to be done there for sure. And then the other big piece is it is just that work that we're doing around equity and understanding how to better support our students with disabilities across the board so our students are better able to access not only CTE, but advanced coursework as well.
Good evening, Dr. Lockhart and board members. I would like to state that I feel the improvements that we're seeing with our underserved students, particularly if we're looking at our Black students and our Hispanic students. I'm glad to see the progress of those numbers have increased, the percentage taking advantage and being able to take part in a rigorous and well-rounded curriculum. I'd like to say I believe the Performance Academy is having a great impact on the numbers that we are seeing before us. If you recall, we had several Performance Academies in which we had teams on every level, elementary, middle school, and high, that comprised of teams of an administrator, our special ed support team, our ESOL support team, equity liaisons, as well as advanced placement. And the whole goal of the Performance Academy was to change numbers into names. Who are our students that we're missing? Who do we need to be equity advocates for? And that was the premise for the whole Performance Academy, giving opportunity for our school teams to come together, to look at data, to see what it's showing in our underserved populations, looking at numbers, but understanding that test scores is just a small part of the story, but what are the other factors that we need to bring together? Also, Mr. Anderson and myself had an opportunity. We set up several community members with our families of color, sharing data with them, sharing insights with them, and making them aware of the educational opportunities that we have with Carroll Community College, as well as within our own career and tech program and CCPS as a whole. And so you find out that many parents are aware, but sometimes there's that miscommunication and connection. And connection is the key. So there's been big strides in making sure that we connect with our families so that they're aware again of how to advocate for their student and the conversations that they need to have and with their school counselors. And then lastly, I would like to state that the student voice was also very key. As you all know, that we had taken a student voice, we had the results done in which we surveyed our students on a high school level, just focusing, and one of them was on curriculum and access to a well-rounded curriculum. And we were able to take those results and embed it into our cultural proficiency and equity training through this past year. And it brought about a great level of awareness in which we were able to share some of the challenges that our students of color felt that they were experiencing regarding having access to this well-rounded curriculum. And so this included extensive training with our admin, content areas, supervisors, as well as our school counselors. And so just opening up the dialogue, I believe, has really put a microscope on how we need to advocate and educate our families about the opportunities that our students need to take. So we're excited about that, and excited also about continuing the Performance Academy. As things begin to settle down a little bit, we can revamp and move back to that whole premise.
And I want to thank Judy and Nick, because we've been working really closely together to really communicate what opportunities are available to students, not only to the students themselves within the schools, but also to families. And we really want to expand those offerings. We want to make the connections between career and those honors and AP courses, and really champion kids, that all kids have the opportunity to do it and can do it, and should be encouraged to do to get involved in those courses and those programs. So that's been really exciting. COVID has slowed us down a little bit, but we're back on track and moving forward to really talk about creating additional opportunities for our students, all students, pre-K through 12.
And Angie, I was just wondering, in the focus area 3 in the slide where we talk about participation of underrepresented student groups, can we identify in that focus area who the underrepresented student groups are, so that if I would just see this slide without seeing the table below, I would know who our underrepresented student groups are?
Yeah, Dr. Dorsey, that's a great point. And it's something that it goes back to the strategic plan and how it's illustrated right now, but that is something certainly that we could include when we go to make our annual revisions of the next iteration. So it's a great point.
Thanks.
Yeah, I agree with that as well. I wanted to ask about, that there are, when we're looking at the disaggregated data, we've been talking about, minority groups and underrepresented groups. And we've had the discussion many, many times that we want to use similar breakouts so that we can track all the different groups, right? So kind of how things are defined and broken out at the state level in a lot of ways. So it would include, Asians and the other category, right? So I think that it would make sense that anytime we show this kind of data, that we want to show all those groups so that we're looking at the whole picture. We want to be consistent.
That's
yeah.
agreed. And that's
Agreed.
something.
Yeah, Asians aren't there.
Yeah, we would go back to our strategic plan and just update that, which we've done before with other goals. We're going to have to anyway with algebra. We're going to have to anyway with other measures where we've already surpassed them. So we certainly can look at how we can disaggregate the data and illustrate it more comprehensively.
Where is
And that has been an ongoing conversation on our floor over the past year.
Right.
where is biracial or two or more races in this? Do they get slid into one group or the other, or?
So, Mr. Kyler, that is a state reporting measure now. I believe when the strategic plan was developed, that wasn't one of the demographics that we were looking at, or the board was looking at when they created their plan. But as I've mentioned, we can certainly pull that data as well from our system and illustrate that also in the dashboard.
Good point, both of them.
Okay, thank you. Next slide. So our focus area 4 is to improve the percentage of students scoring proficient or higher on the Maryland Comprehensive Assessment Program, English, Language Arts, and Mathematics grades 3 through 11 for each of the following student groups: white, minority, non-farms, farms, non-special education, special education. And since testing did not take place in school year 2020, we're going to look at bringing that back to the board in January of 21.
And again, if we can break the word minority down and indicate the groups we're referring to.
Sure. Thank you, Dr. Dorsey.
And so when we do that review, we'll be comparing against, I guess, Park from the 19 school year. Is that?
Yes.
A reasonable?
That's correct.
Okay.
Okay. Next slide, please. So our next steps are to bring back updates on MCAP and access and completion of a well-rounded curriculum to the board in January. And also we'll be working to review the strategic plan and make modifications and updates as suggested by the board this evening. Thank you very much.
Thank you, Angie, and thank you, Nick, and thank you, Judy. Board members, I just want to reiterate, there's a lot of questions in regards to why are we seeing the progress. Obviously, this is the fruit of many years of labor, but also I do believe also what you're starting to see is not only a change, and it's not always an issue of cognition. It's really an effectual issue, and folks are excited, just as you've illustrated the first couple of days of school. Folks are excited about the opportunities that are being provided them. Yes, they're challenging. Yes, they're not the most ideal. But I think also that our staff, our teachers, our students, that's how we're going to change performance when we get to a certain point, is to continue to accentuate the positive, get people excited about what they're doing. And I think we're going to continue to see that growth. So I just want to thank the team again for outstanding presentation and putting it all together for you this evening. Thank you very much.
Thank you. We really appreciate it. A lot of great news to share there and a lot of work in front of us. So roll up our sleeves and, as you said, get excited about that work. So thank you.
Right. And it's good to see some of the good news, right? Like we had a lot of plans that were going to start kicking in the summer of 2020, and we weren't able to execute on many of those. So it's good to see some good news that we can build off of that and not lose them, try not to lose that momentum going forward. So thank you everyone for those results. Okay, and with that, we can move on to section 6, which are the reports. And the first item is the construction report. Dr. Lockard.
Thank you, President Savigny. So this is our monthly construction report. There are no major issues or updates. The Career Tech, Ms. Savigny, you were out by Westminster High School in the Career Tech Center, so you saw that project is progressing. We're working with Ms. Gaddis and the county and coordinating a groundbreaking ceremony. I think you might have even received a hold the date or an invite to that.
Mm-hmm.
And there are some important updates on the East Middle replacement project, but those are coming up as a separate action item a little bit later on in the agenda. So for the construction report, Mr. Marks, as always, is here to take any questions you might have on this month's construction report.
Board members?
There he is. Hi, Mr. Marks.
Hi, Mr. Marks.
How y'all doing tonight? Thank you.
I don't have any questions.
No problem.
So I did get a chance to see the beautiful science rooms at Westminster High, and the only outstanding item I think was the tabletops for the chemistry rooms, and that's because the supply chain basically got messed up with COVID-19. So, but we're expecting those to come in shortly, right?
Yes, they're due in September, and we're looking forward to getting them installed and getting those rooms buttoned up, finished.
Okay. And they are beautiful and extremely functional. And I know that I've met several of the staff members who are very excited to get into those rooms. So.
Good. We're happy for them. It's been a long time. We're glad to see them in good spirits in those rooms.
Right. And Mr. Marks, on the Moton parking lot issue, is that moving forward? Do we have any resolution from the county?
Not yet. We're looking forward to hearing a response from them. I know they have a workload, a large pile of projects in review, and I've been in touch with them, eagerly asking for any kind of update. I need some kind of news so that I can, figure a strategy here with the contractor. So I'm looking forward to hearing something from them, hopefully positive.
Okay. What was can you remind me how long we would have expected that project to last? Is that something that if we heard from them soon that we would be able to get done before a hybrid start, or?
No, this project would take a good summer length, a good 2.5 months to do. Okay. It's pretty involved out front with the what we're looking for with that expansive part of the parking lot. If it was just remilling or doing some paving, patching,
areas of the existing lot, we could do that in probably 3-4 weeks. With, sometimes we change curbs and do some light changes and improvements like that. But this one's a little more extensive. Okay. So we have stormwater management facilities to put in. We're improving access. We're improving drainage. We're improving lighting. It's much more involved.
Okay. So this is more than likely delayed until next summer.
It's getting there. I haven't given up hope yet.
Okay.
I'd like to, if I get some good news from the county, I'd like to work with the contractor and possibly do this in phases. Obviously, I can't disrupt the school. Safety's foremost, more than anything. Mr. Robbins there runs a great ship, and they have so many programs with the Judy Center. I don't want to get in anybody's way. So I would be in touch with them and go through some possibilities of something we can do. Maybe we'll be lucky and it won't get too cold too soon so that we can pour some concrete and asphalt. But it would be very disruptive, and I don't want to get in the way of operations with the school. So hopefully I'll find something out soon, and then we can come up with some kind of strategy to discuss with everybody.
Okay.
And we all know there's a great need for more parking spaces, Robert.
Yes, absolutely.
For need, absolutely. I totally agree with you.
Okay. Board members, any other questions on the construction report? No? Okay.
Thanks, Jim.
Thanks, Mr. Marks.
No problem.
All right, and we will move on to the report on the curriculum guide pilot programs for 2020-2021.
Right.
Dr. Lockhart.
For board members, this is an annual update on curriculum guide pilot programs, showing content areas where changes may have been made, revisions, additions, etc. So, Mr. Anderson, I think you and Ms. McCausland and other specialists are available. There's Ms. McCausland to review with the board.
Hi, good evening. So yes, we're excited about the curriculum guide pilots we have for the 2021 school year. To start off, we have in the mathematics area. We have technical math at the high school level. And this course is intended for students interested in pursuing a trade or 2-year college program. In health education, Ms. Tobias, if I could ask you please to come on, because there are some changes in curriculum for health at all 3 levels. Can you talk a little bit about your work that you've done since last spring?
Absolutely. Good evening, everybody. Just to talk a little bit about this as far as health education at the elementary, the middle, and the high school level, we have had a COMAR change, and that change is an opt-out instead of an opt-in. Ultimately, the reason at the state level was an equity issue. The state found that there were fewer permission slips for family life returned in lower income schools, and to be equitable and provide all students with equal opportunity, the change was suggested, and it was made official unanimously to make it an opt-out versus an opt-in. So currently we are working on an exclusion form that will be sent out at the elementary, the middle, and the high school level so that parents can understand the change, because we are a little worried that they might not understand the change. So we definitely wanted to address that and have effective communication about that change. We also are constantly updating materials in our substance abuse prevention, especially in the areas of vaping. We are working to get a grant this year also so that we can look at some of our elementary materials and also some of our high school. It seems in that category, as soon as we update, those things become dinosaurs because it's just changing so fast in the area of substance abuse prevention. So we constantly have people working with vaping, with nicotine. We also did a training for teachers, high school teachers, and a few middle school teachers back in March before COVID hit. And that change was for naloxone because we thought it was important to put this in under a first responder piece in our curriculum so that we could actually train every student in Carroll County Public Schools on a life-saving measure. And since we talk about first aid and we also talk about CPR, we thought it would be appropriate to also look at doing naloxone training for our students in Carroll County Public Schools. So some of the money came from a grant in order to purchase some materials that we would need for that. And that was through the Operation Command Center grant that we received. So hopefully we will be allowed to start doing naloxone training with our students. And also we have updates to do as far as marijuana goes, because as you know, there are a lot of differences with that curriculum than what have been done in the past with all of the new projects and products and legislation that's gone through. We had to really look at updating our marijuana curriculum. And once again, that's going to be a continual process because that is always changing as more information comes available. We also are looking at some family life additions and in as far as gender identity, gender expression, and sexual orientation to make sure that our curriculum is equitable for everybody in Carroll County Public Schools. And then nutrition, our focus is not villainizing foods anymore. The only one we're supposed to really villainize is sugary beverages. Other than that, we need to go under the model that all foods fit within moderation and really start talking about mindful eating and teaching kids when to identify their senses of being full versus their senses for being hungry. So once again, very important. And all of this is really to help us to make a well world, and it starts with our students. So basically that is, in a nutshell, some of the different changes we're going to be doing and trying to align with the new standards that were just approved in June. And once again, that will be an ongoing process to try to align with those standards.
Well, thank you for sharing this opt-out versus the opt-in, because when I first saw that, I thought, well, you know, I've gotten things before, and it's like, well, you were supposed to opt out if you didn't want it. Well, I didn't really understand it that way. So I don't know. I have some concerns with opting out instead of opting in.
Well, we've really worked with the language in that form, and I did provide 2 examples to the board. I'm not sure if they made it to you or not, but our hope was to try to make that clear to parents so that they understand that difference too.
Yeah, well, I have a problem with this.
Opting out
I do as well. I have
or at the beginning of the section on the family life?
I would think it would be most appropriate for them to do it just prior to that unit being taught. That way they have the comfort level with the teacher that they could ask questions for that. All of our teachers try to do that unit at the very end because we really think that we have to build that trust factor in with our teachers so the kids are comfortable with them. And once again, that starts also in communicating, you know, that change to parents and then giving them the opportunity that, you know, this paper did go home, that if you want to opt out of this section of our health curriculum, that is your right as a parent.
And Chris, you still, your teachers still host like a family life review night?
They do.
Prior to that unit as well, correct?
They do, and we're trying to figure out how that's going to look in our hybrid world. But yes, traditionally every school has a preview night for the materials for family life, and parents are welcome. That is advertised in school newsletters. A letter goes out from every teacher. Obviously, we'll be pushing things out in our virtual world also.
How well attended are those sessions now? I mean, I know there for a while when I was still in the system, the attendance had waned, I'll put it that way.
And I would say it depends school to school. I would say coming from an elementary background, I always had a lot of 4th grade parents come. And by 5th grade, I did not have as many parents come. Once again, just because you've built kind of up that trust with parents. But it is advertised to them that if they want to view those materials that they can.
And Ms. Tobias, I have the actual documentation that you provided, Ms. McCausland and I, that'd be more than happy to share with the board just so they can take a look at it. It is very much in a draft form right now, but we were just doing a once over of it before we provided it and disseminated it. So I'll be happy to share that.
Well,
Well,
go ahead,
yeah.
Donna.
Oh, I was just going to say, Dr. Dorsey, I want to thank you for bringing up the opt-out versus the opt-in. I actually have a significant problem with that. I actually did get the COMAR language and read through it, and I don't
Right.
think it requires that you have to use an opt-out process versus an opt-in. And in fact, it specifically says that the local school system has the authority to establish those policies and guidelines. So I think we want to discuss, like, it was done as an opt-in versus an opt-out for many years for a very specific reason. And I would like to discuss that, not just say, well, according to COMAR, like, this has to be changed. I think we need to talk about that because this like our parents in Carroll County are very engaged, right? And we're blessed from that perspective. It's a core strength of our community. And I feel like this weakens that, right? Like if what we're concerned about is, if you're required to opt in, then you don't get a response from some parents if those parents aren't engaged. Then I think instead of changing it so that, well, the default is just that you're in, I think change it to, like, this is an opportunity to go engage those parents who aren't engaged. I don't agree with the way that we're approaching this. So, and and Ms. Herbert, it sounded
Yes,
like
and
you
I
were
would
going to
agree
say something
because
similar.
I taught this class many moons ago, but it is so important for you as an educator to do an opt-in because you have more contact with those parents, number one, and we need to be transparent. And this is a sensitive subject, and we need to be contacting these parents instead of just doing an opt out and then no one knows what's going on. It needs to be opt in. I totally disagree with this, and especially after I taught this, I understand that it needs to be an opt in, not an opt out. And I did talk to an attorney about COMAR too, and it's exactly what it says in there. It does not say specifically that according to COMAR, it will now be. It does not state that at all. It's left up to the county school boards.
I can tell you as a parent,
Reading it, and as I spoke to our representative for health education for the MSDE, it is student opt-out. The local school system shall establish policies, guidelines, and/or procedures for student opt-out regarding instruction related to family life and human sexuality objectives. Now, it was also the effective date of this opt-out was in December of 2019, but it has an effective date of September 2020. So it is now valid for school year 2020 to 2021 as an opt-out according to COMAR.
Who voted on
Chris,
this?
let me ask a question. Rochelle, while we have you on the line, can you give us some insight in regards, it's very clear that the board wants to continue to maintain the opt-in piece, and we're here, we serve at the pleasure of the board. Is there any ramifications of us keeping our, because it does say in COMAR, and I don't have it in front of me, that the local school system creates the procedure and guidance. Is there anything that keeps us from keeping it an opt-in even though COMAR is saying opt-out?
I mean, and I do want to say, I did actually call Mr. O'Mealy about this before the meeting, because I apologize, Ms. Eisenberg. I thought Mr. O'Mealy was going to be here this evening, so I just wanted to give him a heads up about the potential conversation.
Right.
And he said that the intent, like there's a lot of history behind this, right? And that, it's not meant to be taking authority away from the local school board, right? Like, I think the way that this is meant, or well, you can interpret things however you want, but the fact that if you're in an opt-out situation, right, where the child will not be receiving that instruction, then you need to develop some sort of guidelines about what instruction that child will receive, right? Like what happens when that child has been opted out. Maybe
Right.
I'm misinterpreting it, but I think that you could very easily say that, okay, with an opt-in process, we need a response from parents.
Right. Yes, we need
right?
a contact.
So they either accept it, so they opt into it, or they opt out of it. But the default is not if you haven't heard from the parents, they're automatically in. The default is if you haven't heard from the parents, they're out. And then we need to reach out to the parents in order to try to engage them and get a response, right? But we need to require the parents to respond. Like, there's just way too much capability of this getting lost in the shuffle.
Right.
And you just assume that, like, if you haven't heard from somebody that they're in. Like, I just, this is very sensitive material, and we don't want to take that right away from the parents who may have just missed it.
Right.
Um,
And to me, this could also,
That's gone back, I'm sorry.
it's all right, go ahead, Mr. Anderson.
No, I was just going to say, so President Savini, you're right. It's gone back and forth, opt in, opt out, back and forth a number of times. And so, we serve at the pleasure of the board. I just want to know, and we can create our own guidelines and procedures. So I'm just wondering, is that permissible, Ms. Eisenberg, to go ahead and just, continue to conduct our business as we have, opt in, opt out? We want to make sure that our families are communicated with and are clear on what's being delivered in the classroom, is what I hear.
Yeah, you can continue. My concern always is some families just never respond. And so what does that mean?
And that's why it went back out.
Many.
Right.
Yeah.
Right.
Yeah, but those are the families that in the past we would sort of go after. I mean, just like with field trip permission slips, if you don't have all your permission slips, well, these are the parents we have to contact.
And Rochelle, yeah, okay. And Rochelle,
Exactly.
I taught this class, and I am telling you, if the parent didn't contact us or hand it back in, you were on the phone calling them. That was the educator's responsibility, because we are to serve every child in the way the parent wants to be done, and the opt out is not that way. It's
right. I think we should use this as an opportunity, right? Like, if we're not hearing back from those parents, we want to reach out to those parents.
Please. I'm just concerned. So there's certain things within COMAR that we follow, and there's certain things that we don't. This was up for public comment back in, I believe it was the fall, and they had 81 public comments in favor of it, and they only had one that was a negative or concern about it, and that was at the state level. So I guess I'm just concerned because COMAR is what we are supposed to be following. I just don't know if we should be able to pick and choose what we are able to follow as far as the Code of Maryland regulations.
So,
Well, there are some, I mean,
There
if I
are.
can just make a comment about how there are items in COMAR, like, so not for the family and human sexuality section, but for things like disease prevention, like, you can't opt out of those, right? Like, there are some things that they think were so important that they say that you can't opt out of that, right? They didn't say that about the family life and human sexuality piece. So there is a distinction in COMAR, right?
Yeah.
Between
Let me just
the
put it-
sensitivity level of those materials and what, right?
Yeah, just so I understand, it's very clear the board is saying, listen, this could get lost in the shuffle. This is very sensitive material and content. We want to make sure parents are privy to what is being taught. We feel if it's opt-out, people will miss it. And if that's the case, then students would receive instruction that some families might have a hard time with. That's what I understand. I have that correct so far. I think the reason, going back to what Ms. Tobias had said, I think the reason why the state went this direction is because, yes, in Carroll County, we are very fortunate to be able to call the small number at times of families that we don't hear from. I think in other systems that may not be the case, and there's larger groups of student populations that are going without the content because they can't call all the parents. And I think that's where it came from as far as the equity issue. Chris, correct me if I'm wrong, but I think that's where.
No, it was for equal opportunity because they found out that kids were missing vital information that they really needed to make a wise decision.
Right.
And they did not have that equal opportunity because the parents were not signing the permission slips and they were not returning them in. So it was an equity issue.
Okay.
Yes.
So I just want to know, as the chief of academics, if we can get some counsel in regards to, it sounds like is it permissible for us to continue to create our own guidelines that would run along the lines of opt out or opt in? We need to hear from our families moving forward. Rochelle, can you give us some insight? I think
as we're talking, I'm trying to look up COMAR. Can I give you some insight later? Give me a chance to look at this. Off the top of my head, I cannot give you good advice.
Rochelle, I do believe it was COMAR 13A.0 418 and then 01D, but then I lost the last two. Because I've been on it too.
Yeah, you're right, Mrs. Herbert. It's D, and then it's E.
Yeah, because I looked it up, because I thought,
Right, and I think what it's, at least what I see here is that it's still trying to give the local school system the authority of how they're
Right.
going to go about this for the family life and human sexuality piece of it. And I feel that we need to continue to reach out to our families. You know, regardless, don't get lost in the nomenclature of whether it's an opt-in or an opt-out. We need a response from the parents. And in the cases that we're not receiving a response from the parents, we need to use that as an opportunity to reach out and engage those parents. I think that's a much better equity option than defaulting to, okay, well, they get it, right? Like regardless of what the parents might be, what the parents' desires might be.
If that would help you. I do have this document on my desktop, if that would help you.
Well,
So
here's
can
where
I-
I'm at right now. So
that document isn't going to help us. We have
I'm just here for the COMAR.
Let me jump in for 1 second here while we're looking. All right. So Chris's supervisor at MSD is telling her one thing and saying, here's what COMAR now requires. All health directors go, or curriculum specialists go make this change in your system. We're saying, no, we think that we're able to connect with everybody. Our expectation should be we should hear from everybody, which means you still have the opportunity to opt out or opt in.
Right.
You're still going to get both of those choices.
We need a response.
But we're requiring a response from everybody. And so, you know, if that's the expectation moving forward, and I'm assuming that's what we did previously, we tried to chase down everybody we could if we didn't hear from them to make sure we knew you were either
I did it. I lived it.
I imagine
for
there's
years.
probably a random circumstance where somebody tries and can't get a hold of a parent, but what we're saying is, no, we're going to make sure, because by and large our parents are responsive, so they're going to let us know. And for the handful of kids in my class that I haven't heard from, I'm going to send a reminder. I'm going to call them individually. I'm going to email them. I'm going to do all I
We have
can.
so many ways now to do that.
Now I've heard from everybody, and everybody's given the choice of opting out or opting in. And so in that regard, I feel like we'd meet the intent of whatever's being asked of us, because we're taking it 3 steps further and trying to contact everybody.
Right.
That's my
But in a
2
sense,
cents.
that is opt-in.
Right. And the only difference there, Dr. Lockard, respectfully, is that if you can't get a hold of a student's family, they can't take part in the content, hence the reason why COMAR was changed.
Here's I'm going to give it to you as a parent's perspective. And I heard from a couple parents regarding this. No one has the right to take control of your own child. And by not being allowed to check yes or no and giving someone permission to teach something to your child, you are losing your parental rights. That is how it was referred to me by a parent. When a parent says to me that, I sit there and go, well, I don't like that idea. You know, I mean, I don't want to lose my parental rights as a parent. I want to be able to have that option. Do I allow my child to do something or not? And if I didn't send the paper in and I get a reminder, oh, okay, I gotta send that in. To me, this also opens a floodgate. Because what if a parent doesn't want their child to go on a field trip? And let's just say that's what they start doing. They start changing all this. And then, you know, well, everybody goes on the field trip. Well, what if a parent didn't want a child to go on a field trip and now you have a missing child situation?
Well, but COMAR's not mandating that
No, but
if you
I'm
don't
saying-
return your permission slip, you go on the field. You know what I'm saying?
Right, but I'm saying this could open the floodgates to things like this.
But I guess the question is COMAR mandating this?
Right.
If the COMAR section starts out saying it's up to the local jurisdiction, then they're not
Absolutely.
mandating it.
Yes.
And back to the question, we follow COMAR when it mandates stuff. When it gives an option, obviously we don't have to.
Right, we're going to lay out a procedure that says we are requiring parents to make a declaration, right? Like we need a response from every parent. It's either yes, I want them in, or no, I want them out. And the default is that they're out unless we hear from them. But we're going to set up the procedures of this is how we're going to reach out to parents. This is how we're going to engage with them to make sure that we get that response.
'cause-
Just like we got a parent, we reached out to try to get a parent response on all the intent forms. It's the same sort of process. So
I guess I'm just concerned because I'm reading the language, and the language says student opt-out. The local school system shall establish policies, guidelines, and/or procedures for student opt-out regarding instruction related to family life and human sexuality objectives.
Right, so we can say that our opt-out procedure is that we need a response from every parent.
Yeah, because because it defeats the whole purpose, because we need to make that contact with that parent, because this is sensitive information. And if you only do the opt-out, then these children are in here that maybe parents don't want them. And I have taught kids that have been taken out of that class because the parents don't want them to have it. So.
Right, and Ed
that's-
was giving me
that's-
some examples
Yes, I
of,
can give you
why this
examples
was
of that.
done in the
So-
past with some things that came up with Dr. Ecker years ago.
Mm-hmm.
And there's a reason why it was an opt-in for our community. And, you see some crazy things on the news with some other counties around Maryland of things that the kids are being taught and the parents are saying, oh my gosh, what is going on? Like, I did not want my child learning
In that class.
And so it's very sensitive information that the parents need the ability to say yes or no, and we need a response from them.
The ultimate question was whether you can do opt-in or opt-out, and the answer is you can do whatever you want, because you make the procedures.
Thank you.
Right.
Well,
Okay.
I wanted opt-in.
Thank you, Rochelle.
You're welcome.
So board members, we'll be working on that. In addition to, I know Chris has done a lot of work in engaging a number of additional family members to serve on that committee. So we'll be working on that, on those guidelines to make sure that we are not only in compliance, but meeting the standard that the board would like to see.
Okay, and I do appreciate that. I know that we
Thank
wanted to reinstitute the Family Life Committee. We had talked at the last meeting about maybe having a discussion about that at this meeting. Doesn't sound like that's going to happen in any great length, like a recommendation, but I just want to make sure that we're reaching out to the schools, to increase parent representation on that committee.
We definitely need to increase that parent commitment to that committee.
So Chris, do you want to share a little bit about what you've done since the last time we met?
Absolutely. So the committee, I believe now, I forwarded a new list to you. If I remember correctly, it's about 18 members, and about half of those, I believe 10 out of the 18 are parents of Carroll County Public Schools students. Some of them also double because they might be a school counselor and they might be a parent. We also have community representation. I had 4 more parents review the different curriculum that was up, the materials, the textbooks, because that's what was requested. I was requested to get 2 more elementary, 2 more middle school, and 2 high school parents to review that. So I have gotten that for those 3 materials that were up for textbook review. And then I also have the new representation list for the Family Life Committee. And like I said, it is 18 members, and I'm only looking for right now a student representative, because I think that's important, and our student representative from last year graduated, so I now need a new student representative.
Okay. And I appreciate that a lot of work is going on with that. Like, I thought that we were going to kind of talk about the history of that committee and how we wanted to do it going forward, rather than it just kind of happening. I thought that's what we had said, that we were going to talk at this meeting about possibilities moving forward. But I recognize that we have good community representation from the fact that it's, healthcare professionals and things like that, but it really needs to, I don't necessarily want it to be people that are, it's all healthcare professionals that happen to be parents, right? Like, I think that we want kind of a good representation across our schools, similar to the curriculum council, right? Where we reach out to the schools and get parents involved who are interested in these topics.
I think a number of the members that we're referring to are on the curriculum council. Is that accurate, Christine?
That is accurate. That's why I was raising my hand. Yes. A lot of the parents that were asked to be on this are also parents that are on curriculum council.
Okay.
And the list was provided, so it does show whether they're curriculum council, whether they are a teacher, because I also added some teachers on there also. A representative from the elementary school curriculum, one from the middle school curriculum, and 2 from the high school curriculum.
Okay, Ms. Tobias, we don't
Like I
have,
said,
wait, you're saying that it was provided, we haven't seen anything.
No, we don't have it.
Okay, well, I did send it in, so I can send it to you this week if you like also. I don't know how you want to receive that, whether it's just a personal email or not, but it was sent to be shared with you guys.
So, board members, thanks, Chris. Board members, I believe I'm hearing you say you're interested in, I think it states that we are required to have a local stakeholder group, correct, for family life materials review, family life committee. And so I think I'm hearing the board say you'd like to have some conversation around what should the makeup of that group be. If we have the opportunity to do that, what should that be and how should that look? Chris, I appreciate you soliciting and reaching out to folks. I think the board was also intending to give some input, like, okay, I think we'd like this many members from this sector of the community and this many parents who aren't employees but just parents of different age level kids, and maybe this set of professionals. If that's what the board wanted to do, then let's talk about that. And then I'm sure there are people on that list that we could draw from, but there's probably others that you would like to incorporate.
Good idea. Dr. Lockhart?
Okay. No, I appreciate that. I mean, I think that's what we were kind of thinking of as the intent from the last meeting, that we had said we were going to bring it back to the September meeting and kind of talk about the history of that committee, how and why it evolved, and what we wanted the makeup of it to look like going forward. So,
May I ask another question? Currently, I do have, like I said, 18 people on this list, and I can share that with you. Can this get pushed soon on the agenda? Just because if it keeps getting pushed to another meeting and pushed back, then we aren't going to get anything accomplished as a Family Life Committee this year. So I really think it needs to be a priority.
oh, I agree that it needs to be a priority. We actually had requested the discussion for this meeting, so well, I guess we can talk about it in October and then move on as quickly as possible. I think that it absolutely needs to be a priority.
Absolutely.
In fact, we had asked about that at the last meeting, about whether pushing that discussion to September was going to cause any problems with timing, and we were told that it wasn't.
So can we get it on there then?
So I mean,
For
just to make sure that we're all on the same page, do we need to call for a vote on the opt-in versus the opt-out? It sounds like most, if not, well, I guess that what we say, look, we want to stay with an opt-in process. We can allow, or that we need don't even want to call it an opt-in. Let's call it a response from all process.
Yeah. Yes or no?
Just so that there's no confusion, to say, okay, if we hear that was not the intent, then we can have further discussion. But I'd like to make a motion that for the Family Life and Human Sexuality, that it remain with the current process, and that we require that we get a response from all parents, and that we will develop, or we will make sure that we have a formalized process of how we reach out to the parents that we're not getting responses from.
I second that.
Okay.
But by saying the process, you're saying keep it an opt-in.
Essentially, what I don't want to do is get lost in the technical view of the results. Like we're creating a a process where we need a
Well,
response.
I
from
don't
a
want it to
parent.
be an opt-out, but every parent has to reply.
Right, so we'll leave it as an opt-in process.
Yep. Guess we got a vote or more discussion.
Okay, so are there any other things that folks want to talk about with that? Okay, so with that, I'll call for the vote on the opt-in process. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Any opposed? Okay, thank you. That passes unanimously, everyone.
Ms. Tobias, I do want to thank you regarding the naloxone training. That is something that is extremely near and dear to my heart, and I have been advocating for quite some time to get our high schoolers naloxone trained, not just because of an opiate overdose regarding addiction, but even the potential of the possible accidental overdose. And I'm just incredibly glad to see that moving forward. And I thank you for that one.
I think it's important too. Thank you.
So, Chris, if we have in October conversation about who the board is interested in establishing, how the board is interested in establishing a family life committee, and the general slots, if you will, with like this many, like I said before, this many parents who are just parents, not staff members, this many staff members, this many health professionals, this many community members, whatever it is, and then we go forth. Does that give you enough time to get things done?
I fear that it will not.
Okay. Is that something we could bring to the September 23rd update meeting as?
That's what I was going to ask. Can it be brought in 2 weeks to save time? And it sounds like you thought we saw stuff that we just haven't seen, so I apologize for that.
I did. And at the last meeting, I do remember asking how many more parents you would like to have on that committee. And I do remember Tara saying 2 elementary, 2 middle school, 2 high school. So I have that, but I also have beyond that, is what I'm saying.
Yep.
Right, I mean, I think that was just and Ms. Pataglia, you had thrown that out as a suggestion, and then we said, okay, well, let's talk about it. Let's have a discussion about it next month, so. Understood. So, okay, so we can, is that okay if we include it on the September 23rd agenda? And we'll move from
It
there?
is, I guess my only, once again, I just have a concern that it's delayed. You're talking about the quarter classes ending the end of October, beginning of November. So we're not going to meet until September the 23rd. So I'm just voicing a concern that I have.
There's no doubt the time's going to be tight, but I think that's the earliest we can convene and have that discussion. So we'll do our best, and we'll support Chris as much as possible to make this happen. Chris.
All right, thank you.
Thanks, folks. Okay, I think we still had a couple of additional pieces. Ms. McCausland, did we want to do the library, media, and world languages?
Yeah, so the other 2 areas, we updated digital citizenship lessons for grades K through 5, incorporating lessons and activities in alignment with the American Association of School Librarian Standards and Maryland School Library and Media Standards. And then for world languages at the high school level, we're going to pilot an honors Spanish for native speakers course, which is intended for students who are native or heritage speakers of Spanish who have a strong foundation in the language.
So just for the Spanish class, how will it fit into the progression of Spanish classes throughout high school, like Spanish 1, 2, 3?
Sure, that's a great question, Devanshi. Ms. Pritchett? Ms. Pritchett's our world language assistant supervisor, can answer that question for you.
Hi, good evening. So it's actually the start of a pathway for native speakers. And we currently don't have a pathway that's available for our native speakers. The courses that we teach that are Spanish courses are intended for people learning it as a second language. So this is the start of that progression that I would like to eventually have one for each grade level for 9th through 12th. But this would be the start, and since it's an honors class, The students, anybody 9th through 12th grade could take the course, and then the following course that they would take as a secondary credit would be an AP course after that, since it's honors. But eventually the intention would be that they would have an honors Spanish for native speakers for grade 9, 10, 11, and 12. Very similar to our English progression of courses, because it is intended for those who are already native speakers, so they'll be delving into literature and other AP related themes, and it's providing them with a well-rounded curriculum and a pathway that allows them to continue their studies of the language that they already know, rather than being lumped in with students who are learning it as a second language and do not already speak it.
Okay. So when it's piloted next year, those who take the class and then take AP Spanish afterwards?
They can do that as their second credit. Because we don't have the full pathway implemented as well, they could also take the class more than once, and the themes will change because they're based off the AP themes. We have 6 major AP themes, and then there are 27 sub-themes. So from semester to semester, if the same students would be in the course, then they would be able to alternate what types of themes they would do.
Okay, thank you.
Sure.
Thank you, Ms. Pritchett.
You're welcome.
Thank you. Okay, board members, any other questions on the curriculum guides? Okay.
No, but I think this last one, this world language piece, I think that is really acknowledging that, yes, we do have students whose native language is Spanish, and we should be accelerating them more. So again, I'm glad to see that addition.
Agreed. And again, we're looking at every possible opportunity to provide additional opportunities for all of our students in Carroll County Public Schools and expanding their opportunities.
Great.
Thank you.
Thanks so much, Ms. McCausland. Okay, so then we can move on to item 6C, report of the COVID-19 fiscal impact. Dr. Lockard.
Okay, board members, during this summer, we discussed that several updates that once we got here into the start of school in the fall, we'd begin reporting monthly on the fiscal impact of the pandemic. So we attached a report in your agenda packet. It's our attempt to summarize sort of these moving parts to demonstrate the significant expenditures associated with COVID-19. We also attempted to note the funding sources, and so as we move forward, this will of course grow and be updated. Obviously, it'll evolve depending on how long we operate under certain conditions, the type of experience that we have as we move to hybrid and ultimately, reopening. I'd also like to note this report is not meant to be in the finest granular detail, but it's sort of a thumbnail view, and that presentation can change as we move forward depending on your questions and your needs. For instance, we're not yet showing a large expenditure for cleaning and disinfecting supplies at the moment. We buy them anyway, so that at this point in the year we have not exceeded a budgeted amount. As time passes under specific conditions in the plan, it's very likely we'll need to report these items as we might exceed amounts budgeted for a typical year. Another example would be that there are items we're working in partnership with the county to apply for possible reimbursement, such as through FEMA or MEMA. And if we obtain those reimbursements, we'd begin to report that amount as well. So as a starting point, we wanted to offer this template, and I see Mr. Hartlove has appeared on the grid of staff members there. Thank you, Chris. And, he's going to provide a brief overview, and then we want to take your questions and any feedback on the topic or the format. Chris?
Good evening. Just to quick summary is these are all of the expenditures that were related to COVID-19 through August 27th, 2020, including expenditures that occurred back in fiscal 2020, so back in the spring as well. So it's cumulative up to date. The categories are just categories that I came up with, just as a way to kind of organize the spending to make it fit to one page. I kind of looked at things as instructional in nature, and then so that would be all of our computers and learning packets and those types of things. And then the plant operations and maintenance items, things that we're doing to ultimately have students and staff back in buildings. And then another category would just be food services, since that program was impacted fairly significantly. So that's really, kind of an overview. And then at the bottom, we have a total of $6,875,989. That's a total expenditures. And we so far have received dollars from the federal government through federal COVID funding of about a little less than 70% of those dollars. And as Superintendent said in the introduction, we're looking to increase those dollar amounts by applying for FEMA reimbursement for some of these dollars, as well as there's ongoing potential of other federal dollars going forward. So that's kind of a little overview. Certainly open to questions or any kind of suggestions as far as what you'd like to see going forward.
Chris, what are some of the items under other for food services?
Good question. I actually had asked that question and no one got back to me. I'll try to find out for you. I believe there's smaller items, and I'm saying this without having gotten the answer. I believe
Mrs. Sarno's hand going up.
Mrs. Sarno's there. I didn't realize.
Oh, there's. Hi, Miss Sarno.
Hello. Under that other are some mobile refrigerator units that I had to rent during our period of emergency feeding. I'm still renting a few. It's something that we normally would not rent just because we had high volume of meals going out at certain locations and some storage bags that we wouldn't have normally had.
Thanks.
Sure.
Chris, do we try to buy masks local, or are we buying them from somewhere else?
We're buying them all
over.
Whatever sources that we can find that are reliable sources, because I'm not on the front lines of this,
right?
But I talk to my purchasing folks. There's a lot of folks making a lot of promises that they can get you things quickly and inexpensively, but not everybody delivers. So we have, we're trying to find reliable providers who provide quality products and at the best price. That's what we're looking at. And we have a group of people that are doing this. The purchasing folks are working on it, as well as many of Mr. Prokop's folks are working on it as well to try to identify good vendors. I think when we do this across the board, all things being equal, we always prefer the local folks when we can do that. So when we can, we go local.
Okay, and then on the air filtration system, are they HEPA filters or what is that?
Probably be a good question for Mr. Prokop.
Yeah, they're a portable HEPA filter system. The filters are replaceable. They're small enough where they can be put in nurses' suites but moved around as necessary.
Okay, then and actually stay right there, right? Because I have a question, because I know too many people in Carroll County, and that's okay, but some of the secretaries contacted me and said and one sent me a picture, and I did see it yesterday, that those barriers, do they actually have to sit on the teacher's desk, or can there be another desk in front of that and put the barrier there? Because they lose about a foot of space where they're used to putting their computers, and everything has got to come off the desk. Does that make sense, what I'm saying? Because I saw they were like, it was a foot, the legs on it, on the plexiglass, whatever protection, there's a leg and a leg that you all are making, and then they lose that much on their desk.
We're not demanding that they be put on the desk. They just have to be placed in a way that will provide them
okay.
with the
Good.
with the barrier will work.
Okay.
The barrier will work properly if placed closely enough where someone standing
Right.
6 feet away can't, spray droplets on them. So if there's a desire to put a desk in front, I don't
Yeah,
know how
that
would
worked much better because then they didn't lose that foot of space where they had their computer and their everything, because they use those secretaries have inboxes and notes to give parents or release forms or pick up homework. And when you lose a foot, when you're that head secretary there and everybody stops in there, they lose that foot of space. So thank you for clarifying that they can do that. Thank you so much. That'll make them happy. It seems trivial, but it's not trivial because I saw it in action. If you have a desk and you lose a foot of space all out front, it's not good. So thanks. Appreciate that information. That'll make them happy.
Yeah, I think where people can be flexible, that would be key, because obviously the shields are there to protect them, right?
Absolutely, yes.
So we know it's going to be a little bit of inconvenience perhaps, but I think we can get creative and
Absolutely.
make sure that both things can
Yes,
continue
I
to
think
work.
that's great. Thank you. Yes. I mean, they need it, but it's for their protection, so.
And Chris, I want to thank you for this report. I think it's really helpful to kind of get an up-to-date set of reporting. I mean, these are the additional expenditures as of August 27th. We know that the PPE and the hand sanitizer and things like that, there's going to be additional, these totals are going to keep increasing, right?
Correct. And kind of the strange thing with a report like this is that there are things here that are truly things that we're only doing because of the pandemic. And that there are other things that we kind of do anyway. We always buy hand sanitizer.
Right.
So when we put that down on this list, it becomes a little difficult to say, okay, that hand sanitizer was for the COVID-19 pandemic. This other hand sanitizer was for our normal operations. So is this 100% a science of exactly what we've spent? No, because there are some things that kind of overlap. Computer devices, for instance. I mean, those computer devices will be in use long after the pandemic, so they're not just for the pandemic.
Right.
But we're right now saying the entire cost is going towards the pandemic, but we'll have many other uses of these computers after the pandemic is over.
And Chris, on the flip side, I mean, these were the additional expenditures due to the pandemic. We also had the savings in the spring, right, which was, fuel costs for the buses, the utilities and things not being utilized as heavily in the school buildings. Do we have an accounting of that as well? And is that what the source of because, we have local funding here at $2.145 million. Were the savings enough to cover that piece of it?
Last year we ended in a positive fashion, and the savings that we did see in those areas did cover the most significant item that we did not get a federal reimbursement for were the learning packets. So those dollars came out of the local dollars, but they were covered through savings in other areas, just as you had indicated. So far we're within our local budget, and we've covered most of these expenses through additional federal dollars. There's a lot of unknowns, as I think the superintendent mentioned going in. The hybrid environment is going to be an interesting for us from a spending perspective, because we're going to kind of be a foot in both worlds. So we're going to have expenses on both sides. But right now, I feel good about where we are. I feel good about the savings that we're getting, covering some of the additional expenses, and the fact that we're getting these federal dollars to cover a lot of the additional expenses is a good thing. We have staff that are really working hard to identify opportunities for grants and so on that we can utilize. It's been a very much a team effort in trying to get everything that we need, and do it in the most efficient, cost-effective way possible.
On your revenue, that you show the federal and then local, is any of that local possible state or county money, or is that Carroll County Public School money, period?
That's Carroll County Public School money.
Okay.
Now, some of that, as the superintendent said in his introduction, we are still putting in for FEMA reimbursements. So far, we haven't received any of those, but we're optimistic that we will get some reimbursement from FEMA. So those things that were bought out of local funding, some of that funding can be replaced with FEMA funding.
Thank you for this report.
Thanks very much, Chris.
You're welcome.
All right. And with that, we did check at 6:30 about the additional public participation for Section 7. I'm assuming there's still not anybody out there at the, okay. And then we can jump right to Section 8, action items. So board members, I need a motion for the approval of appointments.
So moved.
Moved by Ms. Battaglia,
I'll second that.
seconded by Dr. Dorsey. Okay, Dr. Lockard.
Thank you, board members. With a vacancy in assistant principalship at Francis Scott Key High School, I'm recommending Joshua Rudder for acting assistant principal at Francis Scott Key High School. Mr. Rudder has some familiarity with Key as a former teacher there and also a former acting assistant principal there, I believe, at one point. And so to fill the vacancy, I'm recommending him for your approval as acting assistant principal.
He's got big shoes to fill. We all will miss Mr. Winters. He did a wonderful job, but I've heard nothing but good about this.
Yep.
So, especially since he's been around.
Yep.
That's a good thing.
Great. Board members, any other questions or comments? No? Then I will call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? Passes unanimously. Thank you.
Great.
Okay. Board members, I need a motion for the approval of the personnel action items.
So moved.
Moved by Dr. Dorsey,
Second.
seconded by Ms. Battaglia. Dr. Lockard.
Okay, board members, this is the monthly personnel action items. The report includes 9 new hires, 1 rehire, retiree, 2 release from contract, 1 promotion, and 2 leaves of absence. This is more or less includes our majoring hiring for this school year, barring any large-scale circumstances associated with the pandemic. And so I bring this to you for your approval as detailed in the agenda packet.
Chantress, do we have all the positions filled pretty much?
So as a result of COVID, we have had some late minute resignations.
Okay.
So we are still in the process of hiring. We have about 4 positions to hire.
Okay. All right, thank
And
you.
that became effective last week.
Okay.
Okay. So 4 positions.
Yes.
Okay. All right.
And knowing all that instructional technology is involved with now, it's good to see a returnee coming in with the experience to help out in that area.
That is correct.
Very nice. Okay, board members, any other questions or comments? Okay, then I'll call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Any opposed? Passes unanimously. Thank you.
I did want to comment as well. It was good to see that promotion also going from the instructional assistant to a teacher.
Mm-hmm.
So congratulations.
That is great. Okay, board members, now we need a motion for the approval of the award of bids.
So moved.
Moved by Ms. Battaglia,
Second.
seconded by Mr. Kyler. Dr. Lockard.
Okay, board members, there are 3 items on the award of bids. The first is the award for construction management services for the East Middle School project. We discussed construction management services in detail when we were at this stage not too long ago with the Career and Tech Center project, so I'll refrain from a lengthy explanation. But just very quickly, for projects of this scale, we try to bring on a construction manager at this stage of the project. And the construction manager is with the project from design, bid, and construction. And I believe you saw with the Career Tech project through the bid and construction award how valuable that construction manager is to us. For construction management services, we follow the process which is outlined in our policy, supported by COMAR and the IAC regulations. We make the award based on a composite review of proposals, interviews, and pricing. The award is to Dustin Construction in the amount of $3,067,700. I think maybe I'll stop there since there's only 3 and we can have any conversation, and then I can keep going if that's okay.
Okay,
All right.
sure.
I think it's fantastic. You started with 15 and got it to 6 and then did this with very close prices. Have you guys worked with Dustin before? I know they just did something big in Baltimore, I think.
So I'm going to look to Ray or
I was
John.
gonna ask that question, Kenny, because I don't
No,
remember that name coming up.
I believe this will be the first for Dustin. If Jim's still on he can correct me if I'm wrong, but I believe this is the first time we worked with Dustin.
Okay.
Ray is correct. This is the first time with Dustin.
Jim agrees with Ray, and that's where we like it to be.
Yeah, yes. They've done a lot of schools, so like I say, you start with 15 and pare it down to this, and you've got some good names on this that didn't quite make it. So that's pretty good.
Yeah. The selection process can get tough when it gets down to the nitty-gritty.
Right. So they've done plenty of other projects, right? I mean, there's plenty of due diligence to be done out there. It's just that we've not worked with them in Carroll County.
Yes, experience is one of the criteria that's used.
Okay, so that goes into the algorithm of the technical points?
That goes into that's right. That goes into the technical points, but school experience in particular.
Yeah.
Excellent. Yeah, I mean, I just wanted to make the point. So the technical points, there's a pretty significant variance in the technical points. There's actually not significant variation in the bids, except for one of them, but there is a wide variation in the technical points. So I was just trying to understand. So you said it's primarily experience.
Yeah, they've done a lot of big schools. They're a good group, I think, but I've never seen them straight up either.
Right.
It's not unusual to have, when you have 4 or 5 people on a selection committee, the numbers can vary. It's all, a part of it's subjective in terms of the interviews and whatnot, and so some of that is going to be reflected in those numbers.
Right. And just so for folks that would ask, why didn't you go with low bidder? Like either they're qualified or they're not, and then you go with low bidder after that point. But it's because we've got a very specific algorithm that we've been using for the technical points, and that's consistent across all the major construction projects that we do. Is that correct?
For professional services, for the most part, it's very similar. I wouldn't say that all of our professional services are done exactly the same way, but the process that we have in regulation, this does follow that process.
Board members, any other questions on that one? Okay, so Dr. Lockhart, I think we can go on to number 2.
All right, number 2. The second item is one we discussed last month, and we said we'd bring it back once we had final official approval from our insurance claim. Deals with the damage that we suffered from the tornado last year at our maintenance depot. So we're returning the award for reconstruction of the pole barn at the maintenance depot, right there back behind West Middle School. As we discussed prior, we did solicit proposals for the pole barn, and the lowest was to Hanover Building Systems in the amount of $170,512. This full amount is covered by the insurance. With the intervening month, we also have had time to determine the best direction to reconstruct a second smaller shed that was severely damaged by the tornado. And as we reviewed the options, we believe it's best not to replace the smaller shed as it was, but rather add a little bit of additional square footage onto the larger pole. So this gives us the best use of the lot at the maintenance site and best protects our large equipment. So the amount after insurance adjustment is $19,865, which falls below the threshold for board approval. However, since we are bringing back the large pole barn anyway. In the interest of being completely transparent, we wanted to make sure you're aware and allow you to approve both projects in a total amount of $205,800. And so I'll stop there for questions, and I know John is available to explain that if anybody needs any additional information there.
Dr. Lockhart or John, can you help me understand? So it says that the total cost to make repairs, if approved, will be $236,651. How does that differ from the $205,800?
So what you're seeing is a few things here. You're seeing a very specific cost for the pole barn reconstruction, and that's, that was essentially a bid or submits for proposal. There was a lot of work that needed to be done at the site. There was a series of a period of time where there was a lot of demolition work. So that was all included as well in the insurance coverage. You're not seeing that demolition work. It had to happen, some of it right away within days, and then some of it over time. So when you add up everything that was done at that site and submitted to MABE, that full cost is the 230. See the number here, the 236,651. There's a couple of moving parts in there as well. There's a deductible, and I don't know if Ray knows that offhand or if Nancy Codner's on the call. I think the deductible is $10,000. All of that's in play. When you shake out all of those numbers, MABE is the insurer. They're reimbursing for the full property damage, everything, at $216,786. And so the full cost, these being the final two pieces to the full repair or replacement, is $236,651. That's the difference. That's the $19,865. And that's what Dr. Lockhart referenced in his notes. With the initial month that went by and talking to Ray and Mike Andrews out at maintenance, it seemed to me we had the time. We might as well show you all of that rather than have us approve the final piece of I have to keep flipping back and forth, 19,865, which we could have done under our policy and regs. But we thought we'd try to show you the whole thing. Maybe in hindsight, thinking about it now, we could have itemized out the demolition cost, but it would just be whatever the difference is if you break out the pole barn and the rest. Were there other costs there besides demolition, replacement of the large pole barn, and this additional square footage for the shed, Ray, that factors in MABE's reimbursement?
Well, yeah, if you take all the property damage also included, there were numerous work orders. We had staff come in the day after the tornado, for instance, that following weekend to clean up the site and take care of electrical issues. We had electrical contractor come in, do a little bit of work. There was also some repairs to a much smaller shed roof. So in total, that the entire what MABE was willing to assess for the total property damage was the $226,786 minus the $10,000 deductible, as John had mentioned. So that's what they felt the replacement, the damage was valued at. And then, as everyone else mentioned, we went to, instead of repairing the smaller shed, went with the expansion of the larger pole barn, which expands the usefulness immensely for our staff.
So what Ray referred to as work orders, in my mind, that was all demolition work. I understand the distinctions he's making, but all of that work from the beginning to now, we're actually pretty pleased with where the insurer came in, and for a difference of $19,800 or whatever the balance is, to get not only everything back up and running, but to really sort of make a slight improvement to the site. That's pretty positive for us. But we had the extra month, so we tried to. Ray and I discussed it. I discussed it with Dr. Lockhart, and we thought, why not just put it all here in front of you so you could see and talk about it, even though I recognize there was a risk of confusing you a little bit by adding that difference to it. But we thought we should do that since we had the extra month and we knew where we were going to go with the remaining square footage.
No, I think that made sense, John, and I really appreciate the transparency so that it's all laid out there. And I think a total cost of $19,000 with $10,000 of it being the deductible, I think that's a great outcome with basically an upgrade to the to the whole setup. So I appreciate that. Thank you.
Very much so. I don't know if Dr. Locker mentioned this, if I'm repeating, I'm sorry. I did query Ms. Codner and Mr. Andrews, who's the supervisor of facilities out there, and confirm that this is a company for the large pole barn that we've done business with, including a couple of projects in the last 5 years. I think Winners Mill and Francis Scott Key are two examples of where they've constructed sheds or pole barns for us. So we've had positive experience with them as well.
Anything else on that one? No? Okay.
Right. So the
Number
third item is a piggyback bid for 2 food service vans in the amount of $33,800. We've been moving in this direction of being able to provide more and more efficient delivery systems, services for satellite locations, and the past few months have certainly only accelerated our needs in that area. And this award supports the efforts of Ms. Sarno and her team to provide more efficient meal service throughout our system. And those are the 3 awarded bid items.
And this third one, so this is all part of the food services budget, correct?
Correct.
It's all built into Ms. Sarno's projections.
That is correct.
Okay. Great. Board members, any other questions on any of the 3 items? Okay. Then with that, I will call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Aye.
Any opposed? Passes unanimously. Thank you. Okay, now we need a motion for the approval of the schematic design for the East Middle School replacement project. Moved by Dr. Dorsey,
Second.
seconded by Ms. Battaglia. Dr. Lockard.
All right, board members, I'm recommending the approval of the schematic design for the East Middle School project. You'll recall from the Career and Tech project that after the board approves the award for architectural and engineering services, the schematic design approval is the first formal step for board approval in the design process. The construction committee has been hard at work with our architect to bring this milestone forward. I know that board members Mr. Kyler and Ms. Battaglia have been very active participants in the process. I want to thank both of them for their important role. And certainly this evening as we go, we'd love your input and your comments. Now, before we ask you to take action, we have Mr. Jeff Hagan and Mr. Prokop. Mr. Hagan's our architect from Horde, Copeland Mock. And of course, Mr. Prokop are going to briefly present the schematic design. So, Mr. Prokop, you want to kick it off?
Yes, thank you. I just wanted to, before Jeff came into the mix here for the presentation, I just wanted to take a minute to I guess, sort of ride the wave of some appreciation that's been shown this evening to some facilities folks, because there's a number of things coming your way. Earlier, Mr. Marks had talked about, in the construction report, and I want to, give him thanks for he and his staff, Ellen Becker and Miguel Agarte, for keeping their capital projects on schedule and everything in front of us in this time that we're all dealing with. Sometimes the normal, what's normal or typical for us, it's not as simple as they make it look. And I want to just take some time to make sure I recognize them. Mike Andrews and his staff, they've been swamped with COVID-related issues. And also, but they still have the time, of course, to put together the comprehensive maintenance plan, which is coming to you a little bit later this evening. And so staying on course, it's, this is all very important for them, for us as a system to be able to maintain these schedules and these reports. And of course, Bill Kane, who's a staff of one, is, working with the planning committee, who deserves a great deal of credit for, again, pushing through and maintaining the schedule as we need to have this project ready to work in the summer. So Bill also has the CIP coming to you later, the capital improvement plan. And so I just wanted to make sure there was some recognition there for the hard work these guys are doing behind the scenes in the background. So before Jeff actually, Jeff, if you could go ahead and start I guess Bob has the presentation.
Yes.
And you could go ahead and take it from there. And I was just going to mention that the schedule that I think is the first page of the report, or the presentation, the first page of the presentation, the schedule, which would be up in a minute. The next page, please. This schedule is much more like what we would see in a typical large project, a large capital project that we would do. As we noted many times during the career in tech process, it was out of sequence. We talked about that quite a bit, but you can see these are the major milestones. You might remember them from career in tech. And this is what we would look at as a typical process. It's not easy. As you can see, these milestone dates are very close together. There's quite a bit of work that still has to be done by Jeff and his crew for us to be able to have a project come next summer. Not the least of which, of course, is getting the state and local funding in order for that too. So, but these milestones, obviously, as we noted with Career in Tech, are give the board an opportunity to see at major development points, see and approve the project moving forward. And as Dr. Lockhart noted, Ms. Battaglia and Mr. Kyler have been part of the planning team, and I think they've got a real education about just how much detail and the level of commitment that I think Bill and Jim Marks and the others put into trying to make sure that we put together a building that serves the needs of the system for the long term. So with that, I'll turn it over to Jeff and let him go through the presentation.
Great, thanks, Ray, and good evening. Thank you, everybody, for inviting me in to speak to you tonight and to update you on where we are with the schematic design for East Middle. We've put actually, if you go to the next slide, if you don't mind, we've put a lot of work in over the last 2 months. We got started in July, and that has included 3 committee meetings. We have actually a 4th committee meeting tomorrow afternoon. We've had numerous meetings with CCPS staff, Principal Carver, the City of Westminster Planning Department, and our design team. And the culmination of those efforts is what I'd like to share with you tonight as we seek approval for our schematic design. Just to recap a little bit about the scope of the project, as you see here, this site plan is our existing East Middle School site. Dashed in yellow are the 2 existing structures, the main building on the left and then the best building on the right. And our scope of work is to construct approximately 125,000 square foot building on that parcel of land just north of our existing building there. We're showing the county track and field property just for reference. Our intent is not to go onto that parcel of land at this time, but we're just showing that for reference. And then just to orient you, the existing parking lot on the far left corner of the site has Longwell Avenue that wraps to the right side of that. I'm going to explain a little bit more detail about what we're proposing to do with Longwell as we get into our proposed plan. Once the new building is constructed, then the existing building will be demolished and the rest of that site will be developed to complete the project. If you go to the next slide, please. Thanks. So part of what we like to do when we start the schematic process is to have some visioning exercises with the stakeholders. And in this case, your planning and construction committee. And normally we would do this in person, and we would get a big whiteboard and we'd use sticky notes, and we'd ask everybody, what are your greatest hopes for this project? What are your goals for the project that you want to see accomplished when we open this building in a couple of years? And at the same time, what are your concerns? What about this site? What about this building that concerns you that we need to address as we design this? Well, knowing that we couldn't meet in person, we came up with a way to do this virtually, and I think it was pretty successful. What we found was a program called Miro, which was essentially a virtual whiteboard. And what it allowed everybody to do was access it at the same time and pull these sticky notes that you see over there on the left and make comments about what their hopes were for this project. And we took about 20 or 30 minutes to let everybody kind of independently do this. And then we got together and talked about it. And then post-meeting, we summarized all of these. There were a lot of common themes that were coming up each time. So if you go to the next slide, what we determined was 7 major goals, what we are calling our guiding principles, that we all agreed to at a subsequent meeting would be what we would focus on for the design of this project. So what does that mean? Well, whenever we are making design decisions as we go forward, from schematic through construction, we want to make sure that those decisions are adhering to these goals and these guiding principles. And I won't read all these tonight, but just a couple highlights that we heard, and you'll see this in the floor plans in a little bit. But the school would like the grade levels separated by floor and by team, and create some localized levels so that there is some separation between the grade levels. And I'll show you how we are accomplishing that in a moment. Certainly, traffic flow and patterns and such has been a huge topic on the design of this, and you'll see that in a minute when we talk about the site plan. And then we wanted this building to have a community focus. There's a lot of aspects, such as the gym, that get a lot of use after hours, and we want to make sure that we're providing an asset that the community can easily access and be a real important piece of this community going forward, as it is now. If you go to the next slide. Thank you. So that was exercise number one. Then we decided to do a vision exercise that we normally do with 3D printed blocks that are scaled components of the program and of the site elements that need to go onto the site. And we divided the committee into 3 groups, and we asked everybody to basically feel our pain of trying to put this puzzle together. It's a lot more complicated than you think. And so by letting people actually experience that and understand what the limitations are on a particular site, I think it really then generates some great ideas that you'll see reflected in really the final schematic design in a couple of slides. But just to understand what we did here was we provided this virtual site plan that you see here with the building outlined in dashed in yellow. And the one parameter was we cannot build the new building on top of the existing building because we need the existing building to remain operational while we build the new building. Other than that, it was kind of free reign. And what you see on the right in the multicolored pieces there, those are scaled representations of all of the pieces of the ed spec. The gymnasium in red, the cafeteria in purple, the blue are the academic pieces, et cetera. And then we also included a play field, parking, bus loop, hard play surfaces, and we asked everybody, come up with ideas of how you would lay out this site, how would you lay out this building, how would you access the parking, access the site, etc. So if you go to the next slide, I'm going to show you one example of one of the groups that they came up with, and that was this. So this was a snapshot right off the Miro virtual board, and you can see how the pieces were moved from the right and configured here on the left over top of the site. And our ultimate plan that we're presenting tonight, while not exactly like this, pulls a lot of the elements from this option and then elements from the other options that the other 2 groups came up with. So it creates a real understanding for us as we start to get into the design of what's important to this community, to this school, to the stakeholders that are deeply involved in this. And I think we get good results when we've done this in the past, and I felt really good about first time we had to do this virtually, but I felt like we really were able to pull that off, and it's been very helpful going forward. So if you move to the next slide, what that then led to, and I won't get into the details of these, but we just wanted to share with you that it's not that we jumped from that one previous slide to a final schematic. There's a lot of iterations that we go through, and these were options that we kept coming back to the committee with, and new ideas were generated, and they said, try this, let's try that, and we did that, and we came back with more options, and this is just a snapshot of some of those options that we test drove to see what worked, what didn't work, what were the pros, the cons, and those were discussed at our meetings. And then coming out of that, if you jump to the next slide, we are now at our proposed schematic site plan, and again, all of that information gathering that happened in these weekly meetings with all the stakeholders is what led us to this. So this is not something that we're just pulling from a file drawer. This is something that has the blood, sweat, and tears of everybody that's involved with this project, and that's what I enjoy. I love seeing that product of all of those ideas generated. So quickly, just to walk you through where we are, this is obviously going to evolve as we get into design development, our next phase, but in general, we'll talk a little bit about the site, and then I'm going to get into the building a little bit next. But site-wise, we're trying to access bus traffic to the site and car traffic to the site from different directions. That was we've talked with transportation. They've been involved with our meetings. It just seems to make sense. So what we're proposing right now is Tuck Road, bringing the buses off of Tuck in our service and lining them up along the front of the building. And the main entrances to the building are facing Key Street, where you see those buses lined up. And we've also provided the ability to separate the best buses from the regular ed buses, so that there's good traffic flow and in and out of the building and off and onto the buses. That was an important component that came out of our meetings. Then coming off of North Street, we're proposing the parking and the student drop-off loop. And you can see the little white dots there. Those are representing cars that are students being dropped off or parents queuing, waiting for their students to come out of school. So we think we've created some good separation there between car traffic and bus traffic. The main entry to the building, I should have pointed out first probably, is next to left of that green area. I wish I could point, but the green box in the lower right corner of the plan is the administration. So we have a main entry right to the left of that. The best suite is left of that, and then we have a secondary entry to the left of the best program, and that we're considering our after-hours entry, and has good access to the bus loop that can be used for after-hours parking. But what it primarily allows us to do is lock off the gym cafeteria section from the rest of the building. You see that corridor running north-south. The building to the right of that can be locked off, and then we can have community access to the big box spaces without having full run of the school on weekends and evenings. We also have really been taking a look at where we place the site elements to try to minimize overlapping that existing building footprint. And if you can see the outline of that building, it's very faint there, of the existing building coming off of Key Street. Our thought there was, if we can build the parking lot, for instance, over on that right side and that parent drop-off, we can construct that independent of demolition of the existing building. So that can be built along with the construction of the main building. And then when we are in that transition period between moving out of the existing and into the new, we'll have parking, we'll have drop-off. We won't have to create a lot of extra temporary measures. We'll be able to have it up and running and ready to go. The bus loop, on the other hand, will have a little bit of transition period, and we're working on strategies of how to bring buses on temporarily, but we're trying to minimize that extra cost of temporary construction to the greatest extent possible. And then another kind of neat fact that's come out of this, the parking area there where we're showing it is also where the CMs are proposing their staging area and their parking for their workers. So our thought there is, well, let's take advantage of that. If they're going to build that anyway for their purposes, then let's then upgrade it at the end with the final asphalt coating toppings, and then we won't have to build things twice, and that'll become our parking area. So we're trying to think about costs at every stage of this and making sure that we're making the best decisions and not doing things twice, which is sometimes has to be done on a phased occupied site, but we try to minimize it as much as we can. And then lastly, before we move on to the floor plans, the site topography on this site is a super challenge, as I'm sure you all know. It really drops dramatically from Key Street all the way back to that back property line. So not wanting to spend a ton of money on regrading the site, making it flat, that just would go to waste, we decided to make lemonade out of the lemons. And what can we do with this building to nestle it into the site and take advantage of that existing grade? And I think we've come up with a pretty successful solution for that, working through with everybody's input on this. So if we go to the next slide, I'll explain that a little bit more detail, what I mean by that. So you see 3 floor plans here, the main level in the lower right corner, and that is that is what we're calling our mid-level. And you'll come in that level for your main entry, your after-hours entry. That's where all the buses will drop off along the front, as I showed you. And everything to the left of that main entry is essentially 1 story or 1.5 stories for the gym. Everything to the right of that main entry is actually a 3-story piece, and that is what we've done there is we've taken advantage of that grade drop-off that happens to be on that corner of the site. So you'll go down to a lower level, as you see on the left, or you'll go up to an upper level, as you see on the upper right. And the thought there is we can separate the grades 6, 7, 8, no particular order, on each level. We don't have to do a lot of grading to make that work. As you approach the building, it'll look like a 2-story building. You'll just see a 3-story piece on that left or the right back wing. And then our media center will be up on that upper level above the admin. So as you enter the main building in that next to admin to the right, just to recap, best suite to the left. As you work your way down that hallway past best, you'll pass those yellow spaces. That's our art, our family and consumer science, health classroom, the technology education rooms. Pink areas are the music rooms, and then red is the gymnasium and athletic spaces, and then the light purple are cafeteria and kitchen. And then we're proposing a shared stage between the gym and the cafeteria, which you have at some of your other schools, so that you could have performances on either side depending on the size of your crowd. And then as I work over to that academic wing to the right, just to walk you through that briefly, we've got essentially a mirror image on all 3 levels of academic spaces. The only difference being on the upper level is the media center, and on the lower level, we don't have anything below admin because that's buried in the ground. This is very preliminary in terms of room adjacencies and such. We're actually having a conversation with the committee about that tomorrow, and then we're going to be getting into our quarter scale meetings. So rooms themselves are going to move and be tweaked, but the intent of the schematic plan is to show where the big pieces fall and how they relate to each other. And then we're going to get into the greater detail of how they all work together, where storage rooms go and where the classrooms exactly open onto each other and that type of thing as we get into this next design phase. Then if we go to our next slide, which is our last slide, just to talk a little bit about budget and our estimate. You see the budget column on the left there, and then we had a professional estimator on our team, and they did an estimate based on the schematic design that you saw tonight, and we're tracking right on budget at this time. They will stay with us, even though the CM is coming on board. They'll be doing their own estimate. We're going to have our estimator perform a DD estimate as well, and then we'll compare and reconcile the two. So we'll get a really good picture when we come back to you in November of how we're tracking from 2 independent sources. So I feel really good about where we stand as of today, and we'll keep you updated on that. And with that is all I had to share with you, but I'm glad to take any questions from you.
Can you flip back to the floor plans again?
Yeah.
Can you just share with everybody where the best program is and how it's it has some privacy, but it's also close to the other things it needs to be close to?
Yeah, no, it's a great question. So the best area is that light blue that's just to the left of the main entry. It's kind of nestled between the main entry and the secondary, the after hours entry. And Mr. Kelly's right. It's got its own privacy, but yet it's also open to the school. And we've also set it up so that as you come in that entry to the left, it has a direct entry right into their suite. So as the students come off their buses, they can go directly into their classroom areas and be right within their suite. Or they could come in the main doors, and there's entries into the suite coming off of the Main Street corridor. So we've given them options and as much flexibility as we can. But it's also got privacy. So I think we've kind of created both components, well there. Again, that layout will tweak a little bit, but in general, I think the concept is sound.
And where did we settle with the restroom placements?
Well, so we have restrooms, and they're a little hard to see in here, but each wing has its own restroom area. We haven't haven't discussed beyond that, but that'll be coming in the DD level in more detail, but we are showing restrooms kind of scattered through the building in optimal places.
Okay.
Did that answer the question, I hope?
I have, I'm on my phone, but I'm on Google because I couldn't see the map. So I'm looking, so the buses will come in off of Railroad Avenue, Route 27, is that how I'm looking at it? To come to Tuck Road? But as a parent or somebody picking up a child, you'll come in off of Center Street. And so the buses and the cars do not intermingle, am I correct, Jeff?
That's correct.
Okay, all right. I just wanted to make sure, because I was looking and I'm thinking, I was looking on the map and I thought, well, that's the way, then that's gotta be. Okay, thanks. I think that's smart to separate
I
it.
forgot to mention, I apologize, with Longwell, I was gonna bring this up and I think I jumped over it, but Longwell currently cuts through the site, as I mentioned in that first slide, next to your existing parking lot, in between the existing building. We're proposing to shift Longwell to the left side of that parking lot, and you see it here left of that play field in this image. We've talked to the city and they're on board initially with that idea, so that we won't have that circulation cutting through our site anymore, which we think will be better from a safety standpoint. It'll give us more usable space of the site and clean the site up a little bit better.
Okay, yeah, I was wondering about Longwell Avenue.
Yeah, I'm sorry I skipped over that, but I meant to
That's
bring that up.
that's why I got my Google map up, because I thought, how are we doing all that, and where's that road going? So, okay, thanks.
Sure.
Mr. Hagan, I appreciate you walking us through all of that. This is sort of a classic example of how the actual site kind of drives the end result of the product, right?
You're right. That is very well put. Yeah.
Because this particular design isn't going to match any of the others that we have for a middle school in the county, but so the ed specs match very closely, right? But the actual design layout, like architectural design, is very different than the other schools because of the site situation.
Right. Exactly. Although I will point out one similarity to Mount Airy Middle. If you could go back to the floor plans real quick. The academic wing layout that we're currently showing here is very similar to how Mount Airy's academic wings are laid out.
Okay.
Not exact, but very, very similar. And that was brought up by the committee as something that they liked. So, but your point's a really good one. The site drove a lot of these decisions, and but I think we've got a really successful layout in the works here.
And it's fun. It's not funny. It's ironic. And I think Mr. Carver's on here. The committee toured Mount Airy before they started this, and like you said, where the classes are is similar. But then the committee sat there and talked about hallway widths and lockers, and a lot of details went into laying out those academic areas. It was really interesting.
All right, and how about the facade and the marble steps? Were you able to incorporate any of that? Because I know the public has asked for some of that.
And that is actually next in the design development phase. That's where we get into that historic aspect of how we're going to honor the existing building.
Good, because my mother graduated from there, I graduated from there, and, there's a lot of people that,
Hey, Dr. Locker, didn't you graduate from there?
We have some ideas really.
Yes, Dr. Locker, yeah.
How old's that building?
We're going to involve the committee in that as we go forward.
Well, thank you, because I know a lot of people have asked me that. What are we doing? So, good, we'll be able to give them some answers.
Yep.
Thank you.
Absolutely.
That wasn't nice, Mr. Collar.
And so I was also very happy to see that the estimates are, at this stage of the game are very similar.
Yep.
They're coming in almost identical to the
Spot on.
original estimates. So it's on a good path.
Yeah, and we're tracking that very closely for certain.
Well, thank you very much.
Yeah, thank you. Thank you very much. I appreciate the time. It's nice to see everybody.
Yeah, yeah, in person.
Same here. It's nice to see you as well. It's been a little too long.
Yes, yes.
All right, board members, anything else on this project? Okay, and according to the timeline, we'll be seeing the next stage up for approval in November, correct?
Correct.
Okay, great. All right.
This is very exciting.
Yep.
It is very exciting. And there's no issues from a budget perspective, are there? I probably want to be asking that of Mr. O'Neill. With everything going on with the economy, and we're not concerned about funding for this project.
I'm not, in the sense that I think we still sit relative to where we were back in March when we discussed this with you and the commissioners. Now obviously a pandemic has happened, and that'll mean something at the state level, certainly, if not the local level, although that's not something we're really anticipating. Dr. Locker and I had an initial conversation with Mr. Zaleski, not about East Middle, but about just a very, very, very general talk about what the fiscal impacts might be broadly. And I certainly can't speak for Ted, but and I know he said he'd do some forecasting by the time he sits down with the commissioners, but you'd have to see really, really significant drops in local income tax for this building to be threatened within the commissioners, or your plan, your CIP plan with the commissioners. So unless and this is just me speaking, not Ted, but unless the pandemic's fiscal impact goes on and on very, 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 very deeply, I think we're fine in the local CIP window. At the state level, it's the same factors we talked about in March, plus whatever impact the pandemic does have on state revenues. Either House Bill 1 has to be passed again, or it has to become enacted by virtue of a General Assembly override of the governor's veto of the Kerwin bill. And one of those things, I think is very likely. And I think what I'm saying with Mr. Kyler and Ms. Herbert would agree, or consistent with what, for instance, Mabe is saying. And then it's a matter of when and how the state would fund it. Would they fund it through House Bill 1? How long would it take the Stadium Authority to work out their procedures and have the bonding money ready, or would they fund it through the traditional capital program? And from my perspective, and I get that this is my perspective and not any of yours, but from my perspective, the last thing we would want to do is change course or slow down or pause. We for all the same things we talked about in March, we still have those same considerations right now. We want the design as far along as possible. We want to be first in line at the state level. As you know, the counties recognize this already, so getting their recognition is no longer a question. But we want to be first in line at the state level, whether it's a House Bill 1 vehicle or a traditional capital CIP at the state vehicle. Whatever the funding vehicle is, we need to have design as far along as possible to say, hey, we're ready in Carroll for this project. So there certainly will be let's see what happens in this year's General Assembly. But even if it's a push out one fiscal year, President Savigny, I still think we need to continue the design to be there. Okay. I think I saw Mr. Kyler perhaps nodding.
Yep.
Hopefully in agreement, at least maybe that was reference to the Mabe comment.
And John, I've always said all along, I want to be first in line for East Middle, and I am not retracting that. I want to be first.
Nope, just making sure that we weren't seeing any surprises or issues developing. So appreciate that. All right, board members, with that, I'll call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Aye.
Any opposed? That passes unanimously. Thank you so much. All right, and now we need a motion for the approval of textbooks and instructional materials for 2020-2021.
So moved.
Moved by Ms. Battaglia,
Second.
second by Mr. Kyler. Dr. Lockard.
All right, I'll turn this over to, I guess it's Ms. McCausland, but this is a list of materials that was first given to the board back in a June meeting, and the remaining materials this evening are being presented for board approval. It's a list that textbook and instructional materials for 2020-21, and also provides comments from Curriculum Council as well as final voting results. Ms. McCausland?
Yes, thank you, Dr. Lockard. So typically we bring the whole list in June, but because of COVID and not having the last two meetings, we decided to bring forward those items that we absolutely had to have to start this school year in June, and the remaining list today to provide additional opportunity for curriculum council members who wanted to actually get hard copies of the books from central office. They could make arrangements to come in and get those books that they wanted to review to provide feedback. So that's why we're bringing it forward this evening.
Thanks. Board members, any questions?
Yes. I understand that this message is spot on from Born a Crime, but I want to tell you something. If I had my granddaughter come home and if I would read those last 3 or 4 sentences, that has no place in public education with the vulgarity on that one. I understand what it's saying, but can we find another book that can do that? The same message?
Ms. Dolan, are you on the call? Good evening. Yes, I'm here.
And I don't even want to repeat those sentences in the bottom. I will not repeat those sentences in the bottom. And I don't know. Am I off base on that?
No, I have similar concerns.
So if Mr. Weinhold and Ms. Dolan could talk about that particular item and what course it's for and how it's used.
Well, let me first say that the item was brought to us by staff that teach 11th grade, and there is currently an initiative in Carroll County to find ethnic writers to represent them more intensely in our curriculum for the benefit of students and staff as well. This particular work is really a series of vignettes. It's not a chronology. And so I think in the comments, in response to the Curriculum Council comment, the entire work would not have to be used in class, but specific portions of it could be used in terms of instruction. Beyond that, it fits with personal narrative and memoir, which is part of the 11th grade unit, and it serves as an example of engaging, interesting, and high-quality writing from an ethnic author. And I'll leave Ms. Doolin to add to that.
Yes, this book would be used in that module within the 11th grade curriculum. So it would be some of our older upperclassmen who would be using this text. And as Mr. Weinhold said, it would be used only in portions. So certainly that particular vignette, that chapter would be one that would be avoided. It is not meant to be read in its entirety. It's not even set up actually in that way as a text. We certainly, to get adult literature into the high school classroom, particularly for 11th and 12th graders, there are instances of language or mature themes or topics. Certainly we train our teachers to deal with that in the classroom, and we ask them to avoid sections of the text that are particularly troubling. That particular set of sentences would be a section of the text that we would avoid.
I just don't want it.
I mean, I guess I also have issues. So, I mean, there are certain sections, right, that were problematic, but then there's also statements here that, there's so many F-bombs in the text that you lose count of them. I don't argue about the subject matter at all. Like, I absolutely want to get this subject matter into the curriculum, but I feel like can we find something different that doesn't have all the vulgarity in it? I mean, we have rules of decorum for our teachers and our students in the classroom. Like, if they use this language in the classroom, there would be disciplinary actions taken either for the student or the teacher. So the fact that we would be endorsing it and promoting it and teaching it, like, I mean, I know that you can stay away from certain areas, but I'm not sure how you would do that in practice. I mean, we're endorsing the entire the entire book, right? As this is going to be used. So I guess I would hope that we could go find something different that doesn't have all the vulgarity and inappropriate content, but has the same subject matter.
Absolutely.
I understand the concern. I would say that when you teach a work of literature in English class, and throughout time this has been true, it does not mean that the ideas as expressed in that work are endorsed. This is a situation where we would be analyzing text for different reasons, not giving our approval to everything that was contained within the text. Can we find other works that would serve the same purpose? We're always on the search for that. This represents one of those. Certainly it is your decision as a board whether we'll move forward with this one or not, but rest assured that the search will continue for works that will represent ethnic writers and will provide our students with quality literature.
Okay. Were there any others, Ms. Herbert?
Yes, I want to, we get called out a lot about doing political statements, and I just was concerned about revenge of the electric car, and the first thing it says, content is loaded with political statements and criticisms of businesses, and I just don't know if that if it's loaded with political statements, it does not belong in that class, in English 9.
Right, and that comment jumped out to me as well, Ms. Herbert. I know that, Dr. Lockard, we've been talking about, providing additional training, trying to keep politics out of the classroom.
Right.
And, there's been professional development and additional training and things going out. So I hesitate to include one that, I'm not saying that I would necessarily disapprove it for all time, but I feel like this is one that maybe we need.
Well, it jumped out when it said it's loaded with political statements, and we're.
Well, can I address that for just a moment?
Sure.
So that particular DVD is actually a sequel. That documentary is a sequel to the original, which is already in the curriculum in our media literacy unit, where we look at these as persuasion. So the students aren't looking at the argument of the documentary or any documentary, but looking at the techniques used for persuasion, the cinematic techniques, because this is film as opposed to written argument. This second one is actually, I would argue, not political. The first one, Who Killed the Electric Car, does blame government, oil companies, and others for killing the electric car when the idea was first generated. This is actually a follow-up that really is more of a documentary series that follows the 4 different entrepreneurs who brought electric cars to the mainstream market. And as we know, they're quite popular these days. I think there's some confusion here about the two documentaries, to be honest. This second one is not particularly political and actually follows up and sets the record straight. What we would do is use pieces of these two together to show that development of argument from the first to the second. And again, I think it's difficult to find literature anywhere that doesn't have politics in some way, that isn't a political statement of some kind of the author. We're not looking at, do we agree or disagree with any political, and certainly not partisan, but any political statement. What we're looking at is, how does the writer achieve his or her argument? Are they successful? What parts make it successful? What parts don't make it successful? So it's really a study in argumentation, not a study in, we don't really look at the efficacy of electric cars in the English classroom. That's not our content area, nor would we be equipped to have a conversation about the efficacy of an electric car. We're really looking at the persuasive techniques used in the documentary. I think the second documentary actually helps to balance the first documentary in the two.
Yeah, so just from a student perspective, I actually did do that unit with this documentary in English 9, and we, of course, analyzed it, and it was, Who Killed the Electric Car was filled with many political statements and all, but it was mostly done for the statement, for the purposes of studying it. And I mean, in 9th grade, the social studies unit is U.S. government and politics, which is filled with many political statements and speeches and analyzing that. So I don't really see a problem with it.
I would also remind everyone that you're reading the interpretation of one member. of the Curriculum Council. And those interpretations, as Ms. Dolan said, there may be some confusion there, but those interpretations are also the reflections of one person. And the vote of the council was 25-1 on both of these items.
But I will say, though, when it reads, content is loaded with political statements, that, that was the first thing up there, and I thought, wow.
But if you look online, it's more about the people, I think. I don't think it is a political, but like you say, that was that person's opinion,
Yes,
obviously.
right.
But
I agree.
yeah, I'm
I
not sure
understand
I
that.
agreed with it.
But it
Well, I
just
do
really jumped
appreciate-
out.
Right, I mean, I appreciate the dissenting comments, though, right? Because
Right.
it's
Oh, yeah.
basically saying that, it was read. Like, I don't necessarily want folks who are, potentially going to rubber stamp, right? Like, because this is what was recommended by the curriculum supervisors. I want them to review it and provide constructive feedback, and I feel that this is constructive feedback, and I don't want to ignore it, so.
Right. So I brought it up.
Well, I would never be in favor of ignoring any dissenting comments, and I certainly wasn't trying to imply that. What I'm saying is that, you have to balance what went unsaid with what was said by the one person who responded. And that's basically what I'm asserting there.
And we do follow up and have conversations with folks who provide feedback. It's not that it's listed and then that's it. I know that Ms. Dolan did contact this person and had a discussion with them.
Mr. Kyler, did you say you viewed it?
No, I looked at it online, and then if you read the supervisor's comment, it's about 4 entrepreneurs, and what they do is, to me, is the story, and it's really, I think one of you said it, the first book's much more political than this one.
Correct.
And again, we just can't lose sight of how the DVD is used. Again, I think that main objective that the supervisor shared, really hits
Yes.
the nail on the head with how that piece of, how this DVD is actually used. So looking at the persuasive elements and techniques that are included.
I guess I would just like, I know that we have the curriculum council that, the Board of Ed can't review everything, right? And opine on that, so we discharge that responsibility for the curriculum to the council, and they make recommendations. I guess I have trouble voting on those two items that we talked about tonight without having a chance to look at them specifically myself, or maybe having some additional discussion around them just to try to understand the issues. Board members, were there any other items that we wanted to discuss or bring up?
Well, and I do apologize because I had not reviewed these documents. And I think one question I have, again, is the number of committee members, because as Ms. McCausland had said at one point, we were all set to review all of these materials when we were hit with the pandemic and couldn't meet. But Angie, what's the basically the total number of members that we have on the committee? Because I'm thinking that a number of people didn't have a chance to really review the information.
We have well over 60 members.
Yeah.
If they're all in attendance, we have parents from all the schools, and we have student representatives as well as administrators, some teachers, directors. Now, not everybody will vote if they're not there on a particular day. So.
Okay. I guess hearing that, like, I'm going to make a motion that I would like to separate out those two texts that we talked about, the Revenge of the Electric Car and Born a Crime, just for a separate vote and maybe additional discussion. Do I have a second?
I'll second.
Seconded by Ms. Battaglia. Okay. Board members, any additional discussion? We can take a vote on all the other items outside of those two.
Can I just ask a clarifying question?
Yes.
So is it just an issue of we had one or more dissenting votes? So I'm thinking for future, because this comes every year to the board. I'm just trying to think about future curriculum committee. So is it that if it's not unanimous with the curriculum council, that it doesn't pass until the board reviews it?
I just really, Dr. Lockhart, when I read those last two sentences, which I will not read tonight, I think that's totally inappropriate. And Trevor Noah is a great comedian, and I watch him. But I just don't think what they are putting there is appropriate.
I understand what you're saying. I'm just trying to get some clarification.
But it wasn't because of that. We didn't say anything about that other book that had one dissenting vote. I just thought that was
Okay,
too much.
I'm just trying to get some clarification for staff.
Sure.
So I know how to.
Well, and again, I think you raise a good issue, because are we going to accept the work of the committee or not? I mean, we don't want them to sense that we're not appreciating their review of these materials.
We didn't have a problem with Me and My Amazing Body and No Ordinary Apple, but I'm not comfortable with that one book at all.
Right, and I appreciate you trying to get the guidance, Dr. Lockhart.
Yeah.
I don't think it necessarily has to do with that it doesn't have to be unanimous. I think it's the nature of the comments that were made on those particular books that I would like the ability to, me personally, I would like the ability to look at those a little bit more closely before approving them. Not saying that I don't want them to be impacting the rest, because I think that it sounds like we're all in alignment on all the other items that are on the list. But we can just take a vote separately. I don't even know if it will pass, but that we would want to look more closely at those other two items before approving them. But again, it's not that it wasn't unanimous. It was just the nature of the comments that had been made.
Right. When you have this comment, the book has many funny and insightful parts, but it is full of bad language. I started marking the pages with the F word and finally gave up because there were so many. So he tells you of use of pornography. I just don't think that's appropriate.
No,
and whether they don't use that part, it's still sitting there on the educator's desk, and anybody can pick it up. And I
mean, don't students get disciplined for using foul language in school? So, I mean, I think it's like you said, I mean, that's in a way of saying we're endorsing this. So in essence, we would be approving that foul language is okay. And I don't agree with that. It's not.
Right.
Well, again, I understand the objections that you've raised, and certainly we could work out a process where if you wanted to look at them more closely, we could. But I do want to go back to the point about endorsing. Again, in the text that we used in class, we are not tacitly endorsing or directly endorsing all of the things that are covered within those texts. If we followed that rule of thumb, the literature that could actually be covered at any grade level would be quite small. So I don't want to leave anyone with the impression that because this was brought forth by educators who are very strong educators, that anybody was endorsing the use of profanity or the other things that are objected to here, because that certainly is not the case. It's not something we promote with students as something we would give approval to. And I know that the people that were personally involved in reviewing this and selecting it certainly had no intention, and that would be expressed clearly to students, and it is on a regular basis, of endorsing any of these things that you have objections to.
I mean, I know we've had books that are, written by some incredible people, but I'm sorry, I don't think every other word was the F word. Or, go into great detail of pornography now. There's a big difference. I don't know.
Okay, so if we don't have any other comments, so we had the motion that we were carving out these two books for a separate vote. Not necessarily that we're disapproving them, but that we would like to look at them a little further. Okay, so I will call for the vote on carving these two books out and looking at them a little bit closer. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Any opposed? Okay, that passes unanimously. Now I will call for the vote on the approval of all the other items that are on the curriculum list outside of those two. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Any opposed? Passes unanimously. Okay, thank you very much, everyone.
And you guys want to look at both. I don't think the DVD's that bad.
Right.
I just, Kenny, that just jumped out, and I know we
Yeah,
get nailed.
that's up to you guys.
And
That's-
we get nailed for that all the time, and I understand.
understand.
So I got to get it. Got to check it out. Yep.
Okay.
And I don't have a problem, looking at it at all. That's our job. So.
One last thing, I think it'll be important for like the DVD, for example, to view in the context of what the lesson or the instruction would be, not to necessarily take a political stance on this.
Right.
But as Ms. Doolin was suggesting, it's and Ms. Mystery, analyzing, the work for whether it's argumentative or, point of view or whatever the English objective might have been, so. Because I think without that, you could form a perception of, oh, this is trying to point me in one direction or another,
Right.
as opposed to,
And I
sort of
appreciate.
analyzing the author or the production's ability to argument, or to create an argument or persuade or whatever it might be.
And I appreciate everybody going, and that's on that committee, I really do, but that one book just really stuck out bad for me.
But when we say we're going to look at it, how are we going to look at it?
I'm going to go get it and read it.
Okay.
That's what I'm going to do.
I think, Ms. McCausland, you probably have copies of that.
Yes.
Both
Okay.
of those. We can get those
Oh,
to
'cause
Ms.
I'll even buy
Lucido,
it.
and she can get them to board members.
Right, Ms. McCausland, can you point us in the right direction for those?
Go ahead, Angie.
We have copies on the curriculum and instruction floor.
Yep.
All right.
Thanks. And so we probably want to time bound that. I mean, we don't want to
Absolutely.
sit on it for a long period of time. Do we want to bring those back for next month?
Yep. I think that'll be good.
Okay.
Yes.
Yeah, and again, I don't care, next month or in 2 weeks.
Okay.
I'll give you time to review it, and
Yes.
we'll see where we are, but definitely by next month
Yeah,
at the
yeah,
regular
right.
board meeting.
Let's do that. Thank you, Dr. Hocker.
Yep.
Okay, board members, now we need a motion for the approval of the Carroll County School Negotiators.
So move.
Moved by Ms. Battaglia,
Anybody want to second
I'll
that?
Second. Sorry.
Seconded by Dr. Dorsey. All right. Thank you, Dr. Lockard.
Okay. Let me find my notes here. Right. Each year in September, we bring the approval, for your approval, the list of employees who we wish to designate as serving in a role in the collective bargaining process on behalf of the board. These employees may be called on to serve on a negotiations team with your chief negotiator or to support the board's bargaining parameters in other ways, such as preparing positions with or providing reports or background information to our chief negotiators and teams. And so those list of folks are included in the agenda packet for your approval. I believe Ms. Baptist is on standby in case you have any questions.
Yes, I'm here. Yes, I am.
So, Ms. Baptist, I just have to make my standard comment every year. I look at the list and say, wow, that's a big list, but it's just, it's anybody who we might need to be involved in the discussions about the negotiations, but very few of these people will be involved at any one particular time.
Correct. We only call in someone in regards to if a negotiated item, a particular proposal is presented, we call them in as a subject matter expert to get their expertise, but they're not involved. Basically, I will tell you, 95% of the group is not involved in the entire negotiation process. Again, it's just as needed on a subject matter expertise purview.
Board members, any questions or comments? No? Then I'll call for the vote. All is in favor. Can I get a verbal aye, please?
Aye.
Aye. Any opposed? Passes unanimously. Thank you.
Oh, I do have a question. Okay, so this is for the 2020-21 year, right?
Correct.
Yes.
Beginning July 1, 2021?
So we are, we have AFSCME, we are in a 3-year agreement, which expires in 2022, but we have language openers, and that's our negotiated agreement expires in 2021. CCA, it also expires 2021. CASE expires, we're in a multiple year agreement, which expires in 2022, but we have 3 language openers. And our food service workers, we're completing a 2nd year of their agreement, which expires in 2021. So this will all become effective for July 1 of 2021 going forward. Language openers or full contracts.
Great. Thank you very much. Okay, so board members, now I need a motion for the approval of the ratification of Carroll Association of School Employees case, modifications of Article 4, Section F of the Master Agreement Memoranda of Understanding.
So moved.
Moved by Dr. Dorsey,
Second.
seconded by Ms. Battaglia. Dr. Lockard.
All right, board members, this is an example of the type of collaboration that does often exist between us and our associations. And I think we referenced last time that we'd be bringing this MOU for ratification to you. We recognize during the school year, particularly during the enhanced virtual model, we will have a need for substitute teachers. In discussing the situation with CASE, we were able to quickly agree to this memorandum of understanding, which temporarily modifies the existing master agreement so that CASE represented employees, especially instructional assistants, will be able to help us fill those needs in terms of substitutes as they arise. I want to thank Ms. Deal, who continues to offer to work with us, as well as the UNISERV directors, Mr. McKillop and Mr. Gates, for working with us on this.
Board members, any questions or comments?
Paragraph 5 terminates on the first day that CCPS returns to full traditional school. So I'm not sure in today's world what that is, but if you would get close to that point and decide that you do need this more, it could always be renewed.
Sure.
Prior, right?
Yes.
Yes, it could always be extended.
Yep.
We will bring any extension, of course, to the board for your authorization.
And Ms. Baptist, do we anticipate this having any fiscal impact? There's not a number here, but are we?
No, so actually, just doing a high-level estimation with Mr. Hartlove, it may be a potential savings because of even though we're giving the instructional assistants $7.50 or $8 an hour, we're not paying the full substitute rate.
Okay. Gotcha. And this is actually, this is pretty exciting. I mean, this is just a great cooperative effort, and we're excited to have the case folks interested in doing this.
Help out.
So, I mean, they we heard Ms. Deal here, a couple of months ago, like saying, case is really wanting to step up and do whatever they can to help out, and I think this is really a demonstration of that. So I'm excited about that, and I want to thank them for working with us in this regard.
We're excited as well. It helps us with consistency of education delivery in the virtual environment. So we are very happy for the partnership with our case bargaining unit.
Right. All right, board members, any other questions or comments? All right, then I'll call for the vote. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Any opposed? Passes unanimously. Thank you. Okay, and that ends the action items. Now we have 5 more items up under the discussion session. Ms. Battaglia, did you have a hard stop tonight? Okay, so we'll just try to get through these at a good clip. Okay, so the first item up is the proposed high school program of studies for 2021-2022. Dr. Lockard?
All right, board members, attached to the agenda packet are approved course offerings available in Carroll County High Schools, and it, includes any notable changes, additions, discontinued courses. Ms. McCausland is available for questions and comments.
Well, I would like to note on page 113 under health, we had already talked about the opting in and opting out. So again, we'll have to look at that wording.
Okay, thank you, Dr. Dorsey.
Sure.
Great catch, Dr. Dorsey. Okay. And we do have the virtual learning program, which is on page 19. Do we know what type of courses would be typical under that type of program? Are they world languages? Are they government classes typically?
They do vary, but I'll let Mr. Bricka speak to that.
Good evening, board members. The curriculum supervisors reviewed a number of courses over last fall. There are a number of world language courses on it. There are several English courses, a handful of math, a limited number of science courses. There was a concern about wet labs and the risk associated with students performing wet labs virtually. But there are a number of courses that align with our program of studies that have been included.
So in prior years, school offered virtual classes for students who couldn't take the class because it wasn't offered in their school at times. So who will be eligible for this, or can anyone simply go to their counselor and say, I want to do a virtual class?
The focus initially, we don't have a huge budget focused on our virtual classes. So the focus really is on equity. So students who the classes aren't offered necessarily in their home school, or if maybe they're in a career and tech program, and some of the smaller schools have a number of singletons. The class is only offered once, and maybe they're locked out of being able to take that class because they're going to a career and tech program. So those are the students that we were focusing on in our initial year.
So So will this be part of their school day or in addition to it, or can it be both?
It is scheduled as a part of their school day. It is one of their standard classes. At this point, we're not looking at students taking more than the 8 credits available to them during the regular day.
Thank you.
And that's helpful to understand, because I know we've heard some comments about how American Sign Language was taken out of some of the schools because we just didn't have the support, and French, like the French teacher retired at one of the high schools, and so French isn't offered there anymore. Those seem like the kind of things that would be really good opportunities to say, okay, well, we're still going to be able to offer it across the county in a virtual format.
I don't believe American Sign wasn't one of the courses that met the curriculum match at this point, although there were French, German, and Latin courses that are available.
Okay. Is there a reason why American Sign Language wouldn't be included?
There was a concern. So currently, we look to see, because you have a right to approve, legally to approve all curriculum, we looked at vendors' courses that matched our curriculum, and in the curricular review with the supervisors, they didn't feel that the American Sign course matched our American Sign course to the degree that it would allow them to say it is the same course offered to other students in the county.
Well, maybe up for discussion again next year. Okay. All right, so Dr. Lockard, the process for this is that this comes back when for approval?
Yeah, hang on a second.
November, is that it?
Is that October or November, Angie?
It should be October.
Okay.
October? Okay.
Yep.
And does this go out for public comment, or this is just for review purposes and we approve it next month?
Correct, that's correct.
Okay. Okay. Board members, any other questions? No? Okay. Then we can move on to 9B, the proposed curriculum guides for 2020-2021.
Right, so Ms. McCausland, along those same lines, significant changes made to related curricula and curriculum guides that were piloted during the 1920 school year, and those are listed here. Anything you want to highlight for the board?
No, so these were pilots last year,
Right.
and feedback from teachers. We made changes to the actual pilot curriculum, and are pretty excited about moving forward with these items.
Actually, a quick question on the program of studies. So it says that there were changes to AP Computer Science principles. So will it no longer satisfy the technology graduation requirement?
Mr. Eccles or Mr. McNett, would you like to answer that question, please?
I'm sorry, Devanshi, I didn't quite hear that. Could you repeat your question?
So in the program of studies for AP Computer Science principles, it's the prerequisites and other notes are crossed out. So will it no longer fulfill the graduation requirements for that class?
That is correct. With the Maryland State Department of Education, we can have a course count for a technology education graduation requirement, or it can count for a career and technology education completer. So as it's being put in as part of a new computer science pathway at every high school, that will no longer count for the tech ed graduation requirement. So we'll have the 2 courses, exploring computer science and foundations of technology, for that credit.
Thank you.
And Devanshi, what page were you looking at?
I believe this is 139.
139, okay. Thanks for that. Okay. Gotcha. All right, so Ms. McCausland, so back to the curriculum guides piece. Board members, were there any other questions that we wanted to ask on that item? And again, this will come back next month for approval?
Mhm.
Okay.
Yes, ma'am.
Okay. Then we can move on to 9C, the proposed 2021-2022 school calendar. Dr. Lockard.
Okay, board members. Last year, if you remember, we had several months of a stakeholder committee working on options for the school calendar. We vetted pretty significantly over the course of last fall. The board made decisions about this current year's calendar. I am proposing a 21-22 school calendar that for the most part mirrors the one that was approved last year and this current school year. One of the significant reasons is that it maximizes full weeks of school to support consistency of instruction, which I think by the time we get to the 21-22 school year, we're all going to need. And so I'm not bringing lots of different options for you. This calendar is proposed to begin after Labor Day, which was the board's expressed desire for our calendar. It includes 4 emergency closing days for weather. However, I am still actively looking at virtual learning as a replacement for makeup days. So we could easily take those 4 inclement weather days out if we ended up using them and can use virtual learning. So we have some time still before the 21-22 school year. And you can see the rest of the dates there and when we would end our school year, even if we had to use inclement weather days. And so as is typical, we're already starting to get some feedback on the calendar. As is typical, this stays out for 2 months. It comes back in November for the board to adopt in whatever way, at the pleasure of the board. So.
Right.
I had some thoughts, concerns, I guess would be the right word, about the 2 Jewish holidays in September. And so I actually talked, and I know we're going to get criticism both ways, but I talked to a couple people that are pretty devout and even a couple people that criticized last year a little bit. And in all cases, the answer I got was, you made a good decision last year based on the percentage of population, be consistent and keep doing it like you're doing. And then one guy even said, well, you yelled at me last year. He goes, I know, but he said, I think you should be consistent and you're getting consistent weeks of school. He gave the positives out of it. So that made me feel a lot better on that part of the decision.
Right, because they got the excuse out.
Yes, they get he said, be consistent with what you did last year.
Right.
People, they get unexcused absences and stay consistent with what you
They
did.
get excused out, yeah, right.
Well, I think one reason we were probably going with the Rosh Hashanah for this year, I mean, it's on a Saturday. It begins at sunset on Friday the 18th, but the actual holiday is Saturday the 19th. So we knew that Rosh Hashanah was taken care of as far as being on a weekday. I will take a stand and say that I would like to see us acknowledge at least Rosh Hashanah and maybe even Yom Kippur if we could. And I know we usually say, well, there's only this small amount of people who may be affected by this. But, we have to be sensitive, I believe, to all of our populations. And, I think this would be one way to show respect. And again, I know that, with the calendar, I can hear what you're saying, Dr. Lockard, because again, the way that you do have it outlined, I mean, there are a lot of consecutive weeks and days in each month for instruction. We also end quite early, especially if we don't use snow days and can use the virtual learning instead. So, I mean, I would even look at tacking on to the end of the year to get a couple of days in to respect that portion of our community who celebrates these days.
Sure. I appreciate that feedback, Dr. Dorsey, and I recognize, and also hearing some feedback from constituents, that next year Rosh Hashanah falls on the first day of school, which I recognize as a challenge as it relates to, sure, you know, we can make whatever accommodations are necessary to support students and religious observances, but I recognize the challenge that comes with the first day of school as well.
Yeah, and I think that we beat this up pretty hard last year. Got a lot of community feedback. You know, provided some direction that we were all pretty comfortable with. I think that one nuance, you know, it probably makes sense to think about and potentially address, like the fact that Rosh Hashanah is on the first day of school. That creates different issues. So maybe we could always maybe have the caveat where if it is the first day of school, that comes into play in terms of designing the calendar. I might want to think about that, or because this has to go out for. We're not voting on this tonight. This is going out for public feedback. So if we could get some feedback in that.
But in turn, Baltimore County, that has a much larger population, they do them as in-service days. The teachers still work, and it's like I say, I got some feedback on it from people that are really respect with it, and I was almost a little surprised, and I said it's the first day of school, and they said that's fine, be consistent. Now again, like you say, we got a little while to all talk about it.
If I can just real quick say, you know, I know, yeah, we started seeing emails that, you know, we close for the Christian holidays. Technically, no, we do not. We follow what Comar states. So we technically do not sit there and say we're closing for Christmas. We are closing for Easter. Those days are out of our control. Like those we have to do by state law. I'm sorry. All religions, there's over 1,000, and I think I said this last year, there's thousands of religions in this world. And if we start closing school for every religion, we will never be in school. We will be in the situation we're in now, where we're virtual. And I know I'm gonna get some backlash for saying that, and I'm sorry, but at some point we're following what the state rule is, what Comar rule is. You know, we don't close for any other specific religious holiday. You know, we have Muslims, we have Wiccans, they're around us. We don't close for their holidays. And I mean, I know we used to, but you know, I mean, when Labor Day falls late and there's other things in the way of everything, just need to stick with what the state mandates are.
So I don't know the statistics. What percentage of the Carroll County population and CCPS population is Jewish?
Did we get an idea of that from the survey last year?
I don't remember
It's the
the percentage.
The percentage of the
Jewish population.
public school system, staff and employees,
Right.
the staff and
That's
students,
why we couldn't do
what
it.
percentage are
I
Jewish?
can't remember.
Devanshi, I believe it's very small. I don't have a exact percentage. And if anybody on the staff has that information, please share. I don't know that we, you know.
I don't.
I think it's well under 4. I think it's 2 or 3, maybe in the county.
Percent?
I know that one of the outcomes of last year's conversations where we were going to monitor attendance and see what kind of impact, and that's really what would what would help us, as we look at what's the impact on the instructional programming in terms of rates of absences. We have to factor in our teachers as well. That's why I was thinking about, that first day of school and a little bit of conversation around that.
I understand that.
And having to, that becomes challenging and difficult for folks, and I respect that.
And Dr. Locker, do we think that we would have, we've been talking about the inclement weather days being potentially one of the silver linings of getting good at virtual, right? That we wouldn't necessarily ever have to take an inclement weather day again, and that would ease up a lot of constraints on the calendar. Do we have any idea when and how we would get that guidance?
I'm actively asking, and as soon as I have an answer, I will share with you. My hope is, by the turn of the calendar year, I'll have some idea of whether that's going to be A, permissible, and B, what do we have to produce, present, demonstrate that to MSDE that they will say yes and count that as a school day.
Right.
So as soon as I have an answer, you'll have an answer.
Okay.
That's a good thing.
So this will go out for public feedback shortly, and then it will come back to us in November
That's correct.
for vote. Okay. Board members, are we comfortable with?
Yep, we'll go
that?
out for public feedback.
Well, criticism that's been said before of opening after Labor Day is for high schools that do half semester AP classes. It gives a lot less time for the students in the second semester who start AP classes to actually prep for the exams in May.
Yeah, that's a point, Devanchi, that we also wrestled with last year as well.
Right, and I think actually the student rep that we had last year had definitely talked about that. I think that actually had gone into part of our decision with the Jewish holidays, right? It was because that it pushed even further, so that kind of, it gave more full weeks and allowed the students taking the AP classes in the spring to get a couple more days in, right?
Mm-hmm. Yep.
Okay, so we'll get the public feedback and go from there.
Okay.
All right, item 9D, the proposed comprehensive maintenance plan for educational facilities.
Okay. Board members, the public school construction program in Maryland requires that each local school system submit a comprehensive maintenance plan. We call it the CMP, which describes a strategy for maintaining public school facilities. We bring the CMP for your approval as required, typically at this September meeting. The approved CMP is then submitted to the public school construction program of Maryland for review. In part, what the plan does is it aligns certain items in the operating budget you approved back in May and shows how we are investing in our maintenance program. And Mr. O'Neill, who do we have there who can answer questions? Is that Mr.
Either Brett or I could, or if you have budgetary questions, Mr. Hartlove, I'm sure could answer.
Yeah. Mr. Prokop, but
I did have a couple of budget questions. I think I can probably follow up with Mr. Hartlove offline. I guess the one big one that I wanted to check on was just on page 7-4, which is the budget for category 7, maintenance of plant. There's a $683,000 negative item here. That's the interfund transfers. I just wanted to make sure that I understood that that's money that we moved at the end, like, so when we reconcile within the budget centers every year, that's what that item represents?
I think that is you're referring back to last year's budget, I believe.
Yes.
Yes. If I don't have it in front of me, but I believe that is, there's a counterbalance to that in category 8. And that goes back to when we put the budget in place back a year ago. And actually there was, I think what happened was the budget was the categorical totals that were approved, if I remember correctly, were different than what we had in. Well, bottom line, it was a correction of an error.
Okay.
So if you look at and you're only seeing one part of the budget there. If you had the category 8 budget, you'd see a counterbalance to that of another $683,000. So
okay.
it goes back to last year's budget. It's not necessarily relevant at this point.
Okay. Well, that's what I was just trying to understand, because I looked at the bottom line totals and it was a 12% increase from last year's budget to this year's budget, and I was trying to understand why, and it was because of that correction. So, okay, so there's an offsetting item in section 8 that, okay. Understood.
Right.
I just wanted to make sure I wasn't missing something there. Okay.
Yes, it's actually a good pickup, but you're only seeing half of the picture there, so it can be deceiving.
Okay. All right. Thanks, Mr. Hartlow. I guess there was one other on page 8-7, and it looks like we increased the number of employees by about 20 under operation of plant.
Okay. What columns are you looking at? You're looking at
I'm sorry. I was looking at the so under the full-time equivalent. So I looked at last year's report, and so the total professional positions was 6 last year. Now it's 7, and the total classified positions is right now 275.1, and last year it was 256.1. So it looked like we increased by a total of 20 employees.
I know what that is also. When we reclassified the hall monitors to security folks, you know how we've taken folks who do that, have the assignment of being security assistants. That really is security is in the operations category. So we moved those folks from one category to another category. They used to be instructional assistants, so they were in the instructional category. And because we really now have made these folks the concentration of their work is now security, we had to move those to category 06. So it was just a movement. It's another example of just seeing one part of the budget. You're not seeing the entire budget.
Gotcha.
There'd be a corresponding reduction in that other category.
Okay, so net headcount didn't change. It's just a reclassification into a bucket where we're only seeing one of the buckets. Okay.
Right. Plus the coordinators there, the coordinator of school security and
correct. That's the other change.
Emergency management.
Right.
Mm-hmm.
I apologize for my 1109 answer.
I thought that was actually pretty darn good for 1109.
It's a very scattered answer. I'm sorry.
Wasn't scattered at all. All right. Board members, any other questions on the CMP?
No, just that we should update the rectory at the very end.
Yes.
I know we've had some staff changes since this one was printed.
Okay, is that pages 11, 2, and 3?
Yeah.
1, 2, and 3?
Yep.
Okay.
Yep.
Yes, starting on 11-1.
Yes, I can take care of that.
Well, this will come back for
Yes.
Right.
correct. We'll make those edits, Dr. Dorsey. Thank you for that, before it comes back to you for action at the next meeting.
Okay. Great. Thanks, folks. All right, the last one, proposed capital budget FY22 and capital improvement program FY23 to 27.
Okay, board members, as you know, each year in September, we start the annual CIP process by bringing you a recommendation for the next year's CIP budget request and the 5-year CIP. After presenting to you for discussion, the CIP is then submitted for public comment, including a public hearing, which we will get scheduled and on the books here, and then bring back for your approval in October. Based on the state's timeline, the CIP is then submitted to both the state and the county for funding consideration. And like I said, we're getting a date for the hearing that we'll announce soon, that we typically do each year, and we're envisioning conducting that in the same fashion we did, if you remember back in June when we did the EFMP hearing. We can do that in the same way. And I think the cover sheet, lists the major changes in this year's CIP as presented. We also included a page to highlight the impact on the facility condition index for the board. And happy to answer any questions or respond to any comments. Again, this is for discussion, and we'll return in October.
So, board members, questions or comments? I think the major changes make sense, as they're outlined here. I did want to ask a quick question. I don't know if Mr. Kane is still on the phone. He's probably been here all night.
There he is.
Hey, Mr. Kane, how are you?
I'm good. I'm a night owl, so I'm fine.
Okay, that's the benefits of being the very last item on an agenda, right? Well, thanks for the CIP request exhibit that you provided. So I think this really shows how it relates to the strategic plan. And so in FY20 we were at 33, and it looks like with the career and tech and East Middle projects, this is going to go up, but then it's going to deteriorate a little bit. Can you help me understand why it goes from 32 up to 39 out in, looks like FY28?
Yeah, so you can see the trend goes down because of those two large projects and the amount of investment in the CIP. But towards the end of the 6-year CIP, there's not any major projects being done. It's just a few roofs and HVAC projects. So the planned system, the amount of, planned amount of replacement or capital that we need to invest in the buildings, the later years of the CIP isn't meeting that. So the FCI starts to creep back up again. Really, the only way to keep it steady is to do enough projects or enough, have enough capital money invested in your facilities to kind of keep pace with those systems as they age and replace them. So what the chart tells you is towards the end of the CIP, we're starting to creep up again because there's no major projects. After we finish with East Middle, there's no more major projects planned in the 6 years. So.
So this is in alignment with the strategic plan from the perspective that we said we didn't want the FCI score to deteriorate, and actually deteriorate in this would actually mean higher.
Did that answer your question?
Oh, can you hear me, Mr. Kane? So this is consistent with the strategic plan over the 5-year period, right? Because we said that we didn't want the FCI score to deteriorate over that period, and it isn't. It actually improved from 33 to 32, because a reduction in the FCI score is actually a good guy.
It's a good thing.
Right, and so, but then it looks like, but we'll need to readdress that in the out years as we go, because again, we're gonna need to start thinking about, okay, well, What was that steady state number, Mr. Kane? Something in the $45 million range per year?
Yeah, I think last year the number I gave you was in the 45. It might be slightly higher now with the inflation. I haven't run that number yet, but it's in that ballpark, 45 to 50 million per year, just to keep pace for the amount of buildings and how old our buildings are, to keep pace and keep us kind of steady where we are at that 35, 33% range. So.
Right. Okay. So as we're planning so we're meeting our objectives right now with this planning over the 5-year period, but next year, as part of the CIP, we'd be looking at not meeting that objective in the out years. And so we would need to start thinking about maybe accelerating what are the next right projects to accelerate, I guess, at that point in time. Does that make sense?
Yes, I mean that's what the information would tell you, is that you would need to start looking at, if you want to keep the FCI kind of stable, adding in additional projects that you would request funding from the state and the county. So that would be part of that public dialogue.
Right.
President Svigny, the real distinction probably is that once you get through Career and Tech and East Middle, which are full modernizations or replacements, after that it's mainly systems. So Bill referred to roofs or HVACs. To drive that FCI back down, it would take additional modernization. So it would be projects in your CIP priority. And help me out here, Bill, but it would be Westminster High, William Winchester. Are those the two?
William Winchester is the next modernization. There's actually a feasibility study in the 6-year request, but it's not, the actual construction and full replacement or modernization isn't included in the 6 years.
So the system renovations, the new roofs, the new HVACs, the windows, the building envelopes, those certainly are great for the buildings and for the folks in them. And we try to make some improvements here or there when we can as we go. But those system renovations don't drive down the FCI in a way that the full modernizations do. So that's really what is sort of being displayed here on this chart. We will present on this again in fairly significant detail. In December, I believe, is the Pillar 4 designated reporting month, and so this is a you referred to the excuse me, I can't speak at 11:17. The strategic plan, the relationship to the strategic plan. This is in Pillar 4, and so this is something we can spend time on again in October, and then especially in December, reporting out on that. I don't know, Bill. I don't want to put you on the spot. I don't know if you could project what the FCI would look like if those modernizations theoretically move forward or not, because that would be the real driver.
Yeah, so I mean the only one currently in the 6-year or actually the 10-year facility master plan, the only one right now is William Winchester, because it replaced Westminster High this year. It took its place. So I could certainly do an analysis or give you a general idea of what the impact of that one modernization would be, but it would hold it steady for a little bit. But then again, really to keep it steady, you almost have to have close to a modernization every couple of years just to keep your FCI stable, and that's kind of the that's what the information would tell you. But we can certainly provide more detail on that at future meetings.
Right. And I think that was the intent of trying to develop the FCI score in general, right? Was kind of the understanding that, okay, well, when you modernize a school, it's good for about 40 years. And so we have 40 buildings. That means we basically have to do one a year. I mean, this was kind of monetizing and demonstrating that there needs to be a commitment and a rhythm and a pattern to the investment in the buildings. And so I think it's just playing out through these numbers, and I think it just helps us set the expectations, though, with the county and the understanding of the the funding levels. So I think this is really good, and I think that we're good for this CIP period, considering that we're hitting the strategic plan objective, right? But we need to start, like, very quickly, it'll become the point where, okay, but now we're not going to be meeting that objective come FY '26, and we need to start talking about what that means. But as part of this CIP cycle, I think it's looking like we're hitting our objectives. Okay. So, Dr. Lockard, this will also go out for public comment, and we'll have it back here again next month?
Yeah, public hearing.
A public hearing, right, sorry.
Yep.
Okay. All right, board members, anything else on the CIP? Apparently, I can't think of the right words at 11:20 as well. All right. I guess we can move on to section 10, which is unfinished business, new business. Board members, do you have anything that you'd like to bring up before I roll into the meetings that are planned? No? All right, not hearing anything. Then our next meeting is at 5 p.m. on Wednesday, September 23rd, 2020. It's a board update meeting, as we've discussed several of the items tonight that will be on the agenda for that meeting. It will be with citizen participation here in the boardroom at 125 North Court Street. And then also at 5 p.m. on Wednesday, October 14th, 2020, it is our regularly scheduled board meeting with citizen participation, again, here in the boardroom at 125 North Court Street. And with that, I will ask for a motion to adjourn.
So move.
Moved by Ms. Herbert.
I'll second it.
Seconded by Dr. Dorsey. All those in favor, can I get a verbal aye, please?
Aye.
Aye. Thank you, folks. And again, thank you so much to everyone for a very successful beginning of a very unique year.
Yes, congratulations.
Congratulations, thank you, and take care, everyone. Good night.